2021, the vaccination doesn't impede the spread of the pandemic. So it's not people's fault, of course, and this was a terrible action because the healthcare, national healthcare, can't blame people and shame people because of their personal decisions. That was a violation that shouldn't happen anymore. And as a society, we need to choose and understand not to make the same mistakes. Many people were hit by those decisions that were very violent. And I'm very, very sorry about that. I really hope it won't happen again. Our former Minister of Health, Roberto Speranza, he said that he couldn't do otherwise because international organizations were following the healthcare, national and international healthcare. Do you think we could avoid that? Or the WHO indications, EMA, and other FDA that were imposing lockdown and others? I think that, especially in 2021, the way in which WHO exposed itself and other healthcare organizations had a very big strength because policies all over the world, thanks to the indications from the WHO, they could blame people for what was happening. They were saying the WHO said that, and so we just follow the rules. So many policies weren't based on scientific facts, impeding all types of scientific help, evidence, and it seemed immoral to criticize another point of view that was different from the WHO point of view or the government. When the WHO gave some guidelines, policy guidelines, they spread all over the world, even if it didn't seem like they could have this power. But they actually did have the power to influence the government's decisions. So they realized, they made a study in China, and we know that China had such a big lockdown in the past. And since this lockdown was successful, they decided to imitate it. And I think that the Italian situation, the problem, it was the consequence of this, because the WHO advised to adopt the same measures that were adopted in China because they were working and effective. And with this behavior, the impact was extremely bad in Italy. Can we say that in this way, WHO gave an excuse to politics? Honestly, I have the feeling that there is this role game again between the healthcare and the politics, because healthcare gives information without giving obligations, and they leave the responsibility to the politics, whilst the politics take wrong choices and they say that the healthcare is guilty, and so you know, it's a difficult situation. Thank you for the question. Absolutely, you are right. I think the problem is exactly that. Every part involved is blaming some other part. Politicians blame the WHO. The WHO said that we just gave guidelines, we don't want to blame anyone, and as a consequence, nobody is responsible, it looks like. And this is a fundamental problem. It has to change. Ideally, the types of decisions that are taken during the pandemic should be in politicians' hands, politicians that are there for that type of task. So politicians that can't, they must not blame other people. So vaccines, Green Pass, this is not right. Politicians don't have to be responsible for those decisions, but I also think that authorities didn't understand fully the danger of lockdowns. And all those authorities need to be judged for what they've done. Because at the moment, the people who are responsible got promotions, are receiving prizes, they are playing very important roles, and we need to invert and this tendency. We need to understand where the responsibility lays. And it's difficult because it's about figures that we consider as reliable. The problem still is that we're pretty far from managing to judge things clearly. Let's take United Kingdom as an example. In the United Kingdom, it's like they were pretending everything was good, differently from Italy, and that it was possible to eradicate the pandemic just thanks to the lockdown, but in reality, it wasn't true. So I think we are in a position where nobody wants to be responsible, and for this reason, the response that we had 3 years ago will be the same we'll have in the future. I want to ask you, since you've talking about vaccines, there are many people who were damaged by vaccine, but there are two problems. One, it's very difficult for those people to show the side effects. So and then they also want a compensation. Where you uh, w- w- did you know that? I mean, did you have an idea about the extent of the situation and the damaged people? Yeah, absolutely. This is a very controversial matter. It's difficult to understand the right number. So let's talk about the non-controversial part. There were people who were damaged, and some studied that reported some people were forced to get vaccinated, and they got a negative response at the heart level, which is terrible. There have been cases of ictus, a stroke in all the elderly people, and also in public health agencies. Some of them, they recognized, they understood that the side effects were given by the vaccines. And to me, the worst part is listening to people who didn't want to get vaccinated, and they decided to impose their point of view, and those people were treated as they were lying. Vaccines was an emergency condition, so we need an exchange in this situation because no vaccine get tested at the point of that we know all the side effects of it. Also, tests in 2020, the random tests, are very broad, but still, it's never sufficient, it's never enough. Because we had to be quick. We had to study how people would react to vaccines. And then it was discovered early on that young man had myocarditis problems, and they had an active role, and those people had to be compensated instead of treating them as liars. The public earth was irresponsible and immoral, and now people don't trust them. I think a big part of responsibility comes from the media and information media, and not only, also all platforms, digital platforms. You had also some censorship on the network, and more broadly, you also had met some difficulties during your job. Could you remind us the difficulties you had, and if this type of censorship, which could be explicit or hidden, wasn't there, do you think the pandemic would have a different outcome? Would have a different outcome, sorry. Yeah, it was very difficult to me, especially in 2020, 2021. As for medias, when I started to expose myself and my position, my family got menaced, threatened. I got accused to diffuse false information. Everyone wanted to destroy my reputation, I felt like. And this reflects the way in which everyone who was, let's say, against was censored by the media. And these brought many scientists to stay silent. For example, on Twitter, I was on a blacklist, literally, so that my ideas were limited and couldn't find and reach many users. I think social media weren't independent. I think they were influenced by governments for this censorship campaign. As in my case, or in the case of other people that were expert as other scientists in the scientist community, Anthony Fauci or Colin. Colin wrote an email for Fauci saying that my colleagues and I were epidemiologists, radical epidemiologists, extremists. And this declaration was followed by some articles that tried to ruin my reputation and my colleagues' reputation, bringing other scientists, as I was saying before, to just shut and not expose anymore. So they did all to silence the debate. And the government pressed media to have this consensus, and I think that those things can't happen in any free country. You, Professor, despite those tensions, you thrived. In Italy, scientific associations, medical orders were the first to adequate to governative indications, and many things said were pretty heavy against people who didn't get vaccinated. Many have participated to the spread of fear. So many were completely aware. So how the science managed to behave in this situation? It's very sad in this situation that many scientists, just like me, decided to damage the reputation of people who didn't agree with them. often you don't agree with other colleagues on a scientific data. Of course, we don't agree always, but this doesn't mean we have to ruin the reputation of people who don't think like us. And many scientists like me felt the social pressure. So they decided to just not expose. And very few decided to expose and stand up saying, I don't agree. As a scientist, I think I have such a good and big responsibility because I'm in a position of power as I'm a professor in Stanford. And if I don't use my power and if I don't talk on behalf of the good, the common good, what's my job? Many scientists saw what was happening to me and they decided to put themselves at the first place and help community. And from one side, I can understand difficult situation, you always try to protect your family, your beloved ones. But also, on the other hand, there are many scientists who actively participated to this situation, troubled situation. And the final effect, the outcome was a consensus of an illusion of vaccines, lockdowns. Many scientists, most of the scientists, didn't agree on lockdown policies, especially people from the infectious illness diseases. I spoke with many people, and so many didn't agree, and they were always talking about consensus, and it was a consensus created by tactic of power abuse strategies. A very important role, the fear of death played a very good role, but you showed us on your recent study that mortality between people that had less than 70 years was very low following the data you have published. Yeah, absolutely. The FAIR had a central role on people's behavior, absolutely, and the data that we had was that the mortality rate and the infection rate was very low among the younger people. So the younger you were, the fewer possibility to die you had. This rate was increasing with the age, of course, because the illness was very contagious in elderly people. The public authority decided to adopt a strategy based on fear, bringing people to respect people. How? Spreading terror. For example, in the United States, there was such a big campaign to spread the fear among young people so that they thought they were the cause of contagious. So it was a very psychological attack, I would say. And they were saying if you don't get vaccinated, you're going to spread the illness to your grandmother. So, of course, they just decided to respect all the measures, lockdowns, and the government used some tactic of psychological terror to spread fear and to make measures, to make respect measures that were. Last question: was it right to get people and pregnant women vaccinated, or do you think that they all decided to follow this path because there were some economical interest? As for the first question, I think that was a bad idea to to vaccinate children and pregnant women because the mortality rate and the risk of being of being hit by the illness was very low. At the beginning, we didn't know the side effects. And of course, vaccinating pregnant women wasn't the best idea, especially when we don't know the side effects. So we exposed, whilst on the other hand, the contagious rate was very low among the young people. So I think it was a mistake. I agree that the pharmaceutical companies had a strong power and they wanted to make money, of course, to have more benefits. But, for example, the American, the Italian government, they guaranteed contracts with those pharmaceutical companies, even though the doses of the vaccines, and they were paid billions of euros. So I think that the financial reason isn't enough to explain this behavior. We need to understand that many people in the healthcare, public healthcare, couldn't read the efficacy of the vaccine. They thought the vaccine was just a way to get rid of the illness, but they didn't understand. They were blind in front of this evidence. But they didn't understand that the vaccine couldn't stop the COVID from spreading. So even if we get vaccinated, the COVID would spread still. So I think it's a more complex matter. There is a set of reasons why we pushed people to get vaccinated, but it's not just about a financial reason. I think that one of the most important reasons is that we weren't able to read the scientific data. We had this irrational idea to, let's say, clean everyone with this vaccine instead of accepting the fact that we didn't have adequate machines. You speak about 150 million additional children that plunged into poverty due to COVID-19. Yeah, at the beginning of the pandemic, there were some organizations like United Nations that documented the damages of lockdown for the different world's economies. And they, of course, focused on the poorest countries. In the last decades, the world adopted some trade policies that could help people to leave poverty. And those economies reorganized for the West. And with the lockdown, suddenly we have launched millions and millions into poverty again. They had to face hunger. And this is shocking to me that those reports from WHO weren't considered at all by governments and that they didn't modify their point of views, their opinions about the lockdown. So we had to bring all the poor countries to rebuild their economies. And hitting them again is terrible because the people, the victims were the poorest and still are. I want to thank Jay Bhattacharya, doctor, professor, for this interview. And I know you will be participating to other meetings. You will keep on writing because I think you are one of the few in the world that contributed to the truth of science. And we're not talking about completist, about the pandemic management. Thank you, doctor.
Funziona questo? Si sente? Sì?
Good morning, everyone. I'm the guy from the video. I'm here in presence. First of all, I want to thank the organizers from Dr. Donzelli who let us hear from Jay Bhattacharya, professor. It's incredible that such a incredible man risks his career. Many colleagues of him lost their job because of their point of view. There has been a study from Pavia University that talked about the spread of Italian spreading medias. It was named during the pandemic in the most important newspaper. Do you know how many times? 0. Nobody in Italy had the information medias about this document of people that were, for example, in Stanford University. And this is the level of information we had in Italy and that we still have today. The fact that the independent scientific medical committee was able to organize these, and we don't have exponents. It's very humiliating to me as an Italian citizen. I want to introduce the following speakers, all of them very important as their matters they are going to hold. Let's see if we are technically ready. After Jay Bhattacharya, professor in Stanford, we have physician Meryl Nass with more than 40-year expertise, expert in terrorism, and she is important for the anthrax. She is committed. We have heard about her and we've heard her on social medias. She was interested in the matter. So I want her to speak first, then Dr. Donzelli will talk, and toward the end of the first panel, we will also have the intervention of Norman Fenton, the mathematician. Please, let's have a round of applause first, because we are at the very beginning. And please, I leave the floor to Meryl Nass. Let me just change place.
Thank you for coming. So I'm going to talk about biological warfare. And the only difference, really, between biological warfare and pandemics is that in one case you've identified an actual perpetrator. There are probably many cases of biological warfare that go undiagnosed. We don't know that they were caused deliberately. There are 4 classes of weapons of mass destruction. The only one in which you can actually hide the fact that it was caused offensively is biological warfare. So it's important to remember this. Genoese had a colony in Kaffa, which is now Fedosia, south of Ukraine, and they were attacked by the Mongols. This is the earliest recorded episode of biological warfare in 1346. Dead bodies of the Mongols who had died from the plague were catapulted in that device over the walls of the city of Kaffa, causing the Black Plague, and the Genoese got into their boats and fled back to Genoa, spreading it to the rest of Western Europe. Everyone knows the British and the Americans in the French and Indian War used smallpox to kill the Indians. Japan had a particularly flourishing program using many biological warfare agents against China and are said to have killed hundreds of thousands of Chinese during World War II. as well as using American, Australian, and other soldiers, captured soldiers, as experimental subjects. The United States was no slouch. There were CIA whistleblowers, so that this story was actually able to get into the Washington Post and other newspapers. This was another era when the media were not controlled, and we learned that the CIA had brought African swine fever to Cuba in 1971. Castro then talked about how multiple epidemics against humans, plants, and animals had probably been accomplished through biological warfare that the United States is likely to have unleashed on Cuba. Now, this is an epidemic of a new disease that Cuba faced over 30 years ago. I was one of the investigators, and I am one of the people who solved it. This was due to low doses of cyanide, probably added to food or water, which affected different parts of Cuba. There were 50,000 cases. People went blind, couldn't hear, couldn't walk properly, couldn't think properly. People who were well-nourished, which was mainly the small children, didn't get this disease. And when they were given vitamins and nutrition to allow detoxification of the cyanide, many people got better. This is another episode I was the investigator on. The world's largest epidemic of anthrax occurred in Rhodesia during its civil war. There were 10,000 known cases, 200 deaths. It was probably low-intensity warfare intended to kill cattle, to impoverish the blacks so they could not conduct a war against the white minority. This is due to an accidental leak in Russia. Russia was not following the Biological Weapons Convention, which had come into force in 1975, and an accidental leak killed about 60 Russians. Now, people are worried. They've just heard about self-spreading vaccines. You know that you vaccinate someone and basically they develop an infectious disease. Now, vaccines can spread. People who have been vaccinated with live measles, mumps, or rubella can potentially spread the attenuated strains to other people. You can culture the measles virus out of the urine of someone who's been recently vaccinated, for example. These are usually attenuated or weakened strains, but they can sometimes revert to virulence, and one should be aware of that. So self-spreading vaccines are a thing. They're not something new. We're just now hearing about them. I thought this was relevant to Italy. There's a problem in Europe. It's sort of a designated problem. I don't know how long this has been going on in Europe, but it's the same African swine fever that the United States unleashed on Cuba. It's in the wild boar population, and these yellow dots are cases identified in wild boar. The red dots are in farmed pigs. If the government finds one case in a pig, they kill every pig within a large radius, and these circles identify the radius in which pigs are being culled. Perfectly healthy pigs. But you can't prevent it from spreading because it's in the wild animal population. So what is the purpose of this culling program, and is it effective? It turns out if you cook the meat, the people are not being affected. African swine fever used to kill the animals very quickly, but it has mutated and doesn't do that anymore. So it's not clear that it's nearly as virulent as the disease the veterinarians were taught about. Despite all this, Italy has culled tens of thousands of pigs, and an Italian regulator said because there's no vaccine, all they can do is cull, and the culling is compulsory. But this is the important part. He warned that non-intensive traditional livestock farming models, the ones we think are the healthiest for us and the animals, which might not have sufficient levels of biosecurity, were particularly at risk and could disappear altogether. In other words, traditional farming could disappear because it doesn't provide sufficient biosecurity. That's a big problem. You can see this is a narrative forming. African swine fever was somehow introduced or showed up in China in 2018. And what happens? Trade restrictions. So now it becomes a much bigger economic problem because you can't sell your pigs where your markets are. And in 2021, China had so much African swine fever, it cost them $100 billion in culling, nearly 1% of their GDP. So was it biological warfare? Was it economic warfare, or was it just bad luck? Tony Fauci and Francis Collins wrote an opinion piece in the Washington Post in 2011 in which they talked about doing gain-of-function research. They said it was a risk worth taking and that important insights can come from generating potentially dangerous viruses in the laboratory. And the only question was whether the benefits outweighed the risks, and they felt they did. We can see that our public health leaders are somewhat blasé about the risks to the rest of us. In fact, they should have known better. Preventing these potential pandemic pathogens, also called biological warfare agents, from getting out when they're studied in labs is almost impossible. In the US, by law, based on the Biological Weapons Convention, the CDC tracks all experiments with designated dangerous biological warfare agents, potential pandemic pathogens, including bird flu, African swine fever, SARS, anthrax, etc. And they collect information on 200 accidents a year. And you can see in 1 year, almost 900 people had to be seen by doctors to evaluate them after an exposure due to a lab problem. So what's the WHO doing about this? They're getting in on the act. This is a very lucrative form of research. And they want to collect, the WHO wishes to be the repository of all these biological warfare agents, which they term potential pandemic pathogens. And they want to share them widely using WHO lab network called the WHO BioHub. And what's the objective? To promote rapid and timely sharing, facilitate access to biological warfare agents. This is another way of saying open source biological warfare. And I'll show you various drafts of the pandemic treaty. There have been about 8 drafts so far, and another one came out 2 or 3 days ago. This was from the March 7th. They discussed a pathogen access and benefit sharing system, and they want countries to equitably get financial benefits for sharing their biological warfare agents. They use the word shall, which means nations must comply. As soon as the materials are available, they must share them with the WHO, which will share them widely. But they can also, nations are allowed to share them to entities outside the WHO lab network as well. You know, the sharing of biological weapons agents, which is prohibited by the Biological Weapons Convention, by the way, is encouraged by the WHO in this document. This is an earlier version of the treaty. Here they talk about gain-of-function research without specifically using that terminology. and they instruct nations that are performing it to minimize unnecessary administrative hurdles for research, which means make it easier to have accidents. This is the same thing. This is the October 30th draft from last year. Same deal, because in almost every draft of the treaty, until these very, very recent ones, they've got the same thing. This is not a flash in the pan. This is one of the bases for this document that has been repeated over and over in at least 5 drafts of the pandemic treaty. And here in the February 14th draft, they finally actually use the term gain of function, and they tell us that scientists appointed by the WHO Director General will be the ones to supervise gain of function research. And these are screenshots. I have not typed these articles from the treaties out. I'm just giving you screenshots. The colors I have added. The black and white is all in the documents, and I've given you the URLs so you can look them up for yourself and confirm that this craziness is actually what the WHO is trying to perpetrate. Now, what happens if you share the organisms widely, you'll have accidents, but also you won't be able to tell if they were deliberately released and who released them, because everyone's going to have the same bugs. It also means nations won't need to go to the expense of developing their own biological warfare agents, because they'll be able to get them from the WHO. And that hackers can download the sequences, because you're required to put the sequences online on publicly accessible databases. And so hackers can hand the sequences to biologists who can then construct these biological warfare agents, just in case the WHO doesn't want to share them. I've just shown you the proof that the WHO's pandemic treaty is actually a method for creating, sharing, and proliferating biological warfare agents. Whether or not there is a pandemic, the treaty is enforced 24/7. These rules have nothing to do with pandemic special circumstances during a pandemic. If a nation has these agents, they're required to immediately share them with the WHO, regardless of whether they've caused any disease. In what universe does this make sense? According to international law, which includes the 1972 Biological Weapons Convention, the 2004 Security Council Resolution 1540, and customary international law, what the WHO is trying to do is completely illegal. And that is why in none of the WHO documents, in none of the talks they've given about this, do they ever mention that there are existing international treaties and norms that prevent what they're trying to do. The WHO is trying to sneak this past us. Since they control most Western governments, they think the governments will go along, and yet we're the ones who are left, and we have to say loudly that our controlled governments will not be allowed to perpetrate this on the 8 billion people of the world. So what can we do? We can first of all make this an election issue. Put their feet to the fire. Force your politicians to express an opinion about this, because it's very clear-cut what's going on, and you can show them the documents. Educate everyone you know. Point out that what they're proposing is actually illegal under international law. Emphasize that what is claimed to be a method for preventing pandemics is in fact a method for achieving more and more pandemics. Assert at the local level, we are doing this in the United States, at the level of the counties and the states, because we can't really influence our national government very well. But at the counties and states, we are passing resolutions and bills that say no. We are not going to allow the WHO jurisdiction in our local area, and we have a federal system that allows us to assert local and state rights. We're also working on a bill now that will require the Senate to ratify these documents, because that's what our Constitution requires, but in general, we just get a sign-off by the President or the State Department. We're trying to avoid that, go back to the constitutional requirement that this is so important, the Senate needs to look at it. And if they look at it, it only passes with a 2/3 vote, and we don't think they will be able to achieve that. So work on your national governments, try to get them to, if these two documents pass now, try to force them to perform a formal ratification where your parliaments actually examine the documents, and you have 10 months to reject the International Health Regulation amendments. Insist on banning gain-of-function research. There is no excuse for it. It has never resulted in a single drug or vaccine, and encourage everyone you know to say they will not comply. Thank you very much.
Thank you, Dr. Meryl Ness, for your interesting speech. I didn't see that. Sorry, it's behind me. I was calling to report, but they say that for those who don't agree. But I can bring it. If on page a photo, takes a picture of you, says, oh, all these Italian greetings.
Allora, mentre
while we're waiting for the coffee to come, yeah, we're gonna take a break. Oh, they're gonna bring it. While you're receiving the coffee, we're gonna continue with the speeches. So I ask you to be concentrated, to stay concentrated, and to be silent, because we're gonna continue as we have important speeches, and ask you to pay attention to what we're gonna have, because as you can see here, the title is full. The International Conference on COVID-19 Management and the Risk of the New WHO Binding Policies, Delusional Efficacy and Safety for Vaccines and Other Interventions. We welcome Dr. Fenton, who is a mathematician, professor emeritus of risk information management at Queen Mary University, and we're gonna have a round of applause for him.
E a seguire poi ci sarà.
And then there will be Dr. Donzelli. I'll give you the floor.
Thank you for inviting me to talk to you in the beautiful city of Rome. As early as March 2020, even before the first lockdowns were enforced in Europe and the rest of the world, it was clear to some of us that flawed definitions and models and easily manipulated statistics were being used to mislead and frighten the public and exaggerate the scale of the pandemic. Since then, we've produced dozens of detailed research reports and hundreds of articles that show that COVID was never as lethal as claimed, the testing was never accurate, the lockdowns were a disaster, and the vaccines aren't safe and effective as claimed. Unfortunately, because of the brutal censorship in both the mainstream media and academia, of voices that challenge the official narrative of a lethal virus and a miraculous vaccine to defeat it, our research went almost entirely hidden from the general public. Fortunately, in recent months, the concerns that we were raising since 2020 are beginning to be discussed much more publicly, and it's therefore an honour to be allowed to raise these concerns further to such an important audience today. So my 25-minute presentation will begin with the flawed and easily manipulated definitions that shape the narrative, especially in creating the perceived need for an almost mandatory vaccine. I'll show that the early data on mortality by vaccination status revealed the extent to which the flawed definitions could be exaggerating vaccine effectiveness. And in particular, I'll talk about how basic misclassification of cases and deaths by vaccine status was being used in a way that would lead even to a completely useless vaccine being shown to be highly effective. We called this the cheap trick because it's just an inevitable statistical illusion. And I'll talk about our recent work that's shown the extent to which that cheap trick has been used in practice. In fact, it's been used in almost all the empirical studies claiming safety effectiveness of the COVID vaccines. And finally, I'll make some conclusions and recommendations. So the definitions that drove most of the COVID narrative have the following counterintuitive implications. So Fred, who has no COVID symptoms, tests positive in a PCR test for work. He doesn't go on to develop any symptoms, but he's classified as a COVID case. Now, 13 days after his PCR test, Fred is critically injured in a car crash and rushed to hospital. Well, Fred is classified as a COVID hospital admission, a COVID hospitalisation. And 2 weeks after being taken to hospital, Fred dies from his injuries. Fred is classified as a COVID death. These are real definitions. These are the UK definitions, and they're the same in many other countries of the world. On the other hand, Jim is healthy, gets a COVID vaccine. 13 days later, he tests PCR positive with symptomatic COVID. Jim is classified as an unvaccinated COVID case. Peter's healthy, gets a COVID vaccine. The next day dies. Peter is classified as an unvaccinated death. Now, these definitions were used to exaggerate the true numbers of COVID cases, hospitalisations, and deaths. They artificially created the big second and third waves at the end of 2020 and 2021 that provided the justification for further lockdowns, almost mandatory vaccines, and then the booster. So here we see the widely reported plots of the daily case numbers, which were everywhere, this is from the UK government's coronavirus dashboard website. So this is going from April 2020 to the end of 2021. So you can see that there's a little peak at the beginning there in the spring of 2020 when the pandemic started. But then look at that much bigger second wave at towards the end of 2020. Massive compared to the first one, based on these are cases, official cases. And then an even bigger, and that of course led to the requirement that the only way out of this is the vaccine. And then into 2020, people then was kind of like resistant to getting the booster. So hey presto, we had this massive third wave and the drive to get the booster at the end of 2021. But let's compare that data with real data on who was actually ill with COVID that you don't see. And what you see here, is a plot over exactly the same timescale of actual people ill with COVID symptoms, as reported to the various National Health Services and TriAge. So you've got the real pandemic peak at the start in March, April of 2020, but after that, there's nothing more than just the usual small seasonal peaks of respiratory viruses. So the definitions, so those big second and third waves were almost entirely driven by mass testing of people without symptoms, asymptomatic testing. Now, the definitions also ensured that the vaccines could be shown to be safe and effective, and that's what I'll now focus on. Now, in early 2021, the UK's Office for National Statistics, which is supposed to be the most respectable and esteemed statistical organisation in the world, started to produce reports on mortality by vaccination status, which is good. That's what we needed to see whether the vaccines were really working. And the first report that actually contained useful information, by which I mean age categorised data, covered the period from the 2nd of January to the 24th of September 2021. And superficially, these reports, which were, everybody got very excited about, suggested that the vaccines were working incredibly well. But in our research article, which analysed the data extensively, we showed that it was an illusion due to misclassification that could easily be seen when you simply plot the weekly non-COVID mortality rates, so that you get rid of any discussion about COVID cases. These are non-COVID mortality over that period, plotted on a weekly basis, comparing the vaccinated against the unvaccinated, right? And as an example, here's the weekly non-COVID mortality for the 60 to 69 age group over that period. Now, because these are non-COVID deaths only, if the vaccine was doing no harm, the mortality rates should be equal. They should be the same between the unvaccinated and the vaccinated, right? But you see something, of course, very, very different here. So the peak in the unvaccinated that you see there coincides with the vaccine rollout peak for that age group. And the same happens for all the other age groups. Even though they're being vaccinated at different times, you always get the peak in non-COVID mortality when the vaccine rollout is given to that particular age group. And also you can see, in terms of the vaccinated, their mortality, right, which is much lower, actually is below, their non-COVID mortality is below the historical mortality rate. Now, why would not taking the vaccine, as in the unvaccinated, cause people to die of something other than COVID at a higher rate than normal? And why would taking the vaccine stop people from dying from non-COVID causes? Apparently, this would mean that the COVID vaccine was some kind of miracle cure and elixir. Of course, in our analysis of the data, some have claimed this is a so-called healthy vaccinee effect, but actually that wasn't the case for this data. That wasn't the case for the UK data. The only reasonable explanation for this was that people dying shortly after vaccination were, of course, being classified as unvaccinated. And such a misclassification is known to cause exactly the statistical artifact seen here. In fact, you can simulate the rollout of a placebo vaccine, one which does absolutely nothing, when there's some fixed percentage of people who die each week, and you can plot it here, and it has all the similarities to the ONS data. The same statistical illusion applies, and the same statistical illusion applies when COVID cases by vaccination status, if those people getting COVID within 14 days of vaccination are classified as unvaccinated. You always see the same statistical illusion. And that's exactly what we call the cheap trick illusion. Now, let's consider an extreme example in the case of a vaccine that is supposed to stop people getting some disease X. So imagine that everybody who gets the vaccination actually gets infected with disease X within the first 14 days. Which would be pretty disastrous, we'd all agree, right? Well, assuming they then don't get reinfected within, say, 3 months, which is the normal period when they're looking at the data for effectiveness, then they're not going to get the disease again. So what happens? You record no cases of disease X in the vaccinated, even though they actually all got it from the vaccine, right? But you don't record any cases. Whereas, of course, so all of these cases, as well as those in the genuinely unvaccinated, would be recorded as unvaccinated cases. Okay, sorry. Now, vaccine efficacy in any given time period, sorry, this is the only bit of maths that you'll see, is actually formally defined as 1 minus the percentage of people who are vaccinated who get X divided by the percentage of unvaccinated who get X as a percentage, But in this case, of course, the percentage of vaccinated who get the disease is going to be 0 because they all got it in the first 2 weeks. They're classified as unvaccinated in that period, and they're not going to get it again. Whereas, of course, the unvaccinated are going to get, at some point, some of them are going to get the disease X, right? And so the denominator there is going to be non-zero. So vaccine effectiveness is 100%, even though every single person who got the vaccine got infected. This is how ridiculous it is. So that's, of course, the worst case scenario, right? But that's, of course, an extreme case. But let's assume that some small fixed weekly rate, say 2% of people get infected, and that this is constant and the same for both the vaccinated and the unvaccinated. So again, this is just a placebo vaccine. It makes no difference in your chance of getting the virus. And if you assume that the vaccine is rolled out to 85% of the population over a 12-week period, which was the typical European rollout in 2021, then this is exactly what you get. This is how you would see the weekly infection rate. And when you then turn that into an efficacy rate, what you see is exactly what was reported in all of the observational studies at the time. You start in the first few weeks with these very high efficacy rates, but it gradually wanes after about 3 months, and hey presto, you need a booster. But this is just a placebo vaccine. And if instead of using the 14-day rule, you use a 21-day rule, which is exactly what the Office for National Statistics were using, you start off at like close to 95% efficacy purely for a placebo vaccine, using the same cheap trick. And it gets even more bizarre. Okay, so those are the 7, 14, 1 week, 2 week, and 3 week delays. You see the same pattern. It starts off with high efficacy. Whatever the delay period is, you get this high efficacy, which then tails off. But it gets even more bizarre because you can take a negative efficacy vaccine in the sense that those who are vaccinated have a constant higher rate of infection than the unvaccinated. And if you take a delay period of 21 days, which was the ONS delay period, you actually still start off over 90% effective. So a vaccine which is actually doing damage is still shown to be effective by this cheap trick. So, okay, and that was it. So theoretically, we have shown that for a useless and even worse than useless vaccine, you will inevitably get very high initial efficacy if there is a period after vaccination in which cases are counted as unvaccinated. But the question is that cheap trick really used in the published studies? And the answer is yes, absolutely. So here's the actual text from the ONS document on how they calculate vaccine efficacy. So you can see unvaccinated, those with no vaccination, or who were vaccinated with the first dose less than 21 days ago. So that's the official document that was producing the vaccine efficacy figures. And the same in Australia. In fact, it's even worse. It's small print here, but I'll tell you what it says there. It's the same, except it's even worse because they were classifying anybody who got infected for whom there was no vaccination record, whether or not they were vaccinated or not, they were classified as unvaccinated. Now, for 3 years, we were reviewing the big, well-cited studies claiming vaccine effectiveness and highlighting that all of those ones we looked at involve some version of this cheap trick illusion or some other selection bias, as we call them. Now, our letters critiquing these studies were never published in the journals, and you can look at my Substack for some of the hilarious correspondence with, for example, the Lancet about why they wouldn't publish our letters on this. But more recently, we decided to do a systematic review of studies of COVID vaccine efficacy and safety to see how widespread this issue was. And that's what we did a few months ago before publishing our results online last month. So we searched the 2 main literature databases, PubMed and Scopus, for papers that presented some kind of retrospective health records or prospective clinical study of a novel study of COVID vaccine efficacy or safety. And the initial search, it actually returned over 2,000 articles, of which 500 were duplicates. But actually, after removing the duplicates and then looking at the abstracts, it turned out that there were only 34 that presented a relevant novel study of vaccine efficacy and safety, because most of the others were just reporting on other existing trials or reviewing them, stuff like that. We found a further 4 papers through citation mining of the included papers. Now, look, I'm sure that this is a systematic review, but I'm sure that there are more studies that we missed, and I apologise for those. But of course, uncovering that which is being hidden is a bit difficult. It's a bit like the FBI claiming they've rounded up all drug dealers. But the key thing is, the 38 papers that we did review included all of the very well-cited studies that people know about and have been promoted widely in the mainstream media. And every one of the 38 papers involved the miscategorization selection bias of at least 7 days in COVID cases in the vaccinated. They were classifying those as unvaccinated in the cases. I mean, we also found other categories of selection bias. I won't go through all of them, okay? There are these various ones that we describe in detail in the paper, but they all compound the effect. And the key thing is that, all of the papers, all of the 38 papers included the basic misclassification bias, as well as some of these. And in fact, you can't see it here, but there's a list of the papers, all 38, and the left-hand column is the basic miscategorization bias, and the other columns are the other types of biases, and the last column is how many days the period was. You see it's 7, 21, some even 28 days delay in some of these studies. And to give you a feel of how bad things can be, here's just one example in a prestigious journal. And this particular study claimed that Omicron variants were less likely to be transmitted in the vaccinated than the unvaccinated. But it's really interesting to look at a footnote here, which I'll blow up and read, because this shows you how crazy things get. So not only were they doing the cheap trick, but look what they also say. They're saying that the unvaccinated includes individuals with partial vaccination, and the fully vaccinated includes unvaccinated individuals with previous infection. Right? So they were actually doubling the bias here, because the unvaccinated, the ones that they knew had been infected, they get a free rein. They of course don't get classified as unvaccinated. And again, I mean, we did the same simulations using realistic rollout periods, and you see these same efficacy. We looked at all kinds of scenarios here, and you get all of these. You always get this starting at high, the sort of 90% efficacy in the first few weeks, and it always wanes. Exactly the same thing always happens. Now, finally, I just want to talk about the failure of the vaccine and other non-pharmaceutical interventions, because just very briefly, I was involved in another recent research report on that. But just before that, a while back, I just did a plot from I think this is from the Our World in Data website, looking at COVID death rates against vaccination rates. So the death rates, this is actually on a log scale, the reason I'll explain in a minute. The Y-scale is deaths per 100,000 of the population, and the horizontal scale is the percentage of vaccination rates in each country. Now, if the vaccination was kind of like working, you'd expect the trend to go from the top left down to the bottom right. But actually, of course, you see it's almost the complete opposite. And the deaths, as I say, they're plotted on a log scale here, because in virtually all the African countries, in the bottom left segment, there are virtually 0 deaths. And of course, these are the countries which also have the minimal vaccine uptake. But the study we did, that I was a co-author was a statistical analysis that looked at the data from 6 North European countries to see the impact of vaccines and other non-pharmaceutical interventions, like, of course, lockdown, on the progression of COVID as measured by the officially classified COVID deaths and cases. Now, notwithstanding the problems that I've already spoken about with those COVID deaths and cases classifications, what we found was that it was only seasonality and not the vaccines or lockdowns or other MPIs that had any significant progression on the pandemic in every one of the countries. So seasonality explained the progression in statistically significant terms, but neither vaccination or lockdown. And these are the conclusions for vaccine. That was deaths, and this is cases, exactly the same thing. Even with cases, you see the same thing. No statistical significance with the vaccination and non-pharmaceutical interventions. So, conclusions and recommendations. So, none of the official COVID data on COVID cases, hospitalizations and deaths can be trusted. Much of it was geared towards framing a narrative of the need for a vaccine. All of the published empirical studies claiming vaccine efficacy and safety suffer from one or more types of misclassification bias. And that type of misclassification bias will inevitably show that even a useless vaccine is seen to be highly effective in the early weeks of a vaccine rollout. Hence, even if there was genuine efficacy in the vaccines, the results claimed for them in the studies would still be massively exaggerated. And there's overwhelming anecdotal evidence from our everyday lives that indicate that the vaccines were not effective. Right? I mean, we know, I'd be interested to people's views on it, but I mean, how many people in the audience know far more people who were vaccinated who kept getting PCR positive or getting COVID cases than people who were unvaccinated? Now, since increasingly unbiased evidence is showing that all-cause mortality in the vaccinated may well be higher than the unvaccinated in each age group, we recommend that any further rollout of the COVID vaccines should be terminated. Thank you very much.
As our moderator is finishing his interview, I want to introduce myself before my speech. I am Alberto Donzelli. I'm a physician. I'm the former medical director of public health. I've been working for 39 years. I'm retired now. And I was a member of the Consiglio Superiore di Sanità, which is the higher health council. And in the last 10 years, I've been working on the evidence-based medicine. And it is pertinent with the scientific part. So I'm working even if I'm retired. And I'm also the coordinator of the committee, of the Medical Scientific Committee. Is not that? So I also declared that I don't want to be part of any conflict of interest. I've been the director of this service, and I am retired. I have no conflict, and I am also president of the foundation, which is Allineare Sanità e Salute, which means aligning health and healthcare, which are opposite sometimes.
And this foundation is based on voluntaries. There is no conflict, but we want to align the interest of an NHS and with the concrete interest of the citizens' health community. And you can check it thanks to the facts, because we can't see what I'm saying, because our committee is asking a scientific confrontation which has been denied, but it's an important news. And also Professor Vaya received my demand. I hope to have introduced a good opportunity for a future collaboration. I'll talk about the COVID vaccine effectiveness, which is negative, and also a quantification of the side effects of vaccinated, and also the mortality related to vaccine. We would like to assess the requirement, the constitutional requirement to determine there is a sentence that explains that laws providing for compulsory vaccinations are compatible with Article 32 of the Constitution under three conditions. The first one is whether the treatment is intended not only to improve or preserve the state of health of those subject to it, but also to preserve the state of health of others. So we have also a community protection, and it is what Mario Draghi, our former Prime Minister, said. He said that the Green Pass is a measure by which Italians can continue to pursue their activities, have fun, go to the restaurant, and attend outdoor and indoor performances with the assurance that they are among people who are not contagious. Unfortunately, 10 days after, there was this publication, but someone should have said to him, so we are going to publish this report, and we hope to receive some excuses. This was made on the 31st of July 2021. We published in preprint, but what did the scientific committee do with preprint publications? Besides, it was published in an official report of the CDC, and then it was published also on pathogens the following year. So you can have these slides, you can do whatever you want. This is a double crime if we ignore scientific sources, which are governative sources, and we continue to censor a scientific consensus. So on August the 8th, 2021, there is the doctor in front of an interviewer. She declared that they can't stop the transmission of the virus. It was made on August the 8th, 2021, and then compulsory vaccines didn't have the reason to exist. I want to show you this study published by the members of the Italian National Institute of Health. It was finished in November 2021. It was published in February 2022, and it shows that the vaccination protection was opposite compared to though that of the unvaccinated, and it was under 29% in those who are over 80, so the most vulnerable people. So the protection is above the line, and under zero there is the negative part. Those who are age 60, 69 are here negative, even if it's near the statistic, which is about 20% less. I don't want to call it trick, but it's a manipulation of data carried out by the Italian National Institute of Health. And these are the data introduced as the data of this period. I want to know, after 8 months, how the curve is declining. So the idea of the negative protection is shocking when we see data, and we can see it from February 2022 in Italy. So we have this situation which is even worse in the high-risk people, who are high risk. We're talking about people who are in nursing home and long-term care residents. We see less 44%, which is really negative, which is under the level of unvaccinated people, even if this average gave us in the narrative that we have some kind of protection. This is the British situation. They start before us to attend 50%. And we extrapolate from British data in 2022. We extrapolate the data that you can see here in the age group 1869. Teachers, policemen were those who were forced to get vaccinated in order to work. As you can see here, the line arrives in the 13th week compared to those who weren't vaccinated. So this can't be a stable value, and we couldn't do that because the request of data wasn't realized. Where you can see that decline because the Health Security Agency decided to change data. So we don't want to to compare only the vaccinated people, but at least those who have 3 doses. And there was a reduction, as you can see, but then he jumped again. And someone could ask, but after the 13th week, what happened? We were writing, such as Fenton, we went that starting from next week, we don't want to publish this data because they're confusing. And this is what happened. This is the situation in France. The first booster from 60 months had a negative efficacy. So as Dr. Fenton said before, it matches. But then the situation is getting worse because you can see that with the second booster, we have the efficacy equal to 0 after 4 months. We're talking about people, elderly people, and it is 40% less compared to unvaccinated people. This is the data of the clinic Cleaver of the US in Ohio. And healthcare workers were controlled for 200 days. And a part of the healthcare workers wasn't vaccinated. And during the course of the 200 days is shown in the line with 0 doses. And we see the red line with to those which show those who received 1 dose, and you can see the lines with the doses. So we have to say that vaccination doesn't protect from transmission of the virus. It is misleading because we have to say that it increases, exponentially increases, the propension to have the COVID. This is what data say. So we need to spread this information. Otherwise, we say something that is out of reality. And this is the same work that we done for those who had the booster, the up-to-date vaccination. As you can see, it worsened the infectious state because those who followed the CDC guidelines get more infectious. You can see this period of unvaccinated people. In 2023, children with 2 doses were more exposed to get infectious. These are the subjects aged from 12 to 39 years. And we can see half of those who were forced to get vaccinated, to get also the booster in order to work. And in the week of January in 2023, we see 51% more of being infected compared to unvaccinated people. As you can see the line, there is the other half of healthcare workers, of those who were forced to get vaccinated. And on 18 January 2023, they had 70% more of being infected compared to unvaccinated people. And the following week, what happened? Our committee continued to insist that, can't you see that they are more exposed to get infected? And we can't post anymore this data, so it won't be confusing anymore. And I'm still waiting for explanations to this regard. This is MPE. He was answered by the European Medicines Agency. It was an interesting answer because yes, you're right. Oh, sorry. You're absolutely right. There's not a real protection from the transmission. It is also just to protect from the disease. Maybe we should say it clearly, but at least they said it. After 2 years that it was admitted by the director of the CDC, of our committee. We had lack of data on transmissibility. But starting from August 2021, she said that there was no possibility to limit the transmissibility. But better soon than later. And then our president said that get vaccinated is a civil duty, is a moral and civil duty, because unvaccinated people pose a risk. I hoped he said, dear citizens, I'm aware of the EMA data and I'm sorry for what was imposed to you. And I ask for a survey for those who didn't inform me and had to inform me. And I hope it will happen. This is just to see that the situation is even worse compared to what I've just described. He is one of the most famous epidemiologists worldwide, and he carried out a study on 4 million of Austrian people to see what was the propension to do that again. And he didn't find any benefits from the fourth dose compared to the previous periods, levels, sorry. But he showed that compared to the infectious, there is a turning point of the position. Compared to the line of unvaccinated, sorry, there is a slight protection that after a month disappears and increases the risk of being infected compared to those who received 4 doses. And they have 7.3 times more to be infected compared to unvaccinated people. Do we recommend to continue to get vaccinated? In the France of Liberté has just approved a law. The National Assembly approved a law because with the excuse of defending the fact that we can have many deaths, this law concerns also us because having so to avoid to continue to get vaccinated, the state still thinks it is important to get vaccinated, but we could have a 30,000 euros fine for anyone who induces abstention from medical or prophylactic treatment. So we are trapped. This is not only an unprecedented duty. We are in the totalitarianism system. There is no a democracy anymore because we have to discuss it. And fortunately, in Italy, we don't talk about it. We hope that there will be a different point of view, a more coherent point of view for our democracy and for our science that have to be taken into account. There are also some controversial areas which is supported by evidence because our committee doesn't want to say we want to listen our opinion too. We want to express our point of view, which are supported by evidence, and then we are ready to compare with evidence. If these are better of ours, we are going to say sorry because we didn't consider better evidence than ours, but we want to see the evidence of those who say that it's not true what we're saying. The second condition of the Constitutional Court to admit an obligation is that whether there is an expectation that will not adversely affect the state of health of the person subject to it, save only for those consequences. We want to have a block quantity of the adverse effects based on institutional sources which are official, and we have to check them. We don't want to assess all of these on opinions. We also publish the quantification, which you can see on our website, and it is the 12th EFA report. The EFA is the Italian Medicine Agency. Is this report detects suspected adverse reactions many hundreds of times lower than the CDC active surveillance and registration trials, such as the initial trials of Pfizer and Moderna. What is written in the supplementary tables must be checked and must be verified on the web, as we did. And we saw what I'm showing to you. We have to find a different thing, a challenge. And the severe reactions are different. It seems incredible, because I had to show to them because they didn't believe it. And Mario Giordano declared on TV must be seen. Let's see this example in the Moderna trial regarding teens. As you can see, the number is doubled. Those who were vaccinated and those who had just COVID. We only had 8 cases. And they had 5,000 side effects. As you can see, someone asked us, have you eliminated the placebo effect? No. For example, a nurse insert you a needle for the placebo, for example, and gave you water. So placebo means doing nothing. So we have to write it down. The general effects were detected, and we saw that we had 4,000 side effects, of which 400 were severe. We also had 4 hospitalizations. And then we had other side effects that are even worse compared to our cases. So there is a disproportion also in this case. In the studies concerning surveillance of myocarditis, we can see the same thing. So we can see the difference of the passive surveillance and what the active surveillance declares. So Thailand taught us, thanks to, let's say, its arrogancy, Thailand tried to see in 301 students, healthy students, how it works. And after 3, 7, 14 days, they had they were tested to see if something changes. And they had cardiovascular effects that they didn't have before. We, we had some side effects and the assessment of a laboratory based on symptoms, such as myocarditis, as they said, per, per thousand times. This is what passive surveillance says. The follow-up, we didn't see anything in the follow-up. 777 health care workers received the third dose of Moderna, and they had myocarditis. We ignored some subjects. 2.8% didn't show any symptom. And women were more affected compared to men. In this report, we talk about hospitalization. What did they admit, even if it was ignored at the end? They admitted that in some countries like Germany, France, we had this plot. See the right part, which is compared with the vaccination and the booster. Those who received the booster were towards 0 and under 0. And as you can see on the left, with the we are showing you the unvaccinated. And the slope of the curve is like the other. We can see the same inversion of the severe disease. Also, with the subjects who received the third dose. We have to admit it because in the report we can see that out of 8 European countries, we see this table. It's very little, then you can see them later more properly. When we go when we assess 2023, we see the effect, even if it's not taken into account, but we have 6 deaths more due to COVID compared to unvaccinated people. These concerns those who are over 80. These are other examples. These are other examples concerning younger people from 50 to 64 years. Also in this case, you can see a negative trend with a complex overall of 6 months from the first dose. This is really serious, and they support the fact that we too had additional doses because in order to protect our people, we have to continue this way. The 14 days shift is admitted by the Italian National Statistical Institute because it doesn't take into account it's not aware of what it's doing because they admit the trick. They think it's normal. what happens in the first 14 days after the dose, it can happen also in a death case. And you can see it on the website. Maybe they're wrong, but it's written. And there is the evidence, the proof of the cheap trick. This is the fake vaccine which arrives to zero, which goes to zero. Instead, a negative effect goes under zero. It seems like something that we already saw. So we have to wonder what we are doing, and we have to urgently had a scientific comparison. This is another group, a British group, of Norman Fenton and Martin Neal. We don't want more statistics. What did he? What did he do? What did the ONS do? We can't manage the data anymore, and we don't publish data after May 2023. And they gave us the example of what they do when they can't manage the situation as a spoiled kid. For example, a spoiled kid could say, well, I don't want to play anymore because I'm not able to. And then we published a study regarding prevention and epidemiology. After 1 year of follow-up in Pescara, in Italian region, the University of Bologna published a study in which they said people who received the 3 doses of vaccine die a lot. They didn't consider the mortal die. And we can see that there was no difference of mortality between vaccinated and unvaccinated. They continue and they insist to propose again this study. They say, well, it's true, there is a significant increase in mortality with 2 doses, but there is a benefit with 3 doses. So we have to produce doses. So we ask them, and they gave us their data set. We compared from 1 year and 2 years, and the situation is clearly worsened based also on data that we analyzed. But we published, which is not still edited, we published a study which critiques the previous study, and you can see that thanks to our multi-varied analysis, we correct many factors which could be in another analysis, and it emerges that death are even worse regarding those who received 1 or 2 doses. So we applied in this analysis, we applied 2 indices. These are the last slides. As you can see, the restricted mean survival time. I want to show you this one because the life expectancies of people from 2021 to 2022 got vaccinated is reduced of 2.7 days, 2.7 days compared to other people. And what emerges is that we lose 3 months of life expectancy. And those who receive 2 doses, it's lower. You see that the differences in the RMST are meaningful for those who receive 2 doses or 3 doses. You know that in Brazil, you can't receive benefits if you don't get vaccinated. This is an extreme case. So we lose 3.6 months of life expectancies for vaccinated, and we lose 1.3 months for vaccinated with 3 doses. Just think that we correct the minimum mistake, and this gives us hope. We're not in France, so I won't go to prison for that. But in 2022, Italians don't get vaccinated anymore. So it becomes the norm. So this line gave us hope because nature can somehow repair what we did. Thank you very much.
Allora,
So, while we're receiving coffee, I don't know how many doses are recommended. I don't want you to exaggerate. If someone would like some coffee, please raise your hands. I take advantage too. 20? We have some minutes while we're having coffee. We have some time to ask questions to our speakers, Dr. Nass, Dr. Fenton, and Dr. Donzelli. If someone would like to ask a question, you can ask your hand. Yes, please, go ahead.
Okay, it works. Fine. Dr. Fenton, this is the question for you. Then I'd have another one for...
ma credo che abbiano una traduzione, se vuole farlo in italiano.
Parlo in italiano perché gli altri
così
capiscono.
Concerning the determination of chip trick, I would like to understand if there is something similar regarding the determination of effects on death, because he has an evident impact regarding the efficacy, but it's defined on the predisposition to get ill. Is there a bias effect? Is there a bias effect also regarding misclassification to determine the classification of COVID death?
Yes, can you hear me? Yes, the cheap trick illusion, I think as I indicated, works exactly the same whether you're talking about cases or deaths. Now, we had long discussions with the Office for National Statistics in the UK, and they claim that whereas they admitted that for cases within 21 days, they were classifying those as unvaccinated, they said that for deaths, no, if there was a death, they said if they'd been vaccinated even an hour before, they did classify that as a vaccinated death. But we have independent evidence that that did not happen. They might claim that that happened, but it did not happen. In fact, we have the evidence that there's no way they could get that information, given the delays in the death reporting and given the delays in the vaccination record reporting, that happened. And in fact, the real evidence we showed in 2021 was that we know that they were misclassifying deaths as unvaccinated. I think they have done a little bit better. They did a little bit better on that in 2022, but as Alberto said, in 2023, when we exposed more problems in their data, they said, sorry, we're not going to produce the data anymore, and that was it.
I would like to add regarding Italy, because our colleague didn't see the slide number 29, but you can see it on our website and you can study it to see if it's true. So I would like to read what our National Institute said. In order to assess the effectiveness of vaccine, we consider those who are diagnosed regardless if they develop a severe disease or if they died in the first 14 days from the first dose as unvaccinated. So this is the same mistake regarding the following doses, and you can see it on the slide number 29. We have another question, please. The microphone, the interpreter can't listen to the speaker. Thank you. Yes. I'm a physician. I'm part of the Italian Society for Medicines, and I thank, first of all, you, the speakers, for your extraordinary moment of sharing. But what I saw, I would like to talk about another thing. You talk about a pandemic, but the most dangerous pandemic that emerged, it's not viral pandemic. It's an intellectual pandemic. It's an anthropological pandemic which involved important levels of our society. We lived in Italy, we have gone and trained in Italy, but we see how it involved Europe, the world. I think about politics, and I think about our media that we already mentioned. I think about physicians, not the majority, but a large part of healthcare workers. We're part of this fact that you told us, and this leads to death, and then there is an influence on the population. Now the question is it possible to find strategies, I will say, to get vaccinated, but I will say to increase our antibodies in order to avoid to be drugged in our civil society, in our society, Italian medicine. We are trying to create networks of people who are aware, who want to be informed, but it's not easy. We grow up slowly because it's not easy to spread, to raise awareness about these issues. Because then we see plots, we see no scientific evidence. Instead, we saw science today. And then we want also to create healthcare providers network. What kind of strategies would you suggest?
Turn off your television and your radio. And you'll find, if you talk to the tradesmen and the working class people in my country, they understand the truth. It's only the intellectuals who don't.
Come sempre. Non so se vuole rispondere anche professore.
Yeah.
Would you like to answer?
Yeah, I absolutely agree with that. And indeed, one of the main points that was underlying my talk was the fact that was there really even a pandemic? I mean, the psychological indoctrination that created it is phenomenal. And we've just published in the last few days a report about that whole Johns Hopkins University their dashboard, which was set up somehow miraculously, even before there were any COVID cases, any COVID deaths, and suddenly that was considered, everybody in the world was using it, and yet we've now found out that it wasn't real. Most of those reporting was just also simulated. People were thinking this was coming real-time, live data on COVID cases from all these countries in the world, but it wasn't. All the countries in the world were getting it from their dashboards. It's kind of like a self-fulfilling prophecy. That's how they created it. That's how they created that initial mania.
I would like to say that in order to have an additional element to answer, stay here until 5, because there will be a concrete proposal by our committee. I would like to add something regarding information, maybe something more, a hint, as you give responsibility to the press. But see, if we go out of the pandemic issue and we analyze other questions in this moment, main discussion issues, the attitude is the same. We were talking before. We had 44 people vaccinated spontaneously, 44 million people. The alternative was available. We had other information sources, so we not only had the complot, but people didn't want to take advantage of it. There was conspiracy, and as journalists and other speakers were the first one, Jacques Ellul wrote something about that. So why intellectual people are the first one to do that? So it goes beyond the pandemic issue. And I really fear that we have to change our strategies regarding the relationship with the physicians in a decisive way. Because when we show people to people data, they get bored, they don't listen to data. So we have to work on it, and we also have to see what happens in other issues in Italy, starting from the gender issue. There was the lady there, then we have other people. Can I count your hands? There are many questions. So we'll have a couple of questions. And then we will have some other time later for questions. We want to close them as a lockdown. Good morning, I'm Sabrina Gugliali. I'm a candidate for the European elections. I would like to thank you, and I'm thrilled to be here for all the information that you're sharing and all your engagement. I thank the strength of Dr. Donzelli over this month. My question is, and it regards politics, what can we do in order to transform, to get out of this conspiracy of research? Because the pharmaceutical companies continued to insist has a lobby on political forces from World War I. We continue. It continues to insist. You mentioned Johns Hopkins University. These are some examples of real influences. It's just an example. In Baltimore, I want to remind you that Johns Hopkins banned activities, some activities. I'm talking about many years ago. But research was influenced a lot. Can you give us some guidelines, some leverages, taking into account our situation? I would like you to be brief so we can have other questions.
As I understand it, you're saying that the power of the pharmaceutical industry over the universities and the politicians is such an extent that it's going to be very, very difficult to break this stranglehold they have against, revealing the true narrative rather than the one that they are creating. Is that? I mean, I don't know what we do about it. I mean, they are incredibly powerful, and they have the influence, and they have, they bought many politicians, and they've basically have power over the mainstream media as well. I don't know. I really don't know what the answer is. And as Meryl said, turn off your, TVs. I mean, but then, most people, unfortunately, still don't. So it's a problem.
So what's happened in FDA regulation is that it's been gradually dismantled over the last 30 years. And I think if, for example, in the United States, if Bobby Kennedy were elected president, he has some sense of what's happened, and you can gradually build back the FDA and regulation, and one can take away the power of the pharmaceutical companies over it. We didn't used to. 32 years ago, before that, we did not have the pharmaceutical companies paying to get their own drugs approved. That is how it works now. So they pay 65 to 70% of the cost of getting their drugs approved. That's a disaster in the making. So we know how to fix these problems. There are problems of government regulation. The issue is, do we have the will, and can we institute mechanisms through the Congress, if the Congress is also bought, that will take away the power of the purse in terms of these federal regulatory agencies.
Grazie.
Another question, please. Susanna, please. Thank you. I'm a general physician. During the COVID pandemic, I was also assessor for politics in the northern part of Italy. So I've gone through many contradictions in that period. I want to thank the Professor Donzelli and all the panelists here for what you produce, because he saved me during the pandemic, and we see the outcomes now. After what I've heard today, maybe the most important thing was basing on the precaution rule principle. I've lived a digit limitation, as you said, regarding my profession. I was the victim of the delegitimation. I will say, who is who regarding the legitimation of our profession. I'm also a candidate for the European, for the Northwest list. I would like to ask you if it's possible to have a broader explication, a more practical explication to interpret what you said. I think I understood, but I would like to listen again the cheap trick speech, because sometimes things are written in text, but we are not able to interpret them properly. So this mystification are like are difficult to be understood, and I think these must be reviewed because I think that there is the possibility to do research, to work on free science regarding the chip trick. Thank you. Okay, doctor will answer, and then we are going to ask the last question.
Alberto has done some translations of the cheap trick and video. Yeah, you did an Italian version of the video, so.
Guardate, è
It's extremely important, as you can see, all the studies that we carried out on this issue. So beyond the two trials of Moderna and Pfizer that were blocked, stopped after 2 months, when 15 people died due to Pfizer and 14 people for the other group, we can't say that that unvaccinated people died more frequently. But it's very complex, and on our committee website you can see in English the speech of Dr. Fenton. There is also a publication of our physician, of an epidemiologist, in order to strengthen the same issue of another Italian epidemiologist, of Professor Pretti of Sapienza University in Rome. And then you can find other slides in English, but also in Italian. So trust these slides, you can read them, and you can understand what you have to diffuse, to spread. Thank you, Susanna, and then we're gonna start again. I'm Susanna Tamara. I wrote a book on the COVID situation. It wasn't so spread, though. My battle is spreading truth in this dark. I would like to ask, why did we say that we didn't have to control the antibodies? It was banned. Pain, even if we was paid, it was banned. It was forbidden. As I had 2 member families with side effects, I would like to understand why it was forbidden to count the antibodies.
io
I think it was banned, it was forbidden because they wanted people to get vaccinated, because we see the Italian law, there was the evidence of the disease. In the law there was written that we can avoid vaccination. So there was a reason to get people vaccinated, but it can generate adverse opinions, because those who have high antibodies can respond, can react better.
One more thing.
So didn't have any scientific motivation. Well, antibodies are not related to protection, but as we have our law called the Lorenzini law, at least we complied with this law. The scientific motivation is that they lie.
All I wanted to say is that those same antibodies were used to actually license the vaccines by the FDA. So they didn't let you use them, but they used them in a definitive study to give the vaccines a license.
Allora,
Thank you for the question. So we have other important speeches and then you can ask questions again. I'm gonna read them because they are remotely, and a couple of these speeches are very, very important, so I invite you to follow them properly. Besides, you have also coffee. There was a pun regarding who, WHO, who is who, the World Health Organization in English. We have Katerina Lindley, who is your doctor, is the title, which is a pun because of the WHO. And Catherine Lindley is the president of the Global Health Project and director of Global COVID Summit. Then there is Ralph Babbitt, a member of the Australian Senate. He is the only case in the world, regardless the assurances, he managed to let the law pass in the Australian Senate. He let pass the will to have a survey regarding the excess of mortality. This is the only case in the world. And also our Minister Schillaci talk about that in general terms. Then there is Liz Gunn. It's a very strong speech regarding the excess of mortality in New Zealand, regarding also vaccination campaign. As there are still those on social media who, after having bullied other colleagues, other people, I'm talking about journalists, and then also physicians intervene to make a good impression. And then we listen to Masanori Fukushima, who will talk about the RNA vaccine and vaccination, and also the acute death due to cancer. I invite you to follow these speeches because everyone knows people who had side effects. So I invite you to listen to them. Then we will have a break and then we listen to other speeches. Thank you.
Kat Lindley. I was born in Croatia, but I went to, actually lived in Italy for 5 years in Bassano del Grappa, and then I went to United States where I did my medical training and became a family physician. We're going to discuss a little bit about what's happening at the World Health Organization with the negotiations of the pandemic treaty and the amendments to international recommendations, international health recommendations. So meet your new doctor. This is going to be your new doctor, Dr. Tedros Adhanom Ghebreyesus, who is actually not a physician. He was a health minister in Ethiopia. He covered 3 cholera epidemics affecting rival tribe and was chosen by the Chinese Communist government to become the director of the World Health Organization. During the COVID-19 pandemic, the World Health Organizations only had advisory authority, but with the amendments to the international health regulations and the pandemic treaty, this will change. So it's very important to discuss what's happening currently at the World Health Organization, and everyone needs to know that there are 2 documents being negotiated at the same time. One is the Pandemic Agreement or Treaty Accord, CA++. It has changed names over a period of time. And the other one is International Health Regulations. This is a legally binding international law that our countries have already become a part of. And they were originally adopted in '69 and then amended in 2005. So the pandemic treaty that is currently being negotiated would legalize the worldwide use of the experimental, liability-free vaccines, impose health censorship, and many more things. And then these amendments to international health regulations that are being proposed would give the WHO power to impose worldwide lockdowns and stuff. So that's why we need to know that they are working together. One is the legal document, and the other one is a roadmap on how these things can be accomplished. And some of the things that will be accomplished, if those things are approved, will be the force to pass laws to allow unlicensed, rapidly produced, and liability-free vaccines to be used for future pandemics. The WHO will be able to order global vaccine mandates, lockdowns, quarantines, and border closures. The WHO Director General would be able to decide the treatments, diagnostics, and vaccines that the physicians will have to recommend to their patients. The WHO will require the nations to surveil their citizens' online activity and censor what they consider misinformation and disinformation. And WHO is building a biowarfare agent library that the countries will have to share. So I will spend some time on the amendments to international health regulations because it's very important to realize that these amendments, there are 303 amendments. Most of them are proposed by the US government and our Health and Human Services Department. And they will change the relationship that countries used to have with the World Health Organization. In the past, the WHO would advise us on what to do, but in the Article 1, they crossed out this non-binding advice, and now this advice is going to become an obligatory recommendation, which means that the countries will have to comply. In the Article 2, they also changed the scope and purpose of what will be covered. So it used to be restricted to public health risk, and now it's going to be all risk with potential to impact public health, which can be climate change, gun control, transgender issues, and other things. And this is the most important article for me. I'm a doctor, I see patients, I have a practice. So if there is an outbreak somewhere in the World Health Organization can send a team in, the team decides it's an outbreak, country doesn't have to actually agree anymore. And once the Director General considers this a public health emergency of international concerns and declares one, then he will be able to require medical examinations, proof of vaccinations or other prophylaxis, put people under observation, quarantine, isolation. He will tell the doctors what type of treatments, what type of medications we are allowed to use. They can tell us that all of our patients have to be vaccinated. He can also call for lockdowns, travel restrictions, close the borders, and limit the trade. Many of us consider this not only an attack on national sovereignty, but also on personal sovereignty and an attack on patient-physician relationship. This Article 44 speaks about the censorship, the misinformation, disinformations. So people like us who tend to think that there are other ways of doing things will have to be silenced by our own governments, and many of us may lose medical license and ability to practice medicine. This is now going to the treaty. One of the things that has been introduced this time around is this idea of One Health. One Health says that the health of humans is not more important than health of animals and plants, and everything is intertwined with climate change. So essentially, under this One Health agenda, the World Health Organization would have full control over global health. So unless you're okay with all of this, including surveillance, censorship, restriction of travel, forced medical examinations, forced medical testing, forced vaccination, quarantine, loss of our own national sovereignty, loss of personal autonomy and personal sovereignty, I would say that we should ask our legislators, our politicians, our governments to exit the WHO, or at least not sign this pandemic agreement and reject the amendments to international health regulations. One of the things that's very important to understand is the pandemic treaty, or agreement as they call it, they will vote on this in May of this year in Geneva. Once it is approved by the delegates in Geneva, it will go to our own parliaments, and our parliaments will have to agree or disagree with it. Now, the amendments to international health regulation, as I mentioned before, they're already part of our international laws. We have already adopted those. So when they change these amendments, when they add new ones or reject them, we actually don't have to approve it anymore. That becomes part of it unless our governments physically say we will not comply with these amendments. Our governments have to reject the amendments. So there are two roadmaps to this global control of health. And we need to make sure that our politicians understand what's happening and not just say, you know, we trust the World Health Organization, they're going to do the best for us, so we will agree with this. We all know that the World Health Organization has failed during the COVID pandemic and continues to fail because they have failed at one of their most important jobs, and that's safety surveillance. According to their own database, there are many incidents of adverse events and deaths, and they still recommend the vaccination. So we need to make sure that our politicians understand that this is not the way that the global health and public health should go forward. Thank you very much.
Dear Senator Babette, thank you for accepting to participate to our conference. You have been recently successful in your attempt to initiate a formal Senate inquiry into the excess deaths in Australia. Could you please elaborate on the excess mortality in Australia and the circumstances that led you to request a Senate investigation?
G'day, and thank you for your question. And of course, thank you for inviting me to contribute to this wonderful event. Look, I was first elected to the Senate in 2022. I was elected on the back of the Australian government's, frankly, draconian response to the COVID pandemic. As I'm sure you all know, we experienced some of the world's harshest lockdowns and, quite frankly, the most unscientific response that anyone could have ever imagined. Now, in the Australian Senate, I am just one of a few who are willing to challenge the government's actions. I've asked repeated questions and moved 5 separate motions in the Senate chamber on the higher than expected all-cause mortality. Now, this alarming phenomenon commenced back in 2021. In 2022, Australia experienced our highest excess level of death since World War II. It's the equivalent of a fully loaded jumbo jet crashing every week without any inquiry or adequate explanation. Australia saw record high excess mortality throughout the pandemic, peaking at 11.7% above the expected baseline in 2022. This number was initially touted to be as high as 15%. But the official government department, our Australian Bureau of Statistics, revised its excess death numbers down with the adoption of new modelling in 2023. Naturally, some of the excess deaths seen in Australia and around the world have been linked to COVID, but the virus cannot account for all of the excess mortality. In fact, the inconsistent criteria for linking deaths to COVID means that the impact of the virus on excess mortality is probably overestimated. In Australia, we initially separated deaths due to COVID alone and deaths with other causal factors. During the pandemic, this reporting method was changed, and all deaths with a causal sequence of events were moved into the due to COVID category, taking the accounting of deaths due to COVID from, I think it was about 8% to approximately 80%. Despite the biased reporting, not all excess deaths are from or with COVID, in fact, far from it. An analysis of 2022 excess mortality by Australia's peak actuarial body, the Actuaries Institute, who are responsible for reviewing data, allocated only half of Australia's 20,000 excess deaths to COVID. This leaves around 10,000 excess deaths in 2022 from other causes. The factors contributing to this excess are largely unexplained. While most of the excess deaths are in older age groups, excess mortality was at least 5% in all age groups in 2022. We know COVID wasn't really a threat to our youth, our young people, so why have they died in larger numbers than expected? A strong, healthy population is essential for a strong, healthy economy. The Australian government has failed in their duty to protect its citizens, and this is evident in the fact that they opposed all 5 of my motion. Now, of course, as you all know, this issue has been mirrored globally. Now, my World First inquiry will give a voice to many individuals and professional organisations, and I hope that this committee process gives a voice to the family members of the deceased and delivers the answers that our nation and the world so desperately needs.
You have been actively advocating for accountability of pharmaceutical companies for injuries. India requested accountability for injuries related to Pfizer's vaccine, but Pfizer declined to market its vaccine there. Could you please share your thoughts with the audience of this conference about why a pharmaceutical company who advertises its product as 100% safe and effective should fear to be held accountable for vaccine-related injuries? Why it is so crucial, in your opinion, to hold Big Pharma responsible for vaccine-related injuries?
Thank you for your question, and that's a great question. Look, putting it simply, because their products are not 100% safe and they are not 100% effective. I applaud India for acting in the best interest of their citizens and their economy. I just wish that our country had done the same. The real question that we must ask is whether Big Pharma knew that their novel products may injure and may kill thousands of people around the world. Did they know? Australian evidence shows that adverse events following immunisation with the COVID-19 vaccines were reported at 23.8 times the rate per 100,000 doses of all other vaccines combined. Our health regulator, the Therapeutic Goods Administration, last reported over 139,000 adverse events and over 1,000 deaths following COVID vaccination, and many experts believe that this is substantially underreported. Australia has a COVID vaccine injury compensation scheme, but I don't think that it is fit for purpose. The scheme acknowledges only a few select conditions. Each claim is taking just under a year to be processed, and the majority of claims are unfortunately rejected. Now, my response to all of this was to introduce a bill, which is another world first, which would prohibit the granting of indemnities to manufacturers of vaccines. In simple terms, it requires a pharmaceutical company to be liable for injury or harm caused by their product rather than taxpayers paying for compensation to their victims. No more blank checks to Big Pharma. That's basically the gist of the bill. Now, our bill was referred to a Senate committee and received overwhelming public support. 97% of all submissions received supported the passage of my bill. Alarmingly, the Senate committee itself denied multiple senator requests for public hearings and recommended in their final report against the passage of my bill. The committee process revealed that in Australia, indemnity was granted by a public servant who to this day remains unknown. COVID-19 vaccine contracts in Australia remain hidden from public view due to appalling commercial in confidence provisions. The South African Pfizer contract was released following a High Court ruling. This contract is appalling and assigns all risks to the purchaser. We know that Pfizer also asked the South African government to put sovereign assets guaranteeing indemnity against the cost of any future legal cases up for grabs. Latin American countries were asked by Pfizer to put up federal bank reserves, embassy buildings, and even military bases as a guarantee against the cost of future legal cases stemming from adverse effects. Now, one needs to ask why a pharmaceutical company would request such significant collateral. We know that as early as 2006, pharmaceutical companies have been publicly demanding that manufacturers be granted protection from lawsuits associated with vaccine-related adverse events if they were going to participate in pandemic responses. This is a strong-arm tactic by Big Pharma that some would say resembles collusion. Indemnification has created an incentive for risk-taking in the pharmaceutical industry, which is not aligned with the fundamental principles of medicine. Where indemnity exists, it is human nature to take larger and larger risks. Whether it is a conscious decision or a subconscious one, the outcomes are almost always poor. Now, I urge politicians around the world to follow my lead. Legislate against the granting of indemnity to ensure that history will never, ever repeat itself.
Considering all what happened in Australia during the pandemic, considering the strict lockdowns, the vaccination mandates, and the excess mortality that Australia is experiencing, do you believe that some major mistakes have been made? And do you think it would be wise to give the WHO the authority to decide which medications and measures, such as vaccines and lockdowns, should be implemented in all nations, regardless of their healthcare systems, their economies, their location, and their cultures? Please.
I'm a senator for the state of Victoria, and my home state suffered through the world's longest lockdown. This is an experience that I and my family will never forget, and an experience that I hope is never repeated. Many mistakes have been made throughout the pandemic period. In Australia, we experienced lockdowns, border closures, vaccine mandates, and a real centralisation of government power. In my opinion, giving greater power to the WHO should be unthinkable. I believe that Australia must not only reject the proposed amendments to WHO international health regulations, we must exit the WHO entirely. Currently, proposed WHO amendments would give the World Health Organization virtually unlimited power, authority, and resources at the expense of national sovereignty and personal autonomy. My party, the United Australia Party, stood alone in educating the Australian public on the dangers of a WHO power grab prior to my election in 2022. Now, do you remember when the WHO attempted to investigate the origins of COVID? They sent their health officials to China in an embarrassing and theatrical performance for no result and no benefit. The WHO have proven themselves to be incompetent and power hungry. We can no longer blindly follow globalist authority. Changing the WHO from an advisory organization that merely makes recommendations to a governing body whose proclamations would be legally binding would be severely detrimental to member states. We must remember that failures cannot be pinned exclusively on the WHO. Our very own medicines regulator here in Australia, the Therapeutic Goods Administration, is 96% funded by Big Pharma. That's not right, and ensure doesn't promote objective decision-making. I'm one of a few senators in Australia calling for a smaller, leaner government with an aim to repay government debt. Now, with the TGA, I am willing to make one exception. The TGA should be 100% taxpayer government funded to limit conflicts of interest and promote objective decision-making. The way we approach public health must be reshaped. I urge the Italian government and governments all around the world to exit the WHO. If we exit the WHO, remove potential conflicts of interest, transparently release data, and force our key health decision makers to publicly justify their decisions, we can move towards a restoration of trust in health. But as long as we continue to blindly follow the WHO and sign bad deals with Big Pharma, public trust in health will continue to decline.
Thank you again for accepting to participate to our conference, and congratulations for your praiseworthy and courageous work.
Thank you very much for inviting me to speak at your event. I hope you all have a great day and that you can connect with like-minded people and that we can all together, all of us all across the world, make a difference to benefit our individual nations. Bye-bye.
So, dear Ms. Gunn, thank you very much for accepting to participate to our conference.
Thank you.
I'm gonna make you some questions. You have recently done a shocking documentary titled "The Mother of All Revelations" regarding the excess deaths in New Zealand. Could you please provide further details about the content of this documentary and explain to the audience of this conference why these data are indeed the mother of all revelations? Please.
Thank you. I stood in the October election because I didn't believe any other party in New Zealand was going to really expose the crimes in New Zealand by Jacinda Ardern and her successor, Christopher Hipkins. The jab rollouts were continuing. The mainstream media story was continuing. During that campaigning, a man approached me, and it was Barry Young, the whistleblower, and he begged my cameraman for, please, can I speak to Liz for half an hour? When we went to he said it's highly confidential. We found a very confidential room. It all felt very covert and top secret. And I thought maybe it's his imagining. As soon as I saw what he had, and he let me check one name of one family member because he was not exposing the names. He's always been, as a scientist, somebody who's kept the anonymity. It's purely about the data. He allowed me to check one family member's name to verify that this really was what he said. And what he said it was the data of the New Zealand Ministry of Health. Because we are a country of 5 million, in any other country, even England, and that's about the same size land-wise as New Zealand, but a far greater population, because we are a small country, only one person in this country was put in charge of building the database, designing it and building it. And he's a very clever man. And it was for the pay-per-dose system that was instituted as part of the COVID-19 rollout. In any other country, in America, even in your country, Italy, it would be scattered across the country, these databases. Here we have it centralized. Secondly, we know now, many of us know, that New Zealand is in the vanguard of the experiments that they roll up around the world. I was approached during that campaigning by another woman who said, do you realize that big pharmaceutical companies from America often experiment on New Zealanders with new drugs? And she said it's because we are an educated population, but a curious and far too trusting population. We will have quick uptake of new ideas. They often use new cars, models that are never seen anywhere else in the world. They'll roll out here and see what the uptake will be in New Zealand. So more and more Kiwis are realizing that rather than being a free and open society, we've been a heavily censored, managed, manipulated society who've been used as a kind of world petri dish. So what Barry Young, this brave man, said to me was, as soon as he started adding in the data to the system that he built, he saw a pattern of excess deaths. He loves science. He said, not the Fauci speed of science, fake science. He loves the Carl Sagan, the sacred science, the science that says there's never a settled position for science. It must always be evolving. There must always be those at the edges who are disagreeing with those in the center and pulling science into debate and open, intelligent discussion. And the dialectic will eventually reveal a new positioning for science, and therefore it is constantly moving forward. Instead, we have this dead science now that is about censorship, lack of debate, and lack of truth. He didn't want that. He was never anti-vax. He's been vaxxed. He says it's very dubious that I'll ever take one again now, knowing what I know. But here's an open-minded scientist who believed in the sacredness of the vaccine, but was curious that overseas countries were showing excess death rates, and he just ran a query. He looked at what's interesting for this country is there's a kind of sacred number, and we deal with this in the longer form interview, the mother of all revelations. An average number of deaths prior to the COVID-19 rollout per day might have been 100 or a little bit more than 100. That wouldn't have been unusual. He found a sacred number that was 120 deaths a day. And he looked back to 2011, and this is where it gets really interesting. That data showed that in 2011, there was a Christchurch earthquake, and there were 268 deaths there from memory. That was very unusual. That's an outlier event. Then he looked forward, and I think in the next year, there might have been one day with over 120 deaths. And then interestingly, as we looked at the data, I think it was 2 or 3 years, there were gaps of 2 or 3 years where New Zealand never had more than 120 deaths a day. From the period of the rollout of the COVID-19 vaccine in New Zealand, there have been above 120 deaths every single day. If you look at it on the graph, it looks like a barcode from a shopping product that you get from a supermarket. Every day now, we exceed that. And one of our outlier events was the Christchurch shooting. And we're getting a similar number to those deaths or more every day, well above 120. And no mainstream media in New Zealand is questioning this. So when I say it's the mother of all revelations, is it hubris? Is it hyperbole? No, we spent 8 weeks straight after the election, as soon as I had time, 8 weeks holed up together with statisticians. We contacted statisticians around the world. One of them said, this is a 1 in 100 billion chance of this happening, these sorts of numbers. This is so clearly due to an event that has happened in the last few years. And the only differential is the jab. So we holed up, we looked at the data. But here's Barry's line, and this is my plea to this conference and to the world. At 8 weeks, we were all ready to go out to the public because we knew the longer we left it, the more we analyzed, the more we tried to cover every position, and that's impossible, that people were being jabbed and misled and lied to in New Zealand, and that they were dying. And that has really weighed on his conscience. So we decided after 8 weeks to go out with at least preliminary results, but an appeal to the world's statisticians, mathematicians, and those who love to analyze data and say, please, take this body of world data. It is a gift for the world. And cut it and slice it and dice it in as many different ways as you can, because we must stop what this is indicating. And what it's indicating is that the excess death data from the rest of the world's countries is absolutely right. It is linked to the jabs, that this has been a genocidal murder campaign around the world. But we need the people who love statistics to take it up and do something with it. We need the whole world to come behind this, Now, I have just put out in a couple of days ago simply the ages under 40. We did a subsequent recording that day, and I didn't put that in to the main body of the piece for two reasons. There are many Kiwis who have been hypnotized by Jacinda Ardern, have been totally brainwashed, and they are slowly starting to wake up, but there's much trauma in our country, and I felt seeing the young under 40, particularly the children, that would need time to absorb the earlier piece. The second piece was that we had the permission from one of those young, a 26-year-old. He's the only case that has been acknowledged by the government to be a vaccine death. His name is Rory Nairn. It is still 3 years on. It is still traumatic for that family. They are going through endless bureaucracy, and they cannot get the private coroner's report that they sought to prove that this was a vaccine injury. They cannot get that coroner's report in this country. Somebody is suppressing that. So out of respect to Rory Nairn's family, I thought we will hold this one back and see if early in 2024 they have that report. I spoke to him the day before I put this out, spoke to Rory's father. And he said, put it out with my permission, put it out anyway, this report on the under 40 deaths, because he said, I'm just so stuck in bureaucracy and people must know the number of young who have died. You see, one of the ways they've tried to write off Barry Young's data is they've said, oh, it's just old people dying, just old people. But what we have here, if we look at, and Barry has said all the way through, prove me wrong. There are many ways. This will be a gold mine of data for scientists in years to come, this New Zealand data. But what we have is another crucial aspect to it, and that's called the clusters. A cluster is where a particular jab center on a particular day has over 5 deaths within a certain period of time. What we're looking at in the clusters in New Zealand are hundreds of clusters that relate back to a jab on the same day, same batch, often same vaccinator, although all of this data is anonymized, all of it. So even we can't see the names of the vaccinators or the jabbed people. That's all been anonymized. But it all comes down to the timing of the jab. So I'll just read some of this. This is from Invercargill, and I've mentioned this before, in the southern part of New Zealand, a small town of about 50,000 people, I think. It's one of the biggest clusters in the country. On the 11th of December 2021, at one medical centre, Queen's Park, there was the same dose, that was dose number 3, we'll call it, the same batch ID 31, all Pfizer, and one vaccinator, we think, but Barry wouldn't confirm that. Anyway, the vaccines began at 10:44 a.m. 3 minutes later, 10:47, 2 people were jabbed at the same time. There was clearly no consultation with these people who were being jabbed. There was no history taking of their health data. Therefore, it's obvious there was no informed consent by these people because they weren't being informed of anything, no advice that there could be risks. Then we have one at 10:49. At 10:53, 2 more people are jabbed. 5 minutes later, 10:58, 2 people are jabbed. 10:59, 11 o'clock, 11:01, 11:03, 11:04, 2 people are jabbed. This is just an absolute rush of needles into arms with no medical responsibility. And as Barry said, this is hard government data. The Ministry of Health in New Zealand has gone after the truth teller to hide the truth, but they have never denied the data he's put out. They can't. It's their data. It's our people's data. So we've got same batch, same dose number, same day, same hour. Now the key is the date of death. That's how you look at this data. That's the key factor when you're looking at the deaths, is the time of the vaccine. The chances of this happening statistically It's simply not possible. And Barry described it as a 6 sigma, 7 sigma, 8 sigma event, which would mean, I gather, you need to vax about 1 trillion people to get results like this. And it's a black swan event because those who were jabbed in Invercargill on the 11th of December, when we looked at the dates of death or the months of death, they were 6 months later. And that's around June 23, March, June, May, February, all around a 6-month period. If you do an analysis of this, it points to the fact that there's a link to the jab. But of course, the government is using the fact that they don't all die immediately or all die on the same day 6 months later as plausible deniability. What, as far as we in New Zealand understand, what has not happened thus far is no one has correlated it back to the date they were injected anywhere in the world. If you look at the death date, where is the data relating back to the date of injection? And so here we have a clear 2-hour period, jabbed every few minutes, no chance for proper medical care. And the criticality in the data is that it's the same center and the same batch. So when we sent that out to some of the statisticians who were helping us in the 8 weeks before we went public, one of them said a cluster of 10 by one vaccinator, one after the other, that for these people to die by chance, let's say, not from a specific cause, that vaccinator would have to vaccinate 24 hours a day for 38 years. 24 hours a day for 38 years. These numbers are impossible. And if you take the New Zealand data, I'm just feeding you tiny bits of it. Even Barry, when we did that, mother of all revelations, said, you know, Liz, we're just scratching the surface. And my prayer to the universe is that hundreds of epidemiologists and statisticians from around the world will take this data, anonymized as it is, take it from Steve Kirsch. Even though in New Zealand they've silenced it, Steve has the data. Take it and pull it apart and tell the world the truth. That's why we called it the mother of all revelations. And that's only the surface layer that I'm telling you.
I see. Yeah, they can hide, for example, some adverse reactions, but they cannot hide the ultimate adverse reaction that is death. That is a binary data.
Neither can they hide the link back to these clusters. That's a key.
Yes.
The fact that they were all jabbed within a 2-hour period, and then within 6 months, 51 people are dead. If you picture 51 people, that's a whole huge busload of people. A huge busload of people all collapsing within 6 months. The statistical odds of that are impossible. And I know statisticians don't use the word impossible. I'm not a statistician. I'm a reporter. And to me, that is just the impossible odds. And that must be an arrow into the gold mine of data that is in this New Zealand Ministry of Health data. And the fact they've never denied it. And what have they done? They've gone after the messenger with a threat of 7 years in prison for telling the truth. It's disgraceful in this country.
Absolutely. The time is running out, so I have to make the second question. So, dear Ms. Gunn, could you please share with the audience of this conference how the people of New Zealand dealt with the government's zero COVID, go hard, go early policies during the pandemic, and how do they feel now that their country is experiencing this excess mortality despite all these sacrifices?
I will be very brief with this answer, but it's a brutal answer. People loathe Jacinda Ardern. Many people feel she completely beguiled and pretended to be something absolutely other than she was, that underneath that false smile, there is a ruthless, cold woman who gives not one damn about the maiming of many New Zealanders, and now the obvious deaths. I've had people approach me saying she's bought, for example, a $13 million farm from someone who came up to me in Hawke's Bay. Where is a politician getting that kind of money? And I spoke to a politician in England, Andrew Bridgen, who said, Richie Sunak, those English politicians also are dispensing a lot of money. So you get the implication I'm saying there. But New Zealanders believed in her. It was as if she cast a spell over this country for a while. I mean, there were those of us who were outliers who didn't, but many, many did. She did conferences every day. And at one point she said, we, the government, are the single source of truth, in a way that was so George Orwell, that it did wake up a number of people, unfortunately not quite enough. And our mainstream media, of whom I used to be a part 20 years ago, to my shame, is still putting out ridiculous articles when more and more Kiwis are waking up simply because so many members of their families now are dying or being hurt. This article in The Listener, it's April 24th, Heart, Brain and Lungs, the deep effects of the virus that just won't go away. Nikki Pellegrino. I don't know if you can see that. You probably can't. It might be blurry. But yes, that's somebody I used to work with in mainstream media, and they're still trying to say that all of these jab injuries are caused by long COVID, when many Kiwis are saying, no, not anymore. So yes, at the time, it was a propaganda. MK Ultra, many Kiwis are saying from America, it was a propaganda level across this poor little small country of trusting, gentle Kiwis that was unprecedented. And she sucked many people in through fear and lies. But now they see through it. That would be my answer. And many Kiwis want answers, want accountability. There are those who want deep punishments for these lies.
Thank you. And now my last question that is strictly related with the topic of this conference. So, dear Ms. Gunn, in light of everything you said up to now, and in light of everything that occurred in New Zealand during the pandemic, including the vaccination mandates, including the zero COVID, the go hard, go early strategies, and in light of the excess mortality that your country is currently experiencing, do you think that some significant mistakes have been done? And do you also think that it would be wise to give to the WHO the authority to decide which medications and measures, including vaccines and lockdowns, should be implemented in all countries, regardless their healthcare systems, their economies, their location, and their culture? Please.
This again can be brief. When I alluded at the beginning to standing politically, one of the platforms I stood was this: New Zealand must withdraw immediately. If we get in, we will withdraw immediately from the World Health Organization, from the World Economic Forum. No politician from our country should ever go to a World Economic Forum meeting in Davos. And if they do, they should be treated as a traitor to New Zealand when they return to our shores. And thirdly, we must withdraw from the United Nations. All three organizations, the WHO, the WEF, and the UN, are irreparably corrupt. There is no repair. It's like in America, the CDC is beyond repair and must be replaced now by new organizations that are of the people and by the people and deeply accountable to the people. Now, I would add in there, we must have across the world the growth of small local media organizations, turn our backs on BlackRock and Vanguard, who own most of our world's media, and every politician must be held to account every single night on our television and cross-examined and told by the people to listen to what the people want and to listen to the people's concerns. So the short answer is absolutely not. As soon as Trump withdrew America from the World Health Organization years ago, I looked up who is the biggest funder, and it turns out to be the Gates Foundation. You know, to be facetious, Gates couldn't even get viruses out of his computers. He certainly has no knowledge of medicine and he has no knowledge of medical ethics, but he has, it seems, much knowledge of bullying, of manipulating, of conniving, and of lying. A man like that cannot be in charge of the world's health. And this pandemic treaty, we know also, many of us call it the planned demic, because it is tantamount to the apocryphal story of the emperor's new clothes. The emperor was always naked. People just got scared to be brave enough to say, oh, he is naked, because they manipulated. They said, if you can't see the emperor's clothes, then you're not intelligent. It took a child to say, but he's naked. We must all be those children, simple, honorable, and honest. I'm just going to read a couple of comments on the latest post with Barry. It's very brief. This is from one person. These pharmacists, doctors, and nurses, it's frightening when you wake up to how little they value human lives. I have zero trust in any medical personnel still working at this point. So it's the same for the World Health Organization. It has not stood up when it's seen the excess deaths, the maiming, the injury to people around the world. It is clearly corrupt. And I think I want to finish with this from a small town. After the jab rollout, I saw a woman collapse as she walked out of the pharmacy in Mochueca, having taken the jab. She died of heart failure on the way to the hospital. A week later, an 18-year-old was found dead on the beach after receiving the jab. Rugby players here in New Zealand are having heart failure during games. Sports people around the world are dropping like flies. The death certificates read COVID-related. That label, COVID-related death, is being used around the world to sweep under the carpet millions upon millions genocided. That is the crime that needs to be sheeted home to the Gates Foundation and the World Health Organization. They must be given zero power over our lives.
Thank you very much, Ms. Gunn. Thank you for participating to our conference. And most of all, thank you for your courage and for your prize-worthy work.
I salute everybody in this conference, and I know only too well the deep price we all have to pay for standing up. It has been exhausting, and I am so grateful you're doing this conference. Thank you.
Thank you.
Allora, scusate.
Sorry to interrupt you. As Mr. Borgonovo is out, I would like to introduce you, Mr. Fukushima. But before, I would like to tell you something that you don't know. From the interviewer, who is not an unusual interviewer, but he is Dr. Kreti. He is a structural biology member of the our committee, and also member of the foundation, of which I'm president and founder. And he was the first researcher worldwide to describe the structural mechanism of autoimmunity that was induced by genetic vaccines against COVID. So he really changed the need to carry out accurate studies of distribution. As his expertise that we can see in the video with these speakers, I would like him to come here at the end to answer questions, because there are some questions regarding his research, regarding also Infovax and Business Bay, and he can answer in an exhaustive way. And regarding Dr. Fukushima, I don't want to add anything else because you can see his extraordinary curriculum.
Professor Fukushima,
Yes,
thank you for accepting to participate to our conference.
welcome.
I'm going to ask you some questions that are highly relevant to the topic of this conference. Dear Professor Fukushima,
Yes.
you have recently published an extremely important paper regarding the increased age-adjusted cancer mortality in Japan that Japan experienced during 2021 and 2022. Could you please provide further details about the findings of this paper? In particular, what was the impact of the widespread and indiscriminate mRNA vaccine administration on cancer mortality in Japan during the last years? And which cancer types shown a significant increase? Please.
はじめにこのような機会を与えてくださいまして大変光栄であり、感謝しています。ご承知のように、日本も欧米諸国と同様にですね、ファイザーのワクチン、それからモデルナのワクチンを国民の大半に接種しました。政府の指導によりまして。で、日本の場合はご質問にありましたように、ほとんど無差別の通りです。で、最初は医療関係者に投与されて、続いて、高齢者に投与された。2021年からですね。それで、国民の80% は2回接種受けて、それで 60% 以上、70% ぐらいが、3回接種受けています。で、それからさらに4回、5回、6回、7回というふうに、ワクチンは続けられましたが、だんだん回数を経るごとに、接種者は減りました。いずれにしても、3回接種以上が 70% に達してますので、実際、このワクチンによる被害がですね、どれぐらい出るかというと、死亡者は政府に届けられている数だけで、0.002% ですね。数としては2130数名ということで、それはおそらく氷山の一角ですね。で、実際日本人の、人口で割るとですね、0.002%、10万人に2人が亡くなったというのが事実です。で、これは今申し上げたように、アンダーエスティメイト、政府、厚労省に届けられた数ですから。それから、ワクチンを打った後、健康被害ということで、まだ医師にかからないといけない、相当、長い期間ですね、やっぱり闘病をしないといけないという人が、被害届を政府に出しているんですが、それが3万数千人を超えてます。これもやはり、一部だというふうに思います。この届けを出すというのがなかなか面倒なことなので、医師の協力もいりますし、そんなような状況の中で、巷ではですね、やはりターボガンと言われるタイプ、今までに医師が経験してないような非常にスピードが速い、見つかった時にはもう4期であると、進行したがんであるというケースがちらほら診察に訪れることになって、それで今までとそういうふうに違うということを医師同士がやはり情報を共有し合うようになっていました。ですからそれが去年、一昨年ぐらいからですね、だんだんそういうことになってきて、でやはりがんに関連して、この異常なことが起こっているんじゃないかというのは、医師は現場から感じ取っていました。で、私が2022年ですね、2022年だったよね。2022年に徳島でレクチャーをしたときにですね、このファーストオーサーである義母先生、ドクター三木義母が超過死亡のことを問題にしておりまして、それで私が超過死亡について検討するのであれば、やはりそれは精密な解析をしないと、見かけだけで議論すると、それは 真実を見てない可能性があるからということで、提案しました。提案というのは3つです。1つは、エイジアジャスティッドモータリティ、つまり年齢を調整しないといけない。日本人の人口はどんどん高齢化してますから、毎年違ってくるので、そうするとがんの死亡率も違いますから、年齢で調整しないといけないということが1点と、それからがんの死因別にですね、全体の死亡を見るっていうのも、それも一つの方法かもしれないけども、死因別に、疾患別にですね、カテゴライズして解析をするべきである。それでがんに焦点を絞ります。でもう一つは、がんについてもそれぞれのがんのタイプでですね、だんだん年々、減っているがん、典型的には胃がんとか大腸がんというのは減ってきているわけです。それから乳がんとか膵臓がんが増えているんですね。このトレンドを見ながら、トレンドに対して実際に、予測よりも超過しているのかどうかをきちっと、統計的にですね、これは回帰分析とレグレッション回帰分析っていう手法で統計的にそういう手法がありますので、そこからどれぐらい逸脱して、るか、それが優位なのかどうかと、そういう優位さ検定をした上で、やはり議論しないといけない。その3つが重要である。エイジアジャスティッド、それからコーズオブデスということですね。それから次はトレンドですね。過去10年、少なくとも10年ぐらいの死亡率の推移を見て、そのトレンドから見て、どれぐらい逸脱しているか、過剰なのか過小なのか、エクセスなのかデフィシットになっているのか、それを見ないと、そのモータリティと言ってもですね、やっぱり、正確でないということです。それで今回、その義母先生が非常に努力しまして、で日本はですね、幸い、がんについては登録事業というのが行われてまして、法律に基づいて、統計が非常に精度が高いということですね。でそういうことからこのがんにおけるエイジアジャスティッドのモータリティレートを調べたっていうのは、これは諸外国と比べて、統計的な精度からまたこれをサイエンティフィックに議論する、材料としては適切であろうというふうに確信しています。でやはりここで起きたことは、それだけ大勢の人にですね、ワクチンを接種して、実際に、つまりワクチンを接種した人の方が、感染した人よりも、これははるかに多いわけです。感染した人は大体、数千万人ですから、ワクチンを接種した人はほぼ1億人近くとなるので、そうするとですね、やはりこの原因としてワクチンを無視することはできないと思います。だから今回、しかもこの解析した結果からはですね、驚くべきことに、特定のがん種がですね、ワクチン接種と関連して、超過死亡が起きているように見えるということです。まずは乳がんとか卵巣がんとか膵臓がんとか、それから、頭頸部のですね、上咽頭、口腔がんということですね。これらがもう一つは男性の前立腺がん、こういうがんが特異的に、超過死亡になっている。これは人為的なというのかな、つまりパンデミックによって検診というのは早期に受診できなかった、あるいは治療を受ける機会をロスしたとかいうことでは全然説明できない現象だと思います。ですから、ここでしかもワクチン3回目以降に超過死亡が起きているという、こういう論文に最初の図表に示しましたが、2020年にパンデミックが起きて、その時点で超過死亡があるわけではないので、だから、受診が控えられた。つまり、医者に見てもらおうと思っても、あるいは手術受けようと思っても受け入れなかったために、超過死亡が起きたという説明は一切できないということになりますね。それで、実際には1回目、2回目のワクチンよりもさらに遅れて3回目、4回目以降に 超過死亡が起きているということをデータは示している。だから超過死亡が実際に優位になったのは2022年ですね、全体のトレンドから見て。トレンドで見ますと、がんの死亡は年々減ってきてるんです。確実に減ってきてて、それで2021年から22年にそれがフラットになってしまったと。だからがん撲滅っていうのは日本国民の悲願でありまして、法律まで作って、キャンサーコントロールアクトっていうのを作ってみんな努力してきたわけですよ。ところが、2022年にはっきりしたことはもうそこから、どんどん減ってきた傾向が水の泡になったということですね。これで見てこの図にはっきりしているように、がんの超過死亡っていうのは、特に、ワクチン3回目、4回目の以降に顕著になっていると。だからこのデータからやはり我々はこのがんの死亡の超過に関しては、ワクチンというのを疑わざるを得ない。これはこのワクチンによるスパイクタンパクの放出、さらに、他のいろいろな原因も当然考えられる。IgG4 抗体ができて、がんの、なんていうのかな、がんに対する免疫を邪魔しているとかですね。だから他にもいろいろな理由が考えられます。特に一つは、この先ほど申し上げたように白血病とか乳がんとか卵巣がんとか前立腺がんとかこういうがんはエストロゲンのリセプターですね。エストロゲンリセプターをこのスパイクタンパクが刺激して、これが分かってますので、そういう事実が実験的に分かっている。だからスパイクタンパクがエストロゲンリセプターを刺激することによって、そのエストロゲンリセプター刺激されると増殖するタイプのがんがまさにここで明らかになった超過死亡が起きているがんであるということです。そのことを論文できちっと指摘しております。で、これは予想されたことでした、基本的には。だけど、現実になったということで、実は私、2021年にワクチンの接種が始まった10月にですね、このワクチンを続けることによって将来おそらく、自己免疫疾患、神経変性疾患、さらにはがん、感染症について問題が起こってくるだろうということで、前例登録を提案してました、論文の中でね。だけど、実際にここまでになると、次に我々はやはりもっと実態をですね、正確に把握していく必要があるというふうに考えています。
Thank you. Now, my next question. Dear Professor Fukushima, among all your qualifications, you are an emeritus professor of the Kyoto University, in which you have been professor of pharmacoepidemiology and director of the outpatient oncology unit. So, considering your huge experience in this field, how do you judge the decision to vaccinate the vast majority of your country's population with an experimental genetic vaccine without first conducting comprehensive pharmacokinetic, pharmacodynamic, and genotoxicity studies? Please.
OK、ご質問ありがとうございます。私は日本で最も年長なメディカルオンコロジストです。で、メディカルオンコロジーを日本語に訳すと腫瘍内科っていうんですが、これは私が最初にそういう名称で新たなディシプリンとして普及させ、定着させることを、キャンペーンをやってきました。で、私は日本で初めて、京都大学に、がんのアウトペイシャントクリニックを開設したわけですし、その前に京都大学には2020年に愛知県がんセンター、前職は、愛知キャンサーセンターホスピタルの、セクションヘッドをしておりました、メディカルオンコロジー。これによって、これが本来の私の仕事でありまして、日本で世界最初に神経の再生を実用化して、角膜の再生、鼓膜の再生、それから血管の再生、骨の再生、軟骨の再生と次々手掛けてきました。それが私の実は本業であります。トランスレーショナルリサーチ、メディカルイノベーションと言っていいんですが、ただし、今回こういうワクチンを打つということが始まって、私は正直仰天しました。 今でも覚えてますのは、その最初にこれが有効であるという論文、ニューイングランド・ジャーナル・オブ・メディスンの論文だったと思いますが、やはり死亡例が、ワクチン接種群で不可解な死亡が4例あったと思いますが、それについての詳細なデータがなかったです。やはりこういう薬を、このファーマコエピデモロジーが専門ですから、先ほどの有効性がはっきりしてない薬を市場に出してブロックバスター化してたっていう過去の歴史があるし、それからいろいろな薬害が他にあるんですね。そういう薬害は常にインマチュアなデータで承認しているということがあるわけです。それ有効性についてもインマチュアだし、それからサイドエフェクト、アドバースドラッグリアクションについても十分な解析がなされている。そういうことで過去に重大な薬害を日本は抗がん剤の分野でも起こしているんです。で、そのレッスンがあるのにかかわらず、今回に限って、見切り発車的にですね、ワクチンを大規模に接種したということは、これは日本はその過去の薬害の歴史、それを防ぐために制度も作っている。前例調査です。新しい作用機構の薬はとにかく世に出した時には承認して市場に出した時にはもう前例を調査するというそういう制度を持ってるわけです。だけどそういう過去の薬害に学んで作った日本独自の制度も一切適用しなかったというのは私は政府そしてこのワクチンの接種を進めたアドバイザーですね政府に重大な責任があるというふうに思っています。このワクチンによる被害は十分予見できたし、そして、このワクチン接種が始まってから半年も経たないうちに、厚労省、政府には死亡例が次々と報告されたわけですよ。その時点で数百人になった時点でもう死亡率が10万人に1人から2人あるということは確定してました。ですからその時点でストップして前例調査をかけてこのワクチンの危険性について政府はきちっとレビューした上でやめるならやめるあるいは続けるならどういう場合にはこれは有効かというデータをですね取れるように舵を切らないといけなかったと思います。このワクチンは前例に国家としてですねやるべきものでは毛頭なかったしこれは重大なですね結果を生んでます。政府に報告されている、現在までに報告されているのが2130数名です。この人たちはワクチン接種後、1日から2日、3日、4日、5日、6日、7日、1週間以内に70%以上が死んでるんです。元気だった人がですよ。で、ワクチン打つ人は基本的にそんなね、リスクのある人には打たないわけですから、それは心臓に問題があるとか、あるいはそういうコロナにかかった場合にリスクがあるということから、いろんな潜在的に疾患を持っている方も受けてますが、例えば私がレビューした症例はですね、解剖もされてるんですけれども、ワクチンによって心臓が溶けた、平たく言えば、心筋の黄門筋誘拐によって、亡くなった28歳の男性で、今まで医者にかかったことがない人が、ファイザーの2回目のワクチンを打った5日後に、朝、奥さんが起こしに行ったら死んでたっていう。で、当然のことながら警察を呼んで、それで、大学病院に運んで、そこで解剖すると。解剖した先生と話したら、解剖した先生は、心臓を取り出そうと思ったら、ふにゃふにゃで仰天したって言ってる。心臓が溶けて、ふにゃふにゃになって。こんなような症例もあるということは、もうその一例をもってしてもですね、いかにこのワクチンが危険かということは分かるわけです。だから私から見ればね、健康な人が今まで病気がなかった人、いつ死ぬか分かんない人じゃなくて、健康で何も問題なかった人がワクチンを打って死んだというのは重大ですよ。これはね、殺人ですよ、結局は。ね、私はそういうふうにはっきり言いたいですよ。これはやっぱり重大な話だと思います。で、そのことについてマスコミもきちっと報道はしないしですね、新聞も取り上げない。これはやっぱり歪んでます。私は今は医学の危機、医療の危機、 のみならず科学の重大な危機であり、民主主義の危機であるというふうに私は非常に危機感を募らせています。科学者として、医者としてですね、このワクチンは断じて国家レベルでやるべきものではなかったし、本来はこのワクチンは承認されて、なんていうかな、市場に出るものではなかったというふうに私は断定します、現時点では。WHO がこれ全国のですね、医療事情も違うし、習慣も違うし、制度も違う国について一律にね、ワクチン接種を、WHO が指揮を取ってやるというのは根本的に間違ってます、これは。医療はね、人々の生活習慣、そして医療制度、それからその国の法律制度、そしてカルチャーによって違うわけですよ。だから一律にね、これを地球規模でワクチンを進めるというのは、これは遺伝子ワクチンであろうがなかろうが、それはちょっとおかしいと思います。で、天然痘のワクチンで成功したのがね、コロナのワクチンで同じように成功するとは限らないし、ましてインフルエンザでも全然成功なんかしてないわけですし、ですけども、ワクチンについて反対するとね、ガリレオの異端審問じゃあるまいしね、まるでね、異教徒扱いになるわけですよ。これはね、狂ってます。だからこういう事実、今、全世界、WHO は全世界のそのワクチン接種のアウトカムについて、そしてその被害について、ね、ダメージについて、デフィシットについて、WHO が責任持ってね、調査して報告書を出すべきだ。これは WHO に私は強硬に要求したいと思いますよ。WHO はそれをせずに、しかも遺伝子ワクチンなんて全くのクソですよ。全くのクソだと。遺伝子を人の中に導入するって遺伝子治療でしょうね。そんなものをワクチンにしてどうするのっていうことですよね。これメッセンジャー RNA を中にナノパーティクルに封埋して投与したらね、なんていうのかな、オフターゲットエフェクトばっか出るわけですよ。で、事実、卵巣をはじめね、脳にも、それから肝臓にも、脾臓にも、骨髄にも、一番問題は骨髄に行くということ、それから卵巣とかそういうリプロダクティブオーガンに行くということね。でもうありとあらゆる臓器にそれが行き渡る。しかもそれがですね、1年以上経ってもね、ブツブツできた皮疹の中にスパイクタンパクが検出されるっていうのは、これスパイクタンパク作ってるに決まってますよ、そんなものは。ね、そのスパイクタンパクがそこのところで1年前のが残っててね、それで染色されるっていうことはない。これ、新たに出した日本の高知大学のプロフェッサー佐野の論文ですけどね、こういうことも分かってきてるわけですよ。そしてこういう論文もきちっと精査した上で、WHO はとにかくワクチンを推進したんだから、この始末は WHO がつけるべきだっていうのが私の意見です。ふざけんなということですよ、これね。科学の乱用、悪用、Evil Practice of Science と断定していい。ね、図らずもこれによってですね、私たちは、あらゆる疾患をパンドラの箱を開けたように、我々はあらゆる疾患に遭遇してるわけですよ。ね。もう自己免疫疾患、神経変性疾患、がん、それから感染。こういうの全部に対して、それがね、しかも、こんなことがあってはならない。もう一度、もう正面からこのサイエンスでサイエンスの光を当てないといけないから、 WHO はこのワクチンの被害によって何人亡くなったか、何人死んだか、各国政府からきちっと調査を指示して、そのデータを全部集めて、そしてアウトカムを評価する。私はそういうふうに思います。
Dear Professor Fukushima, thank you for this interview, but most of all, thank you for your courageous commitment in defense of human health and scientific truth. Fukushima Sensei, ありがとうございました。
こちらこそありがとうございます。私、心底、私の本音で思っていることをお話しさせていただきました。
Invito Panaghis a venire sul palco.
Abbiamo purtroppo tempo solo per una, massimo 2 domande, ok? Perché poi andiamo a pranzo. 2 domande, quelli che hanno alzato... poi comunque avremo la sessione finale, cioè il pomeridiana, dopo ci sarà uno spazio di dibattito un po' più lungo e si potrà anche tornare. Inviterei su questi temi, inviterei chi deve fare domande a farle sull'intervento di Fukushima piuttosto che di Babette, piuttosto che di Gann, e riservare il ritorno sui precedenti temi alla sessione finale. Vi ringrazio, dopodiché andiamo a pranzo. Chi ha ricevuto il voucher ci seguirà dove è già programmato. Chi invece non l'ha ricevuto, non abbiamo potuto provvedere a tutto, in un'ora, perché riprendiamo con un parlamentare importante che viene alle 2 e poi prosegue come da programma la sessione pomeridiana. Prego.
Grazie, professore. Abbiamo ascoltato...
We listened to 2 important witnesses, and it showed how, not only in Italy, but also worldwide, anomalous things happened. And we need to clarify them. In order to do that, we need to convince the governments, the political power, who is sensitive. In Italy, as worldwide, there are many movements, groups of physicians. I am Vincenzo Simonetti, I'm a physician, and I'm a member of the Italian Medicines Agency. In Italy and in the world, there are many movements and groups of physicians who still continue to study what we already studied, and they saw the contrast with what we were imposed without any scientific evidence. But if all these groups can't work together and be aligned on a common objective, which is being aware and push public opinion and the so-called the political power to be responsible in order to clarify things, we're gonna waste time. Thank you. Are there any questions for Dr. Kindley? Please. Thank you. I'm Stephen Mayfield. I'm a researcher. I would like to ask you, Dr. Lindley, how was exactly the WHO influence? Is there an evidence on how the WHO influence on each country worldwide in protocols and in procedures of data analysis after the vaccination campaign regarding side effects and COVID? Is there a traceability of the flux of information which led to a broad application of similar protocols in all countries? And is there a World WHO influence? Is there an upstream influence? How was this pandemic, this influence on the pandemic regarding the scientific aspect? Is there an evidence of this influence? Thank you.
So far, the World Health Organization, they try to, their narratives coming about how the virus was spread and what happened, they were not forthcoming in all of their data. And then as soon as the early treatment physicians were starting to use medications, you would get the narrative from WHO saying that it should not be used. It was interesting, actually, what they did in India, when there was a outbreak in India, they recommended to use the ivermectin, but then the rest of the world was not allowed to use the ivermectin. I think one of the biggest places where they failed was their own VG data. They were not, despite the fact that they have very many adverse events reported and deaths reported, they still recommend the vaccines, and they were still recommending masks until recently. So many government, countries, and our medical agencies do look up to the World Health Organization for recommendations. The important thing to know is that with the pandemic treaty and the amendments to international health regulation, as the Australian senator also said, these used to be recommendations that countries could take on, but now they will not be. Those will be things that they will tell us we need to do. So when it comes to treatments, there will be a list of medications that will be approved, and then if you go in the United States, you can actually, and I'm sure Italy is the same, you can use medications that are not indicated for something, but as long as you have a relationship with your patient and explain the risks and benefits and explain why you are using something, you are allowed to use that. With these new documents from the World Health Organization, none of those type of treatments are going to be allowed. We're only going to be allowed to use the medications that they want us to use. And if we don't, they do have different mechanisms where the physicians will be discouraged, in many instances lose their licenses, like it happened for many doctors in the United States. They had to defend their medical license when they started using ivermectin and hydroxychloroquine and some other medications that were part of the early protocol.
Grazie.
Thank you. I say to respect our roadmap at at 2:05, we come back here. And those who would like to ask questions to Dr. Lindley, you can keep them after the lunch break. Be punctual, please. Be on time. Thank you.
So let's start again. There's the Senator Borghi. I want to leave him the floor, and then we will continue with the program. He should have speak at the end, but he's going to speak now. Thank you.
Where can I be? Over there?
Okay, if you don't mind, I will make my speech in English. So it's something that goes, I hope, in the direction of making our international guests, more comfortable, because you know, the headphone is always a pain. And then I guess that my Italian colleague that follow what I do and what I say has got already an idea of what I'm doing. So it's better to have an international approach, I would say. Thank you to Dr. Donzelli to having organized this meeting, and it's always too little. It's always too little because one of the things that I was able to see when I began to making my second life in politics, and my first life I was in international banking, so it's something that was pretty new for me when I arrived first in this beautiful Montecitorio Palace that is here on the opposite side of the road. And the one thing that struck me was that not important things were debated for months. Really important things were kept in absolute secret. Every time that there is an international treaty, something that probably will bind countries for generations to come, not a single debate was held in the parliament. And this is something that drove me mad. I made, probably the people who know me, I made a battle against the European Stability Mechanism, that is the MES or ESM for people who knows, that has got some similarities about what at the moment they are trying to do on the WHO. Every time the pattern is the same. It's an international treaty that takes away the power from parliament and so eventually to the scrutiny of the people, to give to a body that has got no accountability whatsoever. There is a couple of articles in the European Stability Mechanism that was a treaty that they want us to sign. That was the same of any kind of international organization that says the director, the managers, and so on are not bound to any jurisdiction. That is something that if you tell to the people in the street, they say, well, I've heard about immunity, but usually an immunity is someone that eventually is scrutinized by the whole body, or that is the representative of the people, or by a judge that can tell if you are eligible for immunity or not. Instead, you start with something that you are not subject to any jurisdiction. It's very convenient to do so. You take away the power from there, and then you put to someone that is not accountable. So that's why we have to be very concerned every time that there is this kind of international treaty linked with the international organization. Because more often than not, is a crucial attack to the democracy. And it's not being the left, the right, the center, or whatsoever. Democracy is the people. So our politician, of course, very easy to say bad things about a politician, but eventually we have at least one characteristic. We cannot be voted out. When there are elections, you decide, and if ever my party takes 0, I go back happily, I'll say, to my family. Instead, who is that one that can send away a manager of the WHO or something like this? No one. Not you, at least. So, when I was first told about this pandemic treaty, I started being concerned. But there is one thing that I want to be sure that everyone is aware. Because I'm here not to tell you that we are right. Because if not, I mean, we are right, it's a danger of, for anyone. It's like patting each other's shoulder. And it's a comfort, but it's not probably useful to our common goal. Our common goal is to stop it, okay? I think that everyone here in this room is agreed that we must stop any kind of pandemic treaty or whatsoever. Still, we have to find what is the best way to stop it. My opinion is that the first step is to acknowledge that there is an asymmetry between what we can do and what they can do. For them, it's very easy to put what we try to say as a mockery. To tell the newspaper that here are crazy people, that believe that the earth is flat, that, I don't know, that thinks that everyone is become taken by aliens or something like this. So it's very easy for them to exaggerate and to laugh at us. We don't have this advantage. We have to be very sharp in what we present. The data that we are putting forward and the reason, the political reason of why we can be against of someone should be bulletproof. So that's why sometimes I see that people are exaggerating things, and it's not helpful. It's not helpful to say that the WHO wants to rule the world. Not helpful, because it's not like this. It's not helpful to say that the WHO, if we sign this treaty, then the day after we'll be locked in our home, whipped by some people. It's not like this. There was not, for example, there was a big alarm about what could happen if, and I do remember 2 years ago, if 2 years ago we don't say no to the pandemic treaty, then there was the 22nd of November. No, there was technicalities that was important to know, and I see Madame Tussa in the first row, and that was very helpful in understanding and untangling what was the reason regarding this, what was going on. But we have to be very detailed what is going on, what is at risk, and what is not. Because if not, we risk the cry wolf effect. But now we are there, because all the false alarms that has been in the past, now it's over, because now, with the next May, it's going to be the decisive assembly of the WHO, and either is in or out. So that's the moment where we have to be ready and to be prepared and to inform our government and to be ready to say no. For example, what is the problem, the main problem? Well, it's easy. Sovereignty is one. Every time that you give away any kind of your sovereignty, is not an addition. It's less power from you. So if you decide to give more power to the WHO, whatever it is, even for marginal things that at the moment seems to be marginal, but you see that when there are the emergency that start to come out, and moreover, if it's them that they got the power to declare this emergency in the future, then also this marginal thing become dangerous. But the problem is that even small things is something that you are not going to decide, and they are going to do it for you. And it's not something that you want. because your power as a people is to have even the power to make wrong decision, but it's my power. I don't want to make a wrong decision done by someone else, and I have to endure the consequence that sometimes can become a disaster, as we have seen in the last pandemic, where they wanted to vaccinate children or whatsoever without any kind of proof. And if you don't do, you are not allowed to go to school, you are not allowed to go to work or something like this. This is madness. This is not a red flag. This is a full set of red flags that say what is possible to do if ever you are not able to control the process. The former health minister has been set out from the government. Now we have here in Italy a government that full of problems. We are not saying that we are the best government possible in the world of the history or something like this. There is still a lot to do, but when we presented to the election with some discussion inside, because no one is very difficult to get 51% agreeing with something, but there was 2 lines that say no more restriction of individual freedom. And that's what we did. The second after this government took power, for example, we canceled the daily bulletin of the death. You know, it can seem to be a small thing, but it was the daily terror that was instilled by the people that makes possible to do some decision that was clearly against any kind of constitutional right. Because if people are scared to death, then they are able to do horrible things. They are even able to eat themselves, as it happened in some situation in the past when there was people stranded in Long Island or something like this. If you are scared to die, then you are able to accept everything. But we have to stop this fear-mongering and so on, and that's what we did. It's a small thing, but we are trying to do. So at the moment, I tell you what we are planning to do. We are planning to say no to this treaty, but the problem is, and that's why I need these kind of events, that we have to be aware that our ministry are still full of the people of the past. So that's why sometimes there are poison pills that arrive in the middle of the legislation. You probably have seen the infamous Article 43 of the new recovery plan law that had inside the financing of the Green Pass WHO platform. Well, of course, this was not from me, this was not from our president of the government, it was not from my leader. That came from probably someone in the ministry that was the same, that was backing the old Speranza Minister of Health, that write the article in that way. But so it's very helpful to have the warning coming from anyone. What is this? Because we are able to cancel and to amend it. Now there is no reference whatsoever. Of course, there are still a reference to digital health certificate or something like this. But this is, I would be glad to come back time. And to see that anything is then done on paper and so on. We have to be realistic. It's impossible to come so back in this side, but it's possible at least to try to defend ourselves. So not to link any kind of our personal data to anything of WHO, because every time that they tell you that your data are in the cloud, it's absolutely stupid. The cloud is someone else's computer. So if we give our health data to someone else's computer that is maybe in the WHO, then we are dead, because they can decide that maybe that if someone has got some genetic problem, then is not allowed to work, is not allowed to step away from his home. No, much better of not. So we will, what is the next step? We will work with the privacy authority in order to be 100% sure that our data are shielded, and eventually, if ever someone wanted to personally take his data out, could have the option to do it. But not on the international basis. The only thing that we are doing is that if ever someone in the future wanted to travel to a country that require any kind of document to enter, be able to produce it. But it's only voluntary. It's nothing that is going to be imposed to anyone. Still, this fact that in the minister, in the delegation, and so on, are still all the kind of manager and personnel, it's our biggest concern. Because if I knew that every people involved in the subject is someone that is of my personal trust, okay. It's not the case, but I keep daily talking with our partners in government of Brothers of Italy. That is the biggest part of the coalition, so they are necessary to any kind of decision. And at the moment, I didn't find any kind of disagreement. So this is probably the good news. So between us and between Brothers of Italy, we are absolutely aligned regarding this. One person that is helping us a lot, I don't know that there has been some misunderstanding regarding the room and something like this, and I'm sad, but Lucio Malan from Brothers of Italy is talking with me every day, let's say, in order to be aligned to defend our people from this risk. So this is probably a good news. I mean, the political will, it's there to say no. We have to be ready that everyone execute in the right way. So that's why we are every day insisting to inform people and to raise the attention, because what they don't like is the noise. They don't like to have the argument set as a not important thing. So I'm glad to see that in other countries there are this kind of awareness that has been raised. I'm glad that we have seen a question like the one done by our friend there of European Parliament that is able to become viral. Because this is going to raise the awareness of someone that maybe is concerned about other things that are important. I mean, there are wars at the moment in the world. I've been in Washington this Monday and Tuesday. There was the World Bank, another thing that we can talk about later, and the IMF. There are the World Bank and IMF meeting, but I've spoken with many Republican senators and so on, and of course they've got the election coming, and everyone is concerned about this possible change of power in the US, and you know what it means for the whole world as a whole. So there are many sources of noise and of concern for the world. But we cannot tolerate that these things, due to these important things that are happening in all the world, is left behind as something that happens in the shade. We have to spend every day to put full light in this situation and to be able to retain the most power that we can to the will of the democratic parliaments, because it's the only way to be able to have the opportunity to save democracy. Because if not, when democracy is gone, it's too late. It's too late. Then there is someone that will say, no, sadly, now it's me that I've got the power and you signed it. This is the moment that I don't want it to see. So I wanted to keep the power for the people, even when I will not be anymore as here in the Senate, and hope that probably is soon, because start getting a little bit tired, I would say. But as a citizens, I want to have the power to say to my representative that they are accountable on what is happening on my freedom, on my health, on my body. And no, it's not acceptable to have any kind of answer that say, it's not my fault, it's OMS. Like Speranza said when there was the prosecutor that was trialing, was putting him on trial for homicide, and the first question that he said, I was aware of adverse effect, but it's OMS that said that they are fine. Very convenient, very, very easy, but it's not like this. You are accountable, and if you do something wrong, you go to jail. That's it.
Sì, sì.
If there are some questions for Borghi, the senator, please. Senator, could you please give us an idea? Sorry, my name is Francesco. I teach in a scientific liceo in Rome. I come from class. This morning I had class. I wanted to ask you, could you please give us an idea from your point of view if other political forces, except for the two you've already mentioned, have orientations that are different or similar? How is the situation in the parliament?
No, non se ne parla.
No, we don't talk about it, actually. Our partners from Forza Italia, as you know, already were pro-vaccines, which is incredible because the party was called Party of Freedom. So I don't understand how it could be favorable to obligations. It sounds a bit contrary. So with them, we don't talk much. I'm afraid to know their answers, honestly, so I prefer not to speak about it. Cinque Stelle had they went backwards. They had a meeting about vaccination during pregnancy. So I don't know. I feel like people changed completely. They transformed themselves. So I don't trust Cinque Stelle, even if they were our natural allies. So at the moment, we need to count on Fratelli d'Italia because we have the majority, and that's enough. Thank you. May I ask a question? Would you refuse the amendments? Because the critical points will come from the treaty to the amendments. Yeah, of course, there is a difference between the pandemic treaty and the healthy regulation. Because if I put some amendments in the IHR, they come into force. Despite the advocacy said that the time was short to reject any type of change, the sufficient time, even if the amendments had the majority, the fact that they had 10 months, they had 10 months of time, it was more than enough. It's not that we need more time to understand it. So if, unfortunately, there will be some changes, some insidious changes, we also be in need of your help. So I think 10 months to say no are sufficient, are enough. Thank you everyone. I'm sorry, I was outside the box. I just wanted to be there, though. And unfortunately, Dr. Donzelli was very, very nice. Thank you for making me talk. We thank you. Thank you. You see, politicians, they eat as soon as they arrive. May I add another question? I'm sorry, to Senator Borghi. One of the instruments of the pandemic treaty was the Green Pass. Italy approved this tool in a multiple way on different levels. And at the first vote, you were favorable to the introduction. We know that on the following levels, you had a different position. No, my position was always the same. Oh, yes, just since the risk we have now to change the asset of freedom, choice, in terms of governance and at a parliamentary level, don't you think that this could be an action, a move that would give you some credibility, especially for the last levels of the National Green Pass? So to get off this big tool that can be at a risk. What's your position about it? So we, of course, haven't invented Green Pass. We had to put it into force, also for the job, for work. And you also know the first who spoke about it was Macron, and the second after, Draghi, talked about it as well. So I thought that they were also, they agreed. You have voted him. Oh yes, of course I know. That vote wasn't a vote to be favorable. I made all types of speeches to say that this was crazy. And do you remember that the first vote was for the enclosed restaurants, so it wasn't such a big deal. But that was because, in any case, all the votes were, let's say, crushing, didn't have any good outcome. We tried to exchange our vote with some comfort, let's say. But I think that it's bad to think that I was ever on favor for the Green Pass. I was contrary during my first vote, second vote, and third vote. But the question was, do you think it's time now? Yes, but Green Pass now is not up. You don't use it right now. Yes, but they are still valid. So the government puts the Green Pass into force. Even if today I said that in the past there was a Green Pass and all the computers with the Green Pass had to be broken and all the USBs. If one day a government wants to put it back into force, it takes 12 seconds because it's a European software that is just like saying, I'm getting Excel. It's not that I can say, if we eliminate Excel from our computer, it means that the day after Excel doesn't exist anymore. We also need to be, only have to be careful on who to vote, because there is no way to impede, even if I make a law and I say that today in Italy there will never be any type of green pass. Tomorrow another government comes and eliminates it with just a signature. So those things don't work. The only thing that can defend in a stable way is the Constitution, but it could have defended us before. It's already written in the Constitution that you couldn't do those things. But who is in charge? Who decided? The Constitutional Court, and in this moment it's composed especially by people that you know their thoughts, of course. And of course, now the most serious thing we can do is that the 4 judges of Institutional Court that will be elected by our parliament in the following months or days will have at last, and I think it will be a good thing to know also publicly, those people will be people who said that what was done was unconstitutional. So we're not talking about what they are saying right now, because to be voted, people say whatever. But at the time, be clear that they were adherent to the Constitution. And of course, this doesn't exclude changings of ideas in the future. Oh well. Yeah. It's also pretty useless to have those to blame Borghi. Well, when I was here in the Senate, there were 33 people, and I think that the people who were against it, some of them probably were pro, but there were only 2 or 3 people with me. So unfortunately, if all people think the same, it's difficult to make changes. The only thing that can change it is constitution again, but this is also the political body, so there is no way out. We have another question. Hello, good evening. Let's have this last question. Since we've seen during the pandemic, the thing that worries me the most is that the authorizations on the market and also to different European citizens was the drugs, the medicaments that didn't have any experimentation. So those drugs were specific for diseases, and they weren't as vaccines. But what worries me is this type of fast track of authorizations. The fact that, as we saw, the position of Draghi was favorable to this, and he accepted it. The fact that, unfortunately, and I'm sorry, there is the possibility that Draghi candidates again as European Commission president. Is it something you can take a position on, a clear position? Can you propose some alternatives? Since we understand that your role in that prestigious field can cause a chain reaction. Thank you. Well, I'm very chill seeing that the 2 alternatives were Pfizer, or if you don't get vaccinated, you die. and things like that. So from our point of view, we were pretty explicit from the very beginning when we say that we have worked on it. It means that a party like us, from 35 members to 8, because we just stood up for ourselves, then in this case, of course, I wasn't favorable at the time, but that's the reason why my party went from 35% to 8% was because we supported Draghi. We're not crazy to say, just wait, let me support Draghi for the European Union. So from 8 members, from 8% it goes to 1%. So no, from our side, we don't want to support Draghi for this matter. Of course, I speak for myself. I don't speak on behalf of other parties. The only thing I can say is that the other parties, and today, it's just, I said today, I mean, are you crazy? Because we also experimented it and we didn't like it. Of course, it would be good that people who disagree, instead of having disagreements would find a shared, common ground. But again, this is me, so there are people who can't wait to see, oh, I'm a bit different from you, so it's better. I mean, we have to be patient. As for me, it's evident that there is no intention, and also no of my leader's intention, because we already focused on that matter, and this will be our motto. Yeah, we got vaccinated, but we got the real vaccine, Draghi vaccine, and not the experimental one. Thank you very much.
Borghi. Proseguiamo. Allora ringraziamo l'onorevole Borghi, che appunto è uno di quelli che si sono esposti, poi dopo mi sembra che qui dobbiamo parlare, sia più il caso di continuare a parlare di scienza che di politica, perché poi questo lascia il tempo che trova, visti i cambiamenti avuti, no, di posizione da tanti partiti. Così chiudiamo il cerchio. Anche quelli che durante la pandemia sono stati leggermente più esposti, oggi si barca meno, un po' di più. Ecco, diciamo anche quelli che hanno preso posizione contro il Green Pass e contro le restrizioni, oggi di fronte a certi voti sono, diciamo, meno duri nel fare critiche, e ci fermiamo qui, perché sennò dovremo parlare anche del Ministro della Salute e quant'altro. Adesso diamo il benvenuto al professor Edoardo Missoni, che ci continuerà a parlare. Facciamogli un applauso, dai. Ci sono sempre le paste lì, se vuole, prima di...
Non sono un politico, non mangio.
Sono lì solo per... allora resteranno lì a lungo, perché di qui di politici ce ne sono veramente pochi. È un intervento particolarmente rilevante perché il titolo è La cattura del regolatore e perché non approvare le modifiche agli strumenti dell'Organizzazione Mondiale della Sanità. Questo sarebbe un intervento, io spero che i politici lo ascoltino bene, magari se lo scaricano dal sito, dai, diciamola così. Prego, professore.
Grazie mille.
Thank you very much. I'm going to start, as always, in the CMSI with the declaration of no conflict of interest. I followed the works as a Italian technician and an academic from 2002, the works of WHO, so I think I know pretty well. The WHO, when we say it would like to have some coordination. It's already written in the constitution of WHO that it is a binding treaty, so the WHO is an authority that can be directing, that gives some direction, but it's a characteristic that it has per mandate. 194 member states govern through the WHO. The WHO can make recommendations through. It also has two mechanisms, regulatory mechanism. The first one we're talking about is to make treaties, promote treaties international level, as it did in 2005 with the Frame Convention on Tobacco Control, hitting with the economical interests, of course, of the market and against citizens. And it is also right now trying to do it with the treaty or the constitution. So as you can see, there is a change of perspective that is pretty important. I think that Meryl Nass will also talk about it because my intervention will be about other things. Second mechanism, a regulatory mechanism from the WHO, is the regulation about international health, and those are limited by some aspects that are listed here and in the constitution itself, so we can't do regulation on anything, but we can do regulation on quarantines to prevent the spread of illnesses. Right now, also, as Nas will talk about, the amendments are in discussion about international health. What's bad is that also today, this morning, some scratches were presented from those amendments, but they are from a year and a half ago, so today we don't know how it will be and what our governments will vote on. What we know is that the negotiations were with closed doors, no access to journalists, just very few consultancies with little participants of civil society. And they haven't been, and also the document in the scratch wasn't even presented as the IHR was saying. This is a binding document. So those weren't presented with 4 months advance. That is a norm, it's a regulation. And who tried to exit, let's say, this bond through a suggestion from the legal advisor in which it says, but the amendments were already presented in 2022, so now we just need to follow them. But 3 amendments were presented, and in the scratch there will only be 3 or 4 that will be voted by our governments. What is my task today? To understand if we can actually rely on the WHO as for the management of those 2 tools that are negotiated in a parallel way, but we don't understand why we need 2 tools. There are the regulations, health regulations, so we should have assessed what was to improve. And also there were some rules that weren't followed by the member states, so we need to be careful because it's not always whose fault. The WHO is a body funded by the member states. And then the member states reduce the autonomy and the independence in terms of technical independence of WHO. And so they have a very big responsibility in leading it. And from 1985, under Reagan in the United States and also followed by other 14 countries, the WHO was freezed and the budget was freezed. the regular budget, and they suspended their contribution for 20 years without being kicked out. And what was introduced was the neoliberal thought that the government, that also the private sector would participate, and this is about multi-stakeholderism. And also the founder of the World Economic Forum was part of it. With a multi-stakeholder capitalism, so a governance where all other governments govern exactly. So this is based on two mechanisms: the mandatory financement, where those funds had to be used by the 194 member states, and then we're going to discuss about how the vote work, and the voluntary contribution of the voluntary contribution. As you can see here, this is data from the 90s. And at the beginning it was a 50-50, but then eventually with the freezing of the regular budget, so the compulsory contributions from who, they increased. And also voluntary contribution increased. And the donor, private or public, because at the majority they are public, it decides the priorities. And this means that the donor can negotiate in a parallel way with the WHO, privately with the general director of WHO, and negotiate the priorities it wants to fund specific project defined by the donor, public or private donor. So today we have 84% by volunteer contributions, and the use is determined by the donor. Of course, here you can see that it's captured, as I was saying in my title. Here we say that Gates is the biggest funder. And since we have to be precise, as also Mr. Borghi was reminding us, we need to be precise and say, no, that's not true. The majority are the governments that we control or should control with vote, and governments that eventually elect, governments that we elect. So, as you can see, what's the most important thing is that string where there are financing, sorry. As you can see, the part with the red perimeter, and those are the volunteer contributions, and those are determined by the donor. And also in this situation, the majority, that big, let's say, part that is yellowish on the right, are funds, contributions from governments, and those are voluntaries and compulsory contributions, with some other funds that are a forfeit, that are administrative cost. And the contributions that aren't in the red perimeter are exactly the contributions that the WHO determines only. All the others are run by public or private donors. As you can see, BMGF, it's Bill Gates and Melinda, and other philanthropies. Philanthropy, that is that small light blue part, very small. That's just 1%. And then there are people who say there is the private sector of enterprise, that's not even 1%. And then we can add as well, talking about the non-public, we can add, for example, Gavi or you can see that in total we have only barely 9%. So if we want to consider them as a private, because legally they are a Swiss foundations, and we give money to Swiss foundations. And so if you think about the whole private and public sector, it's not even 20% of the financing. All the rest is public funds, intergovernative, that ask the WHO for projects. So the WHO is managed by the member states, and member states need to take all the decisions, should take all the decisions. And then they say that Gavi is managed and funded by Bill Gates, but this is not true. Of course, he is a very important financier, but I'll tell you more. When Gavi was born, I advised not to get in Gavi, and then he decided to get out from the WHO to give power to public and private partnerships. And this is a neoliberal thought. The big economical powers direct the government, and they want more. Another thing, Gavi is not directed by Bill Gates. He started it also with the help of the general director of WHO. Then Bill Gates is number 2 as for the fundings. And these are data you can find on WHO. Blue is the voluntary contributions. As you can see, the United States, they have a big, of course, part of it, and they do it through volunteer contributions. Of course, the Gates Foundation don't have mandatory contributions, and they are all voluntary. Third place is Germany, and then you can see Gavi, and then European Commission and the United Kingdom, that are the most important financiers right now. When we have to talk about the dependence of who, we don't have to think about findings only, and that Gates runs all the fundings, but because it's not true, we need to be specific, and the control of the regulation comes from different types of mechanisms. So we identified how the private subjects managed to capture the regulator, the WHO in this case, that is also a part, the subject that gives guidelines to countries through 3 important mechanisms: information, human resources, and financing. Financing, we've already talked about it, and also companies or philanthro-capitalists, as we've just seen, can define politics or priorities. There are also other mechanisms on a financial level that permit to control the WHO or shift the capacity of the government towards the private parts. But the mechanisms we're interested in and we haven't mentioned yet are, for example, the control of information, that it worries us so much as for the international treaty, because we want to increase the control of public information. And as we did during the pandemic, the WHO signed some contracts with YouTube, LinkedIn, and other big platforms, signed contracts where it gave the permission to, as we all lived, please be careful for information, please ask WHO or just see the website of WHO. So there were all these parts in YouTube, LinkedIn. They were all information that weren't aligned on the mainstreaming. And then, of course, there are lobbying mechanisms, so we don't need to act on the WHO directly to stop the treaty on tobacco, the Convention on Tobacco. There was lobbying on the United States government that tried to block this treaty, this accord. Today, this is difficult because, as I was saying, at the time, the treaty was trying to oppose to some economical interests, but today it tries to include them in the governance mechanism. So today we have this. If they tell you there is already the example of the Convention on Tobacco, be careful because we are in a different situation. And then there is the mechanism of the doors that change, that people that were working in a position and they changed, they shifted, and from, for example, Boston Consulting to going back to the public mediation, etc. And of course, this brings all the interest conflicts that we should stop. And as for the public and private partnerships, I put some examples here. As you can see, also the World Economic Forum, because it's one of them. They have different mechanisms. They also have some more or less strong structure. And even outside the WHO, just like Gavi or Global Fund finance them, they have a power that is bigger than the WHO power in terms of governance or global health. And so let me just give you the example, just also in this case, how there were some treaties that were signed also during the pandemic. And what was the aim of World Economic Forum? To give the permission, the industries to the negotiations, and that's the multi-stakeholder capitalism. Or, for example, the new WHO Foundation. Please don't get tricked. This is not a body from the WHO. It's an organization of private people. Since the WHO must be funded, needs more funded, they try to create new foundations. This is not a big foundation yet, but of course there can be some risks as for corporates, because those bodies are external and they try, of course, to take choices. So who doesn't have the credibility to manage the mechanisms that a pandemic treaty will produce, or the IHR, the regulations that were negotiated with closed doors, but since they concerned everyone's health, it should be better, of course, to discuss about it publicly, especially in our democratic institutions. Personally, I think that WHO doesn't have to be thrown away. It needs to be rebuilt. We need international funds where we can discuss and trying to overcome, for example, the period after the Second World War. And we need to understand who is actually leading the world. Today, we have this multipolar world, and we need, of course, open discussions, but we can't rely on controlled organizations in terms of the management of what we are presenting today. So this is my message. Let's stop the pandemic treaty and let's try to open a big debate on how the international institutions should be responding to the incipit of that says we, the people.
Thank you, Professor Missone. Now we have some changes regarding the list of the speakers because we have the speech remotely by Catherine Austin Fitz concerning the control digital grade, which concerns some speeches. Welcome. Good afternoon. She is an investment banker and she is president of Solari.
Can you hear me?
Sì, la sentiamo, yes.
Okay, great. Thank you.
Thank
So
you
I
very
want to
much.
say thank you to Dr. Donzelli and the organizers for this invitation. I want to look at both the WHO and the management of healthcare globally from a financial point of view and how it fits with what I would call a financial coup d'etat. We're dealing here with a radical change in how our planet and countries are governed. And so we need to look at both healthcare and finance as part of an integrated move to a control grid. So many of my comments come from the point of view I served as Assistant Secretary of Housing in the first Bush administration in the United States. And I've seen many different kinds of land and asset grabs. Some people call them takings in my career. And I look at the WHO machinery as one of the most phenomenal and elegant surveillance and control machineries to permit the political and economic control of places down to the neighborhood level. It's quite extraordinary. Let me just give some background. The US and the G7 nations have been on an economic model for centuries called the central bank warfare model. The central banks print money and the military and intelligence agencies, both with overt war and covert war, make sure that everybody takes the currency. And every 100 or so years, we'll see what's called a reset. So the World Economic Forum calls it the Greater Reset. In fact, the central bankers, the G7 central bankers, voted on the going direct reset in August 22nd, 2019. And the pandemic was simply part of that reset. So grossly oversimplified, you inject $5 trillion in the United States, more in the ECB, into the economies in a way that the money does not spread evenly. It's focused on the people doing the acquisition. So you inject $5 trillion to Wall Street and you proceed to shut down Main Street, which makes it much easier to pick up the market share and the businesses, all under the pretext that you have a health emergency.
Abbiamo avuto un piccolo problema tecnico che adesso... Ecco.
Can you hear?
Yes, please, go on.
Okay.
Okay, go
on. One of the reasons the WHO machinery is such an elegant machinery for asserting control of places. So let's talk about how this came about. In the mid-90s, I was having a meeting with the top pension leaders in the United States, and one of them said to me, you don't understand. The leadership has given up on the country, and we're moving all the money out starting in the fall. That was fiscal 1998, and $21 trillion has gone missing from the US government since then. I call it a financial coup d'etat. Essentially, what happens is the US pension funds and global investors invest money into the, hold on just a second. So let me just say a word to the organizers. Is there a way I can change what I'm watching on the Zoom, because I'm watching the moderator simply text. Let me see if I can change the... Let me see if I can change the view. Okay, I'll just take it all. So 21 trillion went missing, and for many years, some of us have been highlighting that because we knew as soon as the boomers started to retire, if the money was gone, which was supposed to fund their retirements, there would have to be a reset. Met in Jackson Hole, as they do every year, and they voted on the Going Direct Reset, which is what we are in. And again, the pandemic was a very successful operation. If you look at the, particularly in the United States, the movement of market share, business market share and independent income out of Main Street and into Wall Street, it was very, very successful. And of course, we saw the billionaires do very well in the process. Dr. Meryl Ness, who's speaking with you today, who runs Door to Freedom, which is one of the extraordinary sources of information on both the WHO amendments and the WHO treaty, has done an extraordinary job of helping us understand what their proposal is. But from what I can see, it reflects a successful understanding of what worked in the pandemic and how to fine-tune the machinery. Now, let me explain where the reset is going. For 100+ years, both in Europe and the United States, our management system, our governance system by country has been a balance of power between the monetary powers, the banks, with essentially all of the central banks being run by owned and run by private bankers, and the fiscal side of the house, which is essentially run by the legislatures, the parliaments, the representatives of the people. So there's a balance of power between the bankers and the people. Now, with digital technology, if we go to an all-digital system, and I want to stress that again, if we go to an all-digital system, then the fiscal side of the house, including local and small banks and credit unions, can be entirely replaced. Both legislatures at the national and the local level can be entirely replaced in the financial transaction system by a social credit system, a digital ID, and complete control of financial transactions. So in 2020, we saw the head of the Bank of International Settlements, Augustine Carstens, explain that the problem with cash is the central bankers couldn't tell who was using it and how it was being used, but with CBDC, the central bankers could not only have complete control of how that money was used, in other words, they can program it, so if they don't want you going more than 5 miles from your house, your money won't work more than 5 miles or kilometers from your house. If they don't want you buying certain kinds of food, if they don't want you eating pizza, your money won't work to buy pizza. So they can program the money, and as Carstens described, they will have the technology to enforce it centrally. Now, what does that mean? Again, all fiscal policies, regulatory policies, and local and community banking and credit union can be integrated with AI and software into digital currencies. Now, we've had digital currencies for decades now. And so the new part of this is what can be done with an all-digital system, which is why keeping cash alive and a check clearing system, both cash and checks, is so very important. And in fact, one of the things we see globally is as people realize that tyranny is moving as it is through an all-digital system, transaction system, and telecommunication system, they are moving to use cash in many places. There was an excellent documentary published in the Netherlands in recent years called State of Control. It's available for free online. And if you want to understand this movement of asserting complete control through digital control of the financial system, I would encourage you to do it. Now, the G7 meets regularly, so does the G20. The G20 met last September and in India and announced basically a complete loyalty of the entire G20, including Russia and China and India, to the BIS framework of digital IDs and CBDC. There's been some focus on stopping CBDCs. It's important to understand that there are many ways to implement this complete control without CBDCs. CBDCs, or central bank digital currency, is one of them. But there are many other ways to do it, literally with credit cards. Again, it's an all digital financial system. And we know, thanks to Professor Richard Warner, that the central bankers have said that they do intend to insert chips into human beings so that the CBDC can be reflected by a chip, which is in your body. And of course, that would help with the digital ID system. And we've seen conversations at the World Economic Forum that also reassert that. So back to the WHO, it seems to me, if you look at the IHR amendments and the treaty, from everything I can see, you reflect all the things they learned about using the healthcare system for surveillance and to sort of engineer changes to the economy into this machinery. And if it goes into effect, I agree with what many other people have said. It's the end of all national, state and local, and individual sovereignty. You're looking at moving to a complete biodigital control system, which is a radical change in governance system. And I would describe it as slavery, particularly if chips are inserted. And so it is essential to stop financial transaction control, to preserve independent financial transactions and not let the financial system become all digital and all centrally managed and controlled, and not use healthcare as a pretext to scare people into moving into that trap. You know, it hasn't been entirely successful in the United States. Right now, there's a big push to try and use immigration and the fear of foreigners coming across the border to implement the digital ID in the sort of digital control system. So multiple fears are used to market this. Now, why would national legislators, or in the United States, state or local legislators, ever go along with implementing this machinery? I believe many of them are smart enough to understand that it makes absolutely no sense, and it's a descent into a kind of central control, which is very hard for people who've known liberty to live with. Why would they do it? Because they're in a debt trap. We have financed the financial coup by putting more and more governments issuing more and more money that, of course, then gets spent in a variety of ways that have centralized the economy. But suffice it to say, national governments are in a debt trap and feel that if they don't go along, their trade credit or their various subsidies will be cut off or manipulated by the central banks. A perfect example is I was speaking with a state legislator in the western states last week, and he said, you know, every year we send $1 to Washington and we get $1.19 back. And if you look at that trade-off, we keep, to get the $1.19, we keep agreeing to doing things which are outside of the Constitution and the basic laws of both the country and the state. And yet, every time we as politicians try and persuade our constituents not to take that money, they support, of course, the desire to get more money. So this comes down to the fact, wherever we go, we're being bought with our own money. And if you look at the cash flows of how our money goes into the system and then come back around to us in the form of whether it's retirement checks or you know, various government subsidies or taxes, this is all coming down to taxation without representation. You had the president of the Minneapolis Federal Reserve, which is one of the 12 Federal Reserve banks, recently say, I can understand why the Chinese would want to do CBDCs. I can't fathom why Americans would ever let this happen. I would say also, I can't fathom why Europeans would ever happen if they really understood where this is going. So this is so bad that a Fed bank president is warning you against it. And I think the challenge, one of the things he pointed out, is once the system goes into effect, whether it's with CBDCs and digital IDs or other forms of financial transaction control, and certainly in all digital transaction system, what will then happen is taxation without representation. Where this is all going to come down to is our tax dollar going to be allocated by people who represent us according to basic law and some kind of democratic process, or we are going to allow the bankers to essentially, implement the equivalent of a total control system through an all-digital system and essentially strip us of any rights and be able to take whatever taxes they want. And now, let me tell you the good news. I've spent 30 years studying the economy and how the sources and uses of tax money and government credit work. I know the United States better than I know Europe, but I've been living in Europe for several years in the Netherlands and had a chance to become more familiar. And what I will tell you is words cannot express how expensive tyranny is. Globally, the majority of people are struggling with the most hideous form of sort of both physical poisoning and financial poisoning and takings occurring by those who are centralizing power. Part of this is our economic model is very, very dependent on organized crime and warfare. And the question for all of us is, if you look at how the financial flows work, when I talked about that legislator saying we're spending $1 and getting $1.19 back, I assure you, if we kept the dollar and were free to spend it according to what is humanly and economically possible and is lawful, it would create extraordinary amounts of wealth. So we're like an addict who's financially dependent on a economic flow which is making us weaker and killing us. And the question for all of us is, how do we break out of it? How do national leaders break out of the debt trap and say no to the who? And that's the question before us. What I will tell you is the economic possibility, if we're willing to bite the bullets and see if we can't re-engineer our taxes and re-engineer how our cash flow works at a local, individual, and national level, the opportunity to do what I call a building wealth reset and to have a human civilization is extraordinary, not just because tyranny is very expensive and freedom is very productive, but the other reason, if you look at the new technology that is being used to assert complete control, that technology can be used to support freedom and bring enormous blessings. There's absolutely no economic reason that I know of for poverty to exist on this planet. And so our opportunity is to stop tyranny, but at the same time, face the fact that we've all been dependent on organized crime and warfare. We do need a reset, but we need a reset that lives to human civilization. What I can assure you is a financial and economic matter. It absolutely is possible. And it starts with good health, because our populations in both Europe and the United States and worldwide, through this process, our health is deteriorating. And that is why I'm so grateful to the doctors here, and I'm very grateful to Dr. Donzelli and the work of Dr. Merrill Nass to help us understand what's been happening and how, at an individual level, we can turn this around and make sure that we and our families and our children are healthy. Our children are the best investment and the most important investment we make. And it's absolutely essential, if we're going to have a future as human civilization, that we protect and nurture their health right now through this reset. So, ladies and gentlemen, I thank you for the opportunity to address you today. I know that Dr. Merrill Nass will be speaking to you today. I can't thank her enough. She has done an incredible job of educating our audiences. And I published the Solari Report, Our Subscriber. We're deeply dependent on her for understanding what the WHO is doing and how it fits into the greater picture. And I want to thank her also for the opportunity to address you today. And with that, I hope you have a wonderful conference. If there's any time for questions, I'm happy to take them.
Thank you very much, Dr. Fitz. Ringraziamo Catherine Austin Fitz e
Doctor, we have some changes. From Louisiana, there is Senator Thomas Presley from Louisiana. Here he is. So welcome, Doctor.
vi lascio.
So I give the floor to the senator. Louisiana gave a domino effect, and since I need to go back home to Milan, I want to thank you and say goodbye. I want to thank Dr. Donzelli for all his work and all the people present here. I hope you will continue work in your field to bring those messages forward. So thank you again, everyone, and I leave the word to Thomas Presley. I'll bring the pastries with me.
I apologize, my Italian's not very good, but I appreciate you having me on, and I assume that I can go ahead and begin my remarks. I want to tell Ms. Austin Fitz, thank you so much for your words. I enjoyed listening to much of your speech this morning, this afternoon in Italy, but I appreciate the words that you had, and I'm grateful for the work that you're doing. Here in Louisiana, we are working to ensure that these international organizations do not have sovereignty over us. We want to make sure that we have the power right here in Louisiana. So I brought a bill which is here in Louisiana. It's Senate Bill 133, which provides relative to certain international organizations, specifically the World Health Organization, the United Nations, and the World Economic Forum, and that they shall have no power or jurisdiction in the state of Louisiana. No fee, regulation, tax, rule, policy, or mandate of any kind of any of these three organizations shall be enforced or implemented by the state of Louisiana, any of its agencies, departments, boards, commissions, political subdivisions, or government entity of the state, a parish, which is a county for the rest of our country, municipality, or any other political entity. We felt like it was very important to ensure that Louisiana maintains our sovereignty. The United States Constitution is very clear on this, but unfortunately, we've been moving more and more towards a world order and more power being given to international organizations, which, with due respect to those international organizations, to our friends and allies throughout the world, should not have the power over us and governing the citizens of Louisiana, nor the citizens of the United States, which is why we felt like this was important legislation. Surely you would, if you've studied the American Constitution, you would believe that much of this is in there, and it is, to be clear. But we want to make sure that we are as crystal clear as possible in ensuring that the power of Louisiana remains right here in our state. You know, the 10th Amendment of the Constitution provides that power should remain, that's not vested into the national government, should remain with the states. Unfortunately, we've seen more and more every single year, more power being taken from us to be placed in Washington and via Washington into international organizations such as the World Health Organization, which is deeply concerning. Many of the rules and regulations that are put in place are those that are contrary to the traditional principles that America stands for, and certainly our states stand for. And my colleagues and I decided to bring this legislation to ensure that we can do whatever we can to make it clear to international organizations, to our national leaders, that they shall not give power to international organizations that have no ability to be replaced by the people of Louisiana. Every 4 years, our voters put in place our state representatives, our state senators, and our governor. And we represent in the state Senate about 125,000 people to whom I am accountable via those elections and via the recall process. Our House members represent about 44,000 people each. Again, they are accountable every 4 years on the ballot box. And our governor, of course, represents the about 4.6 million people in Louisiana. We hope that we will continue to grow that number, but I do think that it's essential for us to make sure that international organizations do not have power over us if we're going to do that. We've seen a lot of really positive information being shared throughout our state networks. Alabama has done similar legislation to this with a resolution following ours. But I really want to commend the state Senate who passed this legislation approximately 3 weeks ago. And we've had great publicity nationally and internationally about what we're trying to do right here in Louisiana since then. Now, this legislation was to become effective on August the 1st, and I'm grateful for so many people that have reached out to me about the need to expedite that implementation period and the effectiveness date of this legislation. So we are actually going to change that once we get to the House committee, which is actually going to happen next week. So we are moving through the process. I think we will not run into very many obstacles on the House side of the legislature. So we expect this bill to be able to come out of the House and Governmental Affairs Committee next week. On the Senate side, I was very surprised, honestly, in the fact that we were able to get it out without objection, and all of the state senators voted for it. I believe we had one that was absent that day, but we had 38 votes in favor of this legislation moving forward. And again, my colleagues and I, regardless of where you stand on the political aisle, are concerned with the ever increasing amount of power that's trying to be stripped from the people of Louisiana, from their elected representatives, and given to national and international organizations. Certainly here, we're looking at the international aspect and trying to rein in that power that countries that are not friendly to us will continue to have over us. I think we woke up a little bit to this challenge, certainly during the days following the COVID-19 crisis and pandemic, and really saw this shift to an international desire to control all people of this world. And again, when the founders of the United States came to this country, they did so trying to escape tyranny and wanting to have the power over themselves regarding taxes. And that's really the wonderful American experiment that arose out of the English desire to tax the American people in their colonies without having a representation in London. And really, that's the foundation of our country. When you look at the Federalist Papers, really, we looked at the needs for international treaties and working with allies, but there was never any contemplation of giving up our power and our sovereignty to those that are international organizations and countries throughout the world are picking and deciding. So again, when we're looking at what to do here in Louisiana, my colleagues, Senator now Kathy Hodges and Representative Valerie Hodges and Kathy Edmonston, we were all three in the state house last year. And those two really picked up the ball and tried to run legislation through last year dealing with this. And their foresight on this issue, I think, is really to be commended, because they were so worried about the international organizations trying to take over our sovereignty. The people of this great state have elected more conservative members of our state House and our state Senate, as well as a more conservative governor since that time. But they were unsuccessful, unfortunately, in getting the bill through our Health and Welfare Committee last year. I tried to work with them during that committee meeting to move the legislation forward, and unfortunately, we were not successful. But we were very keen on making sure that we were able to do that this year and move this legislation forward. And that's exactly what we have been trying to do. And you know, I'm again grateful for my colleagues in moving this legislation through the process, through the state Senate, in a very expedited fashion. And again, it's in the state House now and in committee. I would expect this legislation to go to the governor's desk in the next 2 weeks. And the pressure that's been put on my colleagues is very impressive. From Twitter and Facebook, I'm grateful for those entities because of the fact that we were able to get this information out to the public. And the public is very keen on wanting to make sure that our voice and their representatives have the voice to enact laws and make changes for them. When you don't have an accountable government, I think we look into you know, more of a challenging state. I know that each of you are familiar with those concerns, or you likely wouldn't be at this conference today. But we want to make sure that we're doing everything, again, to keep that power here locally. On the more local level, the better. And if not at the local level, then on the state level. If not the state level, then the national level. But I am grateful for friends throughout the world who have reached out to me via Twitter about the concerns that they have on you know, the tremendous power that the World Health Organization currently has, that the United Nations currently has, and the World Economic Forum currently has over all of us. And the more that we can do to rein in that power, to restore the traditional principles of our you know, national governments, I think is important. And again, like the United States, that national government really, through the 10th Amendment, returns the power back to the people through the states. And I think that we need to get back to that responsibility, that requirement, that duty that we oftentimes have been ceding more and more power to Washington and to these international organizations. Certainly, you know, the principles of the United Nations, in my eyes, were initially to try to prevent war and have a place to have conversations. I don't have an issue with conversations. What I have an issue with are these international organizations trying to dictate what our people are to do and how they are to act. And that is really the concern and the desire of my colleagues and I in returning the power and the sovereignty to the people of Louisiana through this legislation. Again, we've had several states that have reached out to us. Alabama, in particular, has started to unveil legislation on this. I believe they have a resolution. I believe Tennessee has one as well. But I think we're going to see more and more pushback on the international organizations, particularly in the United States, after seeing what happened during the COVID-19 pandemic and the desire of these international organizations and international minded individuals trying to push for a global approach, which for me is contrary to the reasons that I want to serve the people of Louisiana and that I want to ensure that the Constitution remains in place. I swore an oath to protect and defend the Constitution of our state and our country when I became a state senator and a state House member prior to that. And I want to make sure I'm doing that to the best of my ability. I think this legislation has, again, a great piece of opportunity, a great opportunity to move forward through the process, and I'm grateful for the opportunity to be the lead author on it. And again, grateful for my colleagues, Senator Hodge and Representative Edmonston, in moving this legislation as well. And with that, I am happy to take questions and answer any questions that you may have. And again, I'm grateful for the opportunity to come speak to you all today. I wish it was in person. I've never been to Rome, but it's high on my list of places I'd like to go.
Se c'è una domanda per il...
If there's a question for the senator, please ask it. Otherwise, we thank him with a great applause, a round of applause. Also, because they had a double outcome. The former is that they have a domino effect, because he said that other two states are going to the same direction, and we hope that European countries will do the same. And the latter is because the vote was unanimity. But also Democrats shared the same bill. So this is an important result, and that gives us hope. Thank you again. So at this point, I'll give the floor to Honorable Rob Ross. He is a Vice President of the European Conservatives and Reformist Group, and he managed to have a meeting to Jane Small during a hearing at the Parliament. What is going to tell you regarding the untested transmission of the virus, to stop the virus?
Take this one. Thank you so much for having me here. I spoke about the WHO also in the US Senate, but I have an update for you. It was the President of the European Union Council, Charles Michel, who came up in January 2021 with a proposal for a global pandemic treaty. On December 1st, 2021, the 194 members of the World Health Organization, the WHO, agreed to move quickly on a treaty, agreement, or other international instrument on future pandemics. The power of the WHO, and in particular the power of the Director General to monitor, to coordinate, and to direct, would be significantly expanded. The European Union is pushing for a legally binding pandemic treaty, but that would require, for example, in the US Senate, a 2/3 majority. Negotiations are ongoing. I have a draft right here. This is an update from March 2024. But it is unlikely that this pandemic treaty is going to pass worldwide. Simultaneously, however, negotiations are ongoing on more than 300 amendments to the International Health Regulation. They were originally submitted by the Biden administration, and they will be subject to a vote by the General Assembly of the WHO at the end of May, 5 weeks from now. These amendments would not have to be ratified by any national parliament, thus enabling the WHO to circumvent national democracy. Thereby, they form the true imminent danger to freedom worldwide. Tucker Carlson made an informative segment in a show on Fox in 2022, warning the public against this global pandemic treaty. It makes total sense because this is catchier than amendments to the International Health Regulation. However, as we can see from the original amendments, if adopted, they would already give the WHO a leading, convening, and coordinating role in the operational aspects of an emergency response to a pandemic. So, in short, the pandemic treaty is indeed worse, but the amendments are the imminent danger. Should we trust the WHO? Many citizens, and maybe even politicians, think the WHO is a benign, objective organization, making decisions in wisdom and impartiality. Unfortunately, the reality is different. The WHO receives 80% of its funding through so-called voluntary contributions, and almost 90% of these contributions are earmarked, meaning the WHO itself doesn't decide how the money is spent. And who are these donors? Well, for instance, the Bill and Melinda Gates Foundation. In 2022-2023, they spent more than $1 billion on the WHO. Would that be out of kind-heartedness? I'm not so sure, and nobody should be as naive to assume so. Bill and Melinda Gates have massive financial interest. Their foundation is one of the most successful business operations in the world. Can you see a conflict of interest arising here? For instance, when the financial interest of Bill and Melinda Gates would perfectly align with WHO policy being forced onto countries, either with hard power or with soft power. Because I do see a problem here, a massive problem. It's just one of the reasons why we cannot give the WHO more power with these amendments. And the WHO seems to be in a hurry. In May 2022, there was a vote on 2 significant changes to the procedure of adoption. A significant reduction of the period provided for under Article 59 of the 2005 IHR in 2 regards. First, the procedure for the entry into force, that is changed. Under Article 59, paragraph 2 of the amendment IHR, there is a reduction from the original 24 months to 12 months for the entry into force. Second, the period for rejecting or expressing reservation on amendments to the IHR is reduced from 80 to 10 months. The vote for this change of the IHR was performed in violation of the WHO constitution due to lack of proof of consent. There was no vote and no record who was present. With other words, and this is really important, basic procedural rules for the correct formation of a vote have been violated. The democratic process has been sabotaged. By a letter, I have requested Director General Tedros for proof of a simple majority, but I have not received any response yet. This letter was sent over 5 months ago. It would surprise me, however, that something like an illegal procedural change is going to stop the WHO General Assembly from adopting the Biden amendments to the AHR in May. But what are these amendments? There is still not yet a final consolidated version of these amendments. The only official document that we have is the so-called article-by-article compilation of the more than 300 proposals for these amendments dating from November 2022. I repeat, there is still no official consolidated final version of the IHR amendments that could be submitted to the World Health Assembly for a vote that shall take place in the last week of May 2024. Ladies and gentlemen, that is in 5 weeks from now. This is unacceptable and even goes against the WHO own rules. Article 55, paragraph 2 of the International Health Regulations clearly states, the text of any proposed amendments shall be communicated to all state parties by the Director General at least 4 months before the Health Assembly at which it is proposed for consideration. 4 months. If they are adopted, democracy will be sidelined in the event the WHO decides to declare a pandemic. Experts believe the WHO could then, in practice, impose lockdowns, enforce medical interventions, and dictate medical protocols. Such a one-size-fits-all response to a pandemic crisis is foolish. In geographical zones characterized by vastly different parameters, and it is, of course, totally undemocratic. Instead of a central bureaucratic process, we need local democratic decision-making. The WHO cannot be trusted at all. It is funded by China, by Big Pharma, and by philanthropists. I'll call them oligarchs, by the way. There are enormous conflicts of interest. Further amendments threaten free speech and seek to increase censorship of differing opinions, potentially transforming our nation states into totalitarian-like states. For this reason, I urge you, and I particularly urge each and every elected representative, call for a stop this hasty process. There must be absolutely no vote in May. No vote on the amendments to the IHR in May. No vote on the pandemic treaty in May. A vote in May would violate the WHO own procedural rules, which are the fundamental safeguards for the protection of our democracy. And more importantly, a vote in May would endanger the sovereignty of our nation states. We should do everything we can to stop this. Thank you very much.
So, questions will be asked later, and then we're gonna ask later. Then there is Dr. Mary Nass, who doesn't need other introductions because we know her very well, and she's gonna go into detail of the risk regarding the new pandemic treaty and the amendments of the IHR. Please, the floor is yours.
I was asked to go into detail about the treaty and the amendments to the international health regulations, but I actually feel at this point it's not very helpful to do so. There is a lot of detail, and these two documents were written in such and created in such a way as to cause maximal confusion when you try to understand the differences between them, how they are accepted, how much time it takes before they go into force, etc. So I'm going to try to step back and take a 30,000-foot view and contextualize what's going on at the WHO instead. And so first, I want to remind you, this WHO business did not start in a vacuum. This is a logical conclusion of what's been going on for the last 4 years and longer. We have been lied to consistently and fooled. COVID was clearly made in a lab, if you study the genetics. We are still being told pandemics come from spillover from animals to humans, when that is almost never true. They withheld life-saving medications from us and have no acknowledgement that basically this killed hundreds of thousands, if not millions of people. They use psychological warfare techniques, professional techniques, to force vaccines on us that they knew did not work and were dangerous. They're still doing that. They pre-shielded themselves from all liability, and now they plan to use the WHO, which is just a tool, to get rid of what is left of our democratic processes. So, are we living through multiple crimes, one after the other, or is this all one thing, and are we really in a fifth-generation war? Is this the elites trying to control everything left in the world that they don't already own? Why did Fauci cover up the lab origins, and why is he still doing so? There were many reasons, but I believe primary among them were the fact that they needed to insist this was natural origin in order to blame human activity for the pandemic, to support the climate change agenda, and to justify this crazy concept of One Health. So they're using a lot of false ideologies, guilt and shame, to herd us into the future they have chosen for us, which means we will be no more than their cattle. The global warming, climate change, humans are destroying the planet is, I hope everybody here knows, is a complete exaggeration, and the methods they have chosen to ameliorate it don't work, are very expensive, and have other purposes. We've lived through identity politics and critical race theory in the United States, which were clearly false narratives, and the human activities business is very important. I want you to think about that. Now, I had to pick this slide because it was from the Club of Rome website. This is the group that started telling us there were too many people on the planet and we needed to feel guilty about that. And how have they chosen to fix this? Well, we're going to balance the needs of humans with the needs of ecosystems and the needs of animals. Remember that term, balance. There was a lot of literature saying this. I've collected about 20 different articles from major media. I'm just going to show you a couple. This was from Nature magazine, the world's premier science magazine. Climate change is causing pandemics. So we have to fix climate change to save ourselves. And this is from the World Economic Forum. Worst pandemics are on the way if we don't protect nature. This one's from The Guardian. Nature is sending us a message. It's also from the UN. Human behavior causes diseases to spill over from animals to humans. But even more importantly, global heating and the destruction of the natural world for farming, mining, and housing have to end, because they drive wildlife into contact with people and cause pandemics. Okay, this didn't start yesterday. This is a wonderful book. I would really recommend it to everyone, by Patrick Wood, Technocracy, The Hard Road to World Order. He shows how some of these concepts began in the 1930s. Gro Harlem Brundtland's UN Commission issued Our Common Future in 1987, almost 40 years ago, which led to Agenda 21. And then in 2015 and 2016, We got Agenda 2030, the Sustainable Development Goals, the Paris Climate Agreement, and smart cities. None of these were chosen by the people using any democratic process. And that's the goal for the future. No more democracy. All right, these are the two documents. I'm only putting them up there so that they can be recorded on a screen, and anyone who wants to look at the difference between them can do so. But I find that people are just confused by all this detail. There's a lot of overlap. There are two documents to keep us guessing, and they both do the same thing. And if either one passes, the elites will be very happy. Okay, let's just talk about 4 or 5 different particularly egregious aspects of these documents. The first is nations are, now, there's one version of the amendments that we have that we're going on, which is almost a year and a half old, and there have been 8 different versions of the treaty. And many things have stayed in the treaty with each version, and many things are moving in and out. And so you have to forgive me because I'm selecting things that have been in most of the versions. But in many versions, the treaty says nations are required to pass laws or create other administrative processes so that unlicensed vaccines and drugs can be rolled out to their population. Unlicensed means untested. It also means, in this case, no liability for the manufacturer, the WHO, the government, the doctor, the building you got it in. Nobody is going to be liable for injuries, and that is required if you're going to roll out an untested vaccine. Almost all vaccines fail in the process of development. About 75% fail before they get to a license. That's the 75% they want to give us. During COVID in the United States and Europe, every vaccine that began the process of development was used. Surveillance and censorship are required of nations. The nations have to surveil you, and then they have to censor anything that doesn't agree with the WHO's prescribed narrative. That's in both documents. One Health is in the treaty. That has been in every version. It is a bizarre concept that makes no sense except as a method to gain control over the entire world and its resources. What it says is that health can't just be considered to be a human issue, but you have to include animals, plants, and ecosystems when you talk about health. And that's everything in the world if you think about it. And all of those then could potentially be managed by the World Health Organization. Human rights were removed from the amendments. They've been put in and out of the treaty. Why would you ever, I'll just go back to that. Why would you ever cross out human rights, dignity, and fundamental freedoms of persons? Only if you're looking at the end of democracy. The authority of the WHO will be expanded from being restricted to public health risks to expanded to all risks that have any potential to affect health. This one says the WHO has the right to withhold medications from you during a declared pandemic. No more ivermectin or hydroxychloroquine next time, globally. Now I'm going, those were in the amendments, the treaty versions. This is information control. Here again. This is the one that says you have to allow the use of unlicensed, untested products. Here they say that you've got to give it a liability shield. You have no fault vaccine injury compensation and indemnity clauses for these novel vaccines. This is a recipe for complete disaster. Here's One Health. You can't explain what One Health is in any logical way, so they have created many word salads. Word salad is, you put a lot of highfalutin words together, and most people don't understand it, but they think somebody above them must understand it. It's an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment are closely linked and interdependent, blah, blah, blah. And that's the One Health expert high-level panel that is made up of 3 UN agencies, including the WHO and the World Organization for Animal Health. Where did One Health come from? The idea was invented about 20 years ago, and it was picked up by the Rockefeller Foundation about 15 years ago, who funded it, and then these globalists decided it had use. And they've expanded it and spent billions and billions of dollars embedding this in governments around the world. Public health departments, you can get degrees in One Health. There are so many grants for One Health. If you can write a paper that talks about One Health, you know, you're on your way. It is embedded in US law that the federal agencies are to apply One Health. This is extra, it doesn't mean anything, but it's everywhere in the world. More word salad here. The One Health Commission has issued a joint plan of action. The quadripartite, that's 3 UN agencies and the World Organization for Animal Health, considers this international dynamic to be a unique opportunity to take its partnership to a new level and stand together as a global coalition to jointly drive change and achieve the transformations required to mitigate the impact of current and future health challenges at global, regional, and country level. So if anyone can understand that, maybe Dr. Missoni does, I don't know, tell me what it means. Good. Here, the United States just issued this document 2 days ago. This tells you a little bit about One Health. The government promotes a One Health and transdisciplinary approach, not just for human, animal, plant, and environmental health and health security, but also to meet national and global goals for climate resilience, food security and nutrition, economic development, biodiversity, and conservation. As I said, they're going to use One Health to try to lasso everything in the world into one basket. Pandemic preparedness is a myth. No one's ever figured out how to do it. We don't know how to really detect it. Once you try to detect, you can detect lots of things all the time. And Dr. Wodarg has told us about that in earlier speeches. The harder you look, the more you find, but you don't know what's relevant. WHO has declared the last 2 pandemics for viruses that came from laboratories. It's a big industry. A lot of people make money. A lot of people around the world are making money. The United States, in that new document, said it's going to support 100 countries with the global biosecurity agenda. And yet, when the pandemic came, we had nothing. We had nothing at all to deal with it, and we suppressed the drugs that actually worked and the vitamins. Okay, I want to talk about bird flu for a moment. You're going to hear a lot about bird flu. It's very dangerous. It actually isn't. It mutated. It's only affected 2 people in the entire United States ever that the CDC can find. One had fatigue for 4 days. The other had pink eye conjunctivitis, little infection of the eyelid, nothing. If you cook the meat, if you cook the eggs, you can't transmit it to humans. I don't even know if it's killing the birds. We've been told that back at the end of 2022, 140 million birds, they said, were killed by bird flu. No, 140 million birds, chickens, ducks, and turkeys were culled because one bird somewhere was found to have bird flu with a PCR test, and the whole chicken house or the whole flock had to be murdered on orders of the government. Now, as these 2 documents of the WHO get close to being possibly adopted or approved in some way, the fears about bird flu are ramping up in the United States. And so the CDC just last week or 2 weeks ago put out a warning in this emergency network that is almost never used about bird flu. They're on the lookout for more human cases. They want to justify tighter controls. And Dr. Peter Marks, who is the head of vaccines at the FDA, was asked about bird flu and said he's confident that the vaccine we actually have 3 licensed vaccines for bird flu in the US, amazingly, for people. There's also vaccines in development for chickens. He says he's confident that they'll work, although somebody else at the conference, who used to be the chief scientist at FDA, said she was not at all confident. But what's important to note is he said there's a low threshold to pull the trigger on these vaccines. In other words, he is ready to vaccinate people with these already licensed bird flu vaccines for a disease that has killed in over 20 years less than 500 people in the world that we know of. That's less than 25 a year in the world. That has never killed an American. That has caused something like 800 or 900 cases in the world ever that we know of. This is the most recent vaccine that was licensed in 2020. It's called Audens. I looked up the package insert. During the clinical trial, 1 in 200 people who got the vaccine died. 1 in 1,000 who got the placebo died. So this is the vaccine they want to, he's got a low threshold to pull the trigger on for bird flu. All right. As I get close to concluding, I want to emphasize what was said by MEP Rob Bruce, which is the WHO is not an honest broker. Its pandemic plans are built on lies and misdirection. Of course, there's a transfer of sovereignty to the WHO, many transfers, although there's a paragraph in the treaty that shows up in some versions that says, oh, we will never ask countries to cede any sovereignty. And then a few paragraphs later, they demand that nations do exactly that. But they can point to that paragraph and say, we have no intentions of ceding sovereignty. What they term regulatory strengthening is what I've already described to you. It's regulatory weakening. It's by rolling out vaccines and drugs that didn't go through a licensing process. Managing liability is actually removing liability. Universal health coverage, they try to imply means health care, but it doesn't. It means taxation. It means charging everyone for health insurance. If they can make that work, everyone in the world. The WHO Treaty promises unfettered access to information, as actually the amendments I think do too, and then demands censorship. Pandemics are much more likely to come from laboratories, as we've seen recently, but the whole process of the global biosecurity agenda is dependent on the fake theory that pandemics result from spillover of viruses from animals to humans. One Health is a Trojan horse. And I guess I've told you the rest. Human rights, dignity, and freedom are discarded. They're actually negotiable. They show up in some versions, but not others. So just remember that your human rights, your dignity, and your freedom is negotiable according to the people who are writing versions of the treaty and the amendments. I think what happened is I've got the wrong version of this, so we're missing a couple of slides. That seems to be the end. Thank you very much.
Molte grazie.
Thank you, Meryl. Then we're going to ask questions later. Now there is a brief extraordinary speech of a philosophy professor, who is a professor in the Nairobi University, but he's also editor of Choice Africa Beyond the Liberal Democracies, and is part of the panel African and Pandemic Working Group, which seeks to raise awareness in African countries to struggle to be against the pandemic treaty and international regulations. And I'll give to him the floor.
Dear Professor Oduor, thank you for accepting to participate to our conference. You are part of a group of academics and health experts that is trying to raise awareness in Africa about the threats that the WHO pandemic treaty and its amendments pose to national health and sovereignty. Please share with the audience of this conference your opinion about the threats posed by the pandemic treaty on the African countries and the reasons you are doing such efforts to convince them to reject it. Please.
Thank you very much, Panagis. We have a group called the Pan-Africa Epidemic and Pandemic Working Group. And in this group, we are particularly concerned about two documents. It's actually two documents. One, the draft WHO Pandemic Agreement, and the second one is the amendments to the International Health Regulations. We have many concerns about these two documents. I will only share 8 very quickly. The first one is that the documents advocate for a One Health approach, which simply means that human health and the health of plants and animals and so on are considered to be of equal value. And this diminishes the value of the human person. Secondly, we are concerned that the treaty, the agreement, commits states to confront misinformation and disinformation. But we have learned over the past 4 years or so that anything that the World Health Organization and its partners disagree with is considered either misinformation or disinformation. And that then amounts to censorship and stifles the development of open societies. The third issue of concern at the treaty seeks to protect pharmaceuticals as they market therapeutics, vaccines, and devices under emergency use authorization, which simply means that they will not be sued. The treaty will protect them from being sued by those who get harmed by these therapeutics and vaccines and devices that are sold to the public under emergency use authorization. The fourth issue of real concern to us is the intense centralization of medical care. We saw during the height of the COVID crisis that doctors were being required to only prescribe certain drugs and being forbidden from prescribing certain other drugs, which then means that the age-old principle of the sanctity of the doctor-patient relationship was being violated, and the doctor was now just being made an agent of a central authority. That is not medicine anymore, and yet this is one of the things that the treaty, the agreement, now they call it, and the amendments to the international health regulations would be promoting. The fifth issue that concerns us is the amendments to the international health regulations themselves. If those are signed into international law, the WHO Director General will have power to require countries to lock down, to conduct tests, to issue vaccine mandates, all these kinds of things that we saw during the COVID-19 crisis will now have the force of international law. And we think that that violates the sovereignty of countries. Six, we are concerned that these two documents are propagating a one-size-fits-all approach to public health. And yet we know that global South have totally different problems from the global North. And we cannot have a one-size-fits-all solution. Seventh, we are particularly concerned, and it is related to the previous point, that the treaty and the international health regulations, when amended, will require countries to contribute a lot of money to pandemic preparedness. And yet here in Africa, we have diseases such as cholera, such as Ebola now and then, such as tuberculosis, that are ravaging populations. And funds will be diverted from addressing those to addressing pandemic preparedness. Finally, we are concerned about the conflicts of interests in the financing of the WHO. Because of the rise of neoliberalism, WHO is now not funded as democratically as it was before, and that then means that a few powerful countries and some philanthropic organizations are the ones which fund it and direct it where to put the funds. And that is a conflict of interest. And so we say, let these two documents not be signed in the current form. I would just add lastly that there is a procedural injustice in that countries have not received the 4 months that the law says they deserve to review the amendments, because even by, I think, last week, the countries had not received the amendments. So it will be unprocedural to vote them in May. Thank you very much.
Thank you, Professor. Dear Professor, thank you for participating to our conference with these fantastic and wise words. But most importantly, thank you for all your work and your courageous efforts.
Thank you very much.
Now, there is another message of Senator Ron Johnson. He's extraordinary because we remember him in the occasions where he defended the issue of transparency regarding vaccines, as well as the adverse effects. He also organized extraordinary meetings in the US with highly important experts. He couldn't come here, but he gave us a speech to honor us.
So this is for Senator Johnson. Please talk to us a little bit about the World Health Organization. This is for a group holding a conference on April 18 in Italy about not joining or not signing the treaty. What are your thoughts on that?
Well, first of all, I want to say hi to all the freedom fighters in Italy. I know I was invited. I just couldn't come. I wish I could have. I love Rome and would have been fun to come. But this is so important. What the World Health Organization is trying to do is really take away your individual personal health autonomy and freedom. And they're trying to do it through big government and basically attack the sovereignty of every nation state on the planet. So we need to do everything we can, enlist the countries that could be impacted by this to get them to vote these amendments down. Now, I have heard some encouraging news that, you know, as often happens in government, there's somewhat chaos in the negotiating. So let's hope that chaos continues and there's gridlock on these amendments, but we can't count on that. And so I'm so appreciative of groups and events like this that are pushing back against one world government and the loss of our individual freedom. So God bless all of you and good luck.
So now there is an important speech of an extraordinary person, Dr. Wolfram Woder, who is an epidemiologist, a German epidemiologist. And he was thrilled when he heard the analysis. He was a member of the Bundestag, former member, and honorary member of the Parliamentary Assembly. He's an expert on international health and corruption in healthcare. Some of you already knew him regarding his bestseller, Against Fear. And I'll give him the floor.
Thank you very much that you have invited me. I'm very much honored. And I'm so pleased to be in Rome again. It's very nice here. And I think this is a great meeting because it's so clear. I think it became very clear what we're heading for, what we see, all the dangers we see, and all the possibilities we have been shown to fight it. And I try to help a little bit with it. And I have some historical view. Could you do the first, this one again. You see all those points. No, can they move them? Yeah, see them, yeah. You see how they move. I just want to show you what's going on for centuries and now this goes on for decades. It's 10 million passengers traveling around the world each day, with all their billions of microbes on their body and in their body, exchanging it globally each day. I've been on the airport and you see all the people there, and just imagine they are a biotope. We are all biotopes, we are all living beings, and we have more than 3 billion microbes on our body. And so this all goes for thousands of years. If there were no viruses, we would still lay eggs. We have become what we are with viruses. Our immune system gets to know them, we learn it. But suddenly there are people who say, oh, there is some danger. Okay, human beings get ill, human beings die. When they don't have apartments, when they don't have nice food, when they are not educated, when they do nonsense with their body, then they're endangered. And we see many places in the world still people dying who should not die because they don't know and there's no help for them. They're not together to help each other. They're fighting each other. So there's a lot going wrong in this world, and many people die. This has been all the time too. And we have to do something that this gets less, that we live better together. So, yeah, the WHO, if there would be no WHO, you wouldn't recognize it. You would not feel it, you would not see it anywhere. If there would be no Coca-Cola, you would suddenly recognize, oh, there was something which is no longer there. But with WHO. So this is me as a Port Health Authority in Hamburg. In 72 or 73, I was going around fighting cholera, fighting pest, and fighting all this yellow fever coming from abroad, but only on the ships, because WHO had made the international health regulations, and they said the captain has to declare 6 questions. It was 6 questions then, and he has to say no, no, no 6 times, and then he gave a radio signal, Zulu Victor, Zulu Tango. That means I come from a very dangerous region, but nothing is wrong on my ship. And we controlled this. This is how I met WHO. And you see, there are now 9 questions. They have widened a little bit their questions, but they are still nonsense. Just remember this. They did it only on ships. But all the people that travel on comp, there are only 30 persons on the ship, or 20. And in each plane, there are 200 or 300. What a nonsense. And they make a big fuss about international health regulations. It has nothing to do with health. This is what I really found. I criticized it then. I said, why do we control the ships? So, there is a long history. This is Mrs. Brundtland. And the other one, you know this guy? He looks a little bit younger than, but it's Mr. Schwab, yes. And it is when the wall was falling down, the big wall between the 2 halves of this world, the communist one and the capitalist one, many things changed. There were suddenly people who used to invest only in the western part of the world. They could open their business and earn their money in the western part, and there was this eastern part functioning in a different way. And suddenly the war was gone, and then they could spread. They wanted to invest everywhere, globally now. And this made a big, big change. And the WHO also helped to prepare this change. And this is, you see, the Secretary Generals, I listed them all here. Mr. Chisholm was the first one. He was a Canadian guy. He was very much involved with the Rockefeller Foundation. And they liked him very much, and they made him the first secretary. There wouldn't be a WHO without Rockefeller Foundation. Rockefeller Foundation started this work, what WHO does now, or still continues, started it in 1913 already. They made also always bilateral help. They said, we come to your state, to your country, to your region, and we educate your nurses and your doctors, and we help you to have a better life, to be healthier. And this is how they opened their market. At the same time, they had contact with the country. If you go to someone and say, I want to care for your health. Oh, it's so nice. Immediately you say, oh, this is very good, thank you. And so they used this, I will help you. They used it to have their foot in the door to those states and make business with them. And this was a very successful trick. And they widened the trick. And in the 60s, this was the time when in Germany, for instance, and many countries in Europe, life was quite well. We all had to eat everything to eat what we needed. Many people had good apartments. Life was safe. And there were less illnesses. The children diseases, all those, what the little children could die from and died from and still die in poor countries, in Europe was almost gone. And, but this is the time when they started. Okay, we cannot sell so much drugs. There are no people getting ill anymore. So we have to have new markets. And this is the time when they invented vaccination programs everywhere against all diseases possible. What children could get, what we could get. And they invented more and more. And they made vaccination programs because this is a pharmaceutical product you can sell when there is no one ill. It's a great business idea. It was the biggest idea for business ever. And then there is one thing that was not mentioned today. I have to mention it here now. This is the patent rights. In WHO, I was in the World Health Assembly once. The most important struggle was, if there is a new virus, who gets the right to use it for producing vaccines? And it was about patent rights. They are struggling about patent rights for decades now. India, the BRICS countries, they were always, we want to have the rights. When we have a virus, we want to produce our own stuff against it. And the US, US attorneys I met there, only patent specialists, they said, oh no, no patent, no cure. This was what they said. No patent, no cure. So they were fighting for patents, and the whole thing we experience now, the new virus X, the virus Y, the virus whatever, it's all about patent rights. We have to have this in mind. So this was, the WHO was cooperating first with the Rockefeller Foundation, with the International Health Department of the Rockefeller Foundation, and was the successor of it then. And they struggled in the beginning, but then they made work sharing. The one was more caring for the microbes, and the other was more caring for social things. So this was in the beginning, and WHO took over more and more. But while the health, the term health was changing a lot in the decades. First, before 1883, I take this date because Bismarck made the first regulation for healthcare in Germany. Maybe there are in other states, there were such regulations before, I don't know. But then he made, because he saw that people coming together, workers in the big industry zones came together and helped each other and organized. Like they were afraid of that they organized politically. So Bismarck said, he was clever, he said, we make regulations. Okay, it's very good that you help each other, but we tell you how. And in which frames, legal frames. So they had a control over what was going on there. How the people helped each other. Before, health was a private matter. And I remind you, health still is a private matter. Nobody can tell me when I'm healthy, when I'm or not. It's only me and myself. There's something like autonomy. Other people may think I'm so ill and I may be handicapped, but when I feel healthy, within my environment, with my friends, how I live, nobody can tell me anything else. I define what healthy life is, myself. And WHO changed this. When it was founded, they had the trick that this wonderful definition of what health is. Everything, social, psychological, physical, everything. And now they have even one health. So they started, like Bismarck did, they started telling us what health is and how we should be healthy. And they went on and went on. And then they said, when the WHO was founded, they defined health as a human right. These member states have to do something for the health of their people. You have a right for health. There has to be a sanitary system, a social system, and the states have to do it. They make a list on who does it best and so on. And then, when the wall was down in 1989, they found out that the WHO could do something more for the business, and they made health a growing market. And those poor people in Africa too shall have the good pharmaceutical products we have here in Europe. So they widened the market with this. We bring you health. And they brought some injections nobody needed very often. And now, since 2020, health is used as a population control to get data. They want to know everything. They want to know our genes. When they make the PCR test, a big Chinese company went into 30 countries with containers, with laboratory PCR containers. They didn't make PCR only. They make sequences of the human genome, and they collected the data. They have the biggest data bank in the world. And there's a competition about who gets all the genetic data. And they want to have the genetic data from Africa now. They go to Africa, make new laboratories there, send containers there. It's easy. The sequencing it's cheap. It's very rapid. So this is reframing health. This is what WHO was working on since '48. Before it was were other people. But it was always something, defining something means these are the borders where we discuss about health. And we tell you what health is, where to discuss and about what. So WHO is setting norms, is a norm-setting institution. It tells us which diseases exist. If they have no ICD number, International Code of Diseases, the disease doesn't exist. WHO can tell us which diseases we can speak about, or we can get money for as a doctor when we write our bills as a doctor. It's the ICD code. And then they tell us what emergency is. They call it fake. Funny, easy to learn. Fake. Public health emergency of international concern. Fake. We all have to learn this. Yes, and they say how you can recognize what such a fake is, how you can find it, with which test, with PCR test everywhere. They had a public health emergency with the monkeypox. There was some pustula on someone's where he sits on, yeah, and there was a positive test. I have my homepage. I have a very good homepage. I have there 6 pictures. All people have some red spots or small bubbles on the skin, and so different reasons. And I tell them which of this is a monkeypox. This is a quiz. And the answer is each of them if the positive test is there. Yes, and they define herd immunity it's only when you're vaccinated, and they call it vaccination, and so on. So they define many things, and for instance, this they do too. If they define the cholesterol, the value of cholesterol, if they lower the threshold from 240 to 200, there is 86% more patients who are to be treated with statins and such toxic things. So there are so many, or the T-score for osteoporosis, they just changed it a little bit. They lowered the threshold, and suddenly there are enormous amount of patients who have to be treated. And if the doctor doesn't treat them, at court, something happens, yeah, they set the norms. And the judges, they follow the norms. And they set this norm too. This one disease, a new disease in the ICD codes, it was the PCR, and it was COVID-19, and they had the diagnosis. You see it in the green field on the left. And there are 2 diagnoses for COVID-19. One is COVID-19 virus identified, and the other is COVID-19 virus not identified. Virus identified is the PCR test is positive. Whatever happens, whatever illness there is, if the PCR test is positive, COVID-19. And if such a person who had once a positive PCR test later has some nervous problems, hypersensibility, or psychic problems, it's all post-COVID because he had COVID before. You can say it now, it's post-COVID. And this is, they all prepared this. It was around the changing of the year, I think, 2019. I tried to find out the exact date when they did this ICD, but just in time for this COVID. And you know the COVID-19 virus not identified what it is. When you have a snotty nose, or when you have a sore throat, and you had contact with someone where the PCR test was positive, yes, you had COVID-19 without a virus identified. And the doctor can write it down. So this is how they had the cases, because there were so many cases all over the world. And the PCR test was the most important instrument to find those cases. It was defined, the disease was defined by the PCR test, as it was already in Guangdong in 2002. There was Mr. Drosten who made this for WHO this time too, and for the MERS he did it too. He was finding beta coronavirus in dromedaries, and he made it again. So he trained it for several. He was a specialist, and he was well received by the politicians and by the WHO with his knowledge, and he did it again. And because the COVID-19, you have the cases in China. This is the original data from the Chinese Center for Disease Control. And you see that suddenly there were no cases anymore. This was the 7-day average. It was over 6,000 cases. And suddenly, in the beginning of March, none. Only few in the airports from people coming to China, not in China. This is not possible with a virus, a respiratory virus. It is just impossible, whatever you do. And so you can do this, this result only by switching off testing. Stop the test, and the pandemie is gone. And this is what the Chinese did, and then they were laughing at us. We were locked down, we were locking everything down, they were going around the world shopping, buying everything. We gave up, and they said, okay, we did our play, we did our game, the theater for you to frighten you. And then they traveled around the world and made good business. So this we talked about, the earmarked money. You see, Germany was in this time, this is 21, 22, I think. They were the biggest sponsor. They were the biggest giver. And they, the money, this earmarked money, it just comes very often from states. I think Denmark will do a lot now because they have this new remedy against adipositas. And they will, for instance, they will for sure, Novo Nordisk will for sure go to WHO and say, you have to do something against overweight. This is a pandemic. Yes, so many people die because they eat too much, and so. But there is a new drug. You can take it, and you're slim. The hunger goes away. So they will go for it. I'm sure. I can bet for this. So Germany there had BioNTech in this time. And so Germany had to pay for it because now we could earn money in Germany with this, what the WHO. So we had to give a little bit more. There's negotiations. You give me something, I give you something. Oh, what I experienced in my long time in my contacts with the WHO, the first one was 73 or so, but this is then afterwards as a director of a public health center, I experienced AIDS, and I really thought that AIDS was a result of HIV infection. I really believed it. But it was never proven. It was not proven. There is no show me the scientific results that AIDS is causally connected with HIV infection. Retroviruses, HIV viruses, are in many people to be found. Retroviruses are responsible that we don't lay eggs, for instance. They changed our genome in a way that we can, that the placenta can keep the fetus, that it's not ejected. So the tolerance between two different tissues, we had to learn this in the evolution time. The human beings, it's all the mammals, not only we. So, and then BSE, yes, I kept no time for this. Then the SARS-1, I spoke about it. There were only 8,000 cases in a 226 million region. 120, this is more than Germany has. There are many intensive care beds, many people dying from lung disease, many people dying from pneumonia every day in the hospitals. And when you go there, make the PCR test, which doesn't say so much. You make the PCR test with dying people or almost dying people in intensive, you have a high lethality. It depends where you make the test. If you want to have a high lethality, that people die, that you frighten people, they said 10%, told us, SARS-1, 10% mortality, or lethality, we say. Then you just go to a hospital where many people die, make the test there. And 10% of them will be dead. In an intensive care, almost 30% die. So this is what they did. And then they had the birds flu, where there were no cases at all, no human cases. You spoke about it just. So I was dealing with this. I was traveling to Geneva and speaking with Mr. Stör. He was a veterinary who was in charge of organizing this birds flu campaign. He said 7 million people would die. So I'll come to it later. The swine flu came then. I come to it later. I was very much involved. And there were EHEC. This was nothing so much with WHO, but this was the coli bacteria in Hamburg on the green market or the vegetable market. Suddenly there were lots of people. There were more than almost 3,000 cases and 50 people died. Many people had to go to hemodialysis. And in the time EHEC was running, there was a pharmaceutical company who wanted to sell monoclonal antibodies against it. And they made a clinical study. They used the cases which were on the green market, which have never been there before. This never happened before. And I was there and I saw, yes, you know what they do on the green market to keep the vegetable fresh, they spray them, they make them wet. And if you do some of the EHEC coli bacteria into this liquid where you wetten the vegetables, you have exactly this picture. And I was writing to the Senate of Hamburg and said, don't go there with your health people, go there with the state attorney. Well, they didn't. And they made their clinical studies, and And then there was MERS, there was Ebola. It was the same like with EHEC, but bigger. This was Merck Sharp Dome. You used Ebola outbreak to have their first clinical studies for genetic vaccination against Ebola, so-called vaccination. And they got the market allowance afterwards. And then there was Zika in Brazil, where they made some statistical fake, where they defined microcephalia. It's when you have it cases when your newborn children are counted who have no brain, and then you have also a small brain after 1 year. And this is much more. And one time they counted this, and the other time they counted that, and said it has become more. And they connected it also with a PCR test. So this was, yes, Ebola again. Then SARS-CoV-2, we know what it is. The Mpox, I told you about it. They tried to say there is Marburg fever, and the birds flu again, and virus X now. And then there is the NCD pandemic, which is now threatening all of us. NCD pandemic means non-communicable diseases. And so I have some reminders, only short. This was Mr. Stör with the birds flu. And now last year he said, oh, again, the birds flu will come. We need urgently some RNA vaccine against H5N1. Before he went from WHO directly to Novartis and became director of a department. So he is a rotating, revolving door type. And now he's the consultant for the German government. He's in the German expert group. And he is very critical now. He's from our side now. This is Mr. Ferguson. He's well known. He's a magician. He made out of 360 cases, later 600 cases in Mexico. He calculated them with all the flights going from Mexico all over the world, and he made this scenario, and he said, oh, this is such a dangerous thing. And he found out that there will be so many cases all over the world, millions of people will die. In the newspapers, they brought it. But this was only in his calculator. This is what I saw when I was laughing and said, what's going on there? 600 cases with severe flu? In my room, where I was director for public health, 150,000 inhabitants, I was calculating 10,000 flu cases in a season. 10,000. And they had 600, and they said a pandemic. So this is why I woke up. I said, are you crazy? And I went, I had some questions, and I made some research on it. And then I found out this was a whistleblower who gave me the contract. And they say, yes, the pandemic is there when Mrs. Chan, Secretary General, declares level 6 of this epidemic, of this outbreak. And then this is a contract between Glaxo and the German government. And this, in the contract was, this contract is in power and you have to buy the shots. 50 million. Afterwards with 30-something million, they had to buy, they had to take them. Whether they need them or use them, doesn't matter. So they had to pay. And Mrs. Chan helped them. Said, now you have to pay. Now we have pandemic, 600 cases. The same in France. And this is funny, there was, in the 9th of March, this was before anybody spoke about pandemic, Mr. Sarkozy was in Mexico and giving them some 100 million money for building a new vaccine factory in Mexico. Funny, huh? And then there was the swine outbreak. And then how did Mrs. Chan do it? They just changed the definition of a pandemic. They took away what I learned as a public health man. I said, pandemic is something where many people die and the hospitals are overcrowded and very severe diseases. This is what I learned. It's a catastrophe. And they just took away this gravity or this severeness of the disease. They took away this part of the definition, and they only said, oh, if it's a new virus that spreads in several regions of the world. Oh, this is each year we have it, each flu. And they returned to a definition of pandemic, which was already there, 1870. When there was a Congress in Washington, it was 60-something. It was 1800 at the end of this century. And it was in Washington, many medicines or doctors met there. They were discussing about vaccination. They started with the smallpox vaccination. And they were discussing about pandemics, and it was a synonym for flu. It was that time, some said, oh, there is a flu going around the world. And others say, yes, you're right, the pandemic they call it pandemic. So the WHO just took what was already used 100 years ago, they took it again, and they made it a dangerous thing. And there they said, oh no, it's not so, doesn't need to be a dangerous disease. So this is when I went to Council of Europe and I said, stop this, we have to examine this, you're corrupt, WHO is corrupt. And I made this motion there, fake pandemics, a threat for health. And this was negotiated, we examined the WHO, and we found out there were all the experts who were secret, nobody knew which expert decided. And then we found out who it was, and we found out they all had big conflicts of interest with the pharmaceutical industry. Because WHO is an organization which is paid by sponsors. As we have seen this, they get earmarked money. And who gives money, he also can send his experts and advise WHO which experts to take for this topic. They bring with the money, the expert comes. And yes, this is the next. This was an Ebola. I was there, and I was seeing my friend. He called me, who I worked for him there. He had a laboratory in Conakry, and they said, he called me and said, there is an outbreak of Ebola. Can you ask the German embassy? We need some money that we can make laboratory tests to find the cases. And I asked the embassy, and they said, no, it's not our matter. It's the WHO has taken over. And the WHO, you see, said there's nothing going on when in November in 2014, they said there's nothing going on when the cases were climbing. And at the same time, there was Merksharp and Dome, and this the point, you see the West African coast, you see all the spots there where the clinical studies were made, and this was the Merksharp and Dome said, thank you very much, Wellcome Trust, UK Department of International Development, and then also US Department of Defense, and Bill and Melinda Gates, and so on. They all sponsored this. They were all together and letting the Ebola pandemic, only outbreak, not pandemic, let it just grow so that they could make their studies to have the first genetic modification against an infectious disease. Yeah, and then this. Another fake pandemic. But it was well, how do you say, put in scene or put on stage. Really impressive pictures. And we were so frightened. You see the coffins in New York, and you see the intensive care, and you see the military with the lorries with the coffins in northern Italy, and you see all this. And it's funny, you see New York, this, people dying in hospitals. Here they are. Only between middle of March until middle of May, they died there in hospitals. Why? What a pandemic is that? And then I looked at I looked this year. You see down is New York. You see the spike there? This is the same I just showed. And then San Francisco, it's the upper one, nothing. The original data from the Center for Disease Control. And the other thing is Florida. They have a funny curve there. I don't know why. But this is not a picture you get when you have the spread of a pandemic. And this only changes afterwards when they start giving the vaccines, giving those jabs, then everything changed. So I had this year because they killed people. They took the overdose. This is the principal study, the recovery study and REMAP-CAP study with ill patients. They gave 2.4 gram in the first 24 hours of hydroxychloroquine. This is what this author there, Jessica Duber, recommends for suicide. If you want to commit suicide, you can take hydroxychloroquine because your heart stops. And they gave, in this dose, they gave people hydroxychloroquine, and they had two things with it. Once they killed people to frighten us, and on the other hand, they said hydroxychloroquine is dangerous, which is both is a nonsense, both was a lie, both was trick. Now this year, you see how the midazolam consumption in British hospitals, and you see the different regions of UK down. This is the colourful, and you see at the same time the excess crude mortality rate. It's parallel. This is at only a short time when midazolam was used in a very often, very frequently to give medication to those they want to intubate, to put on ventilators. And they killed people with ventilators. And this was planned too. This was an order by the National Health Service, by NICE. It was a recommendation by NICE to do this. So this is the board of directors. This was when the pandemic started. There's Mrs. Brundtland again. You saw her with Klaus Schwab before. Now she was, in the meantime, she was the general secretary. And there she is now the boss of this monitoring board, Global Preparedness Monitoring Board. And you see the people from China there, from Chinese Health Center for Disease Control, Anthony Fauci, you see Elias from Bill and Melinda Gates, you see Jeremy Farrar, who was then from Wellcome Trust. You see all those sponsors there, and they are the directors of the whole concert, of the whole music, what's going on. They coordinate, and China is always part of it. And you see there the reports they did, 2019 they started. And this is the map you see. This is from the report from 2019 when they tried to map what possible risks they could detect globally, which could be used to frighten us. And they made reports. They always said, this government doesn't follow. Then they monitored the whole process. And they said, what we have to do new laws. And they, for sure, they also tell in this process, which is going on now, how to shape those two contracts that are prepared now in WHO, in the World Health Assembly. So, yes, this is the new pandemics. So, pandemics for non-communicable disease, and they have already a lot of countries that work with them all around the world, and they are giving them money and try to make a problem out of many things we are well aware of, which are problems: smoking, eating too much, all those things, accidents, environmental things. And they can pick some risks, health risks, pick it out and make it something threatening. And they do it when they have something, they want to sell something. When they want to sell a vaccine, or when they want to sell a new drug, Ozempic or Wegovy from Novo Nordisk, and the other one from the US firm, I don't know the name. So it's the slimming, the drug which you can take if you are too fat. You don't have hunger anymore. So they make a new pandemic without viruses like this. And they say those pandemics, NCD pandemics, have to be included, the NCDs, in the COVID-19 response, recovery, and preparedness plans. They treat it the same way. The same people, they use these risks to threaten us, and they try to prepare it. And because there are such people as me and others who are here in this room who say this is all a lie. So they met in 2019, in July, they met in London. The BBC was chairing this, was organizing this, and this is the media, the important media, the state media. They were all there, and they promised each other to fight against disinformation and misinformation. This is why it was so easy. We were all astonished that they all say the same when it started in March 2020. It was as one voice. They met, they organized it. Yes, and this One Health, we heard about it. It was the infodemic management is part of it. Misinformation, disinformation is not healthy. But they make misinformation. They make disinformation. So I agree, we have to fight misinformation. This is why we are here now. And now they have another idea with One Health. You know, they found out in Germany, 170 cities now are analyzing with PCR tests their sewage water. When they go to the toilet, all you have inside, you can find it in the sewage. In the sewage, I'm a specialist for hygiene too. I learned this I always control the sewage machines everywhere in my district. And you can find any virus there. You can find any bacteria. We find so many bacteria and so many microbes there. You can make a big fuss out about it. And they do it again with PCR tests. And even, you know, there's not only human shit in this sewage, there's also dog shit and cat shit and everything. You can find anything in it. It's a genius idea for those fearmongers. And everyone in the community pays for it. They are crazy. The politicians pay for it. They say, yes, that's good, it's more safety. It's a big, big nonsense. And this is the other perspective. We didn't speak about this. This is that the whole thing is a military action. Because normally we have all those regulations, those safety laws and so. But when there is war, no, we have to react very quickly. And there has to be someone who says what we do. So immediately the structure changes. When there is war, no parliament. We can discuss. And they said, they started it with the war against terror. There already they made something which never could be done before. And now they're fighting against the war against the virus. Nous sommes en guerre. This is what the French president said. And so the whole thing was organized there, and they made the emergency use authorization, no prescribed standards for quality control during production, weapon production, and no inspection of the manufacturing process, no ban on large variations between the batches. We have to have them quickly. The virus doesn't wait, we have to fight, and so on. And they could do anything without, and the FDA and the EMA, they just stood there, yes, emergency. They didn't do anything, they were out, they were bypassed. And you know, WHO is one thing, but you showed it already. There are, in the national sphere or in the European sphere, they do the same, they make the same claims. If we don't have this World Health Assembly results, European Union has already made such laws which are in power. US have made such laws which are in power. They can do all the things we are afraid of when the health secretary in US says, now we have an emergency. And he says, we don't have any remedy, take this. Clinical trials, no, take it, produce. It's a defense, it's a countermeasure. So this is already, without WHO, it's possible. And this is from Sasha Latipova. She had the timeline of this all. You see there is the normal market authorization, the green thing there, which then, at the same time, there was this emergency use authorization, which was done. And when this emergency use authorization was given, they started producing, manufacturing, in the same time while the clinical trials started. They produced already. But they produced in a different way and with different stuff, and they made these clinical trials with a shell with a more clean stuff. And then this was just switched over to emergency, and it was spread not only in US, it was spread in Europe via NATO. Via NATO. Here you see it. Until May 2022. It was military who was in charge of the logistics, because they had a good reason. They said, oh, it has to be cooled down to 80 degrees. No doctor can do this, no hospital. We have to have a special infrastructure for this. And they put the military in charge to do all this. And then when they came to the hospitals and when they came to the healthcare, there was always a group of soldiers carrying the pharmaceutic product, the bioweapon, the countermeasure. They carried it to the old people, and there were some doctors hired, and they gave the injections. They had to fight against the virus. They made this a war. And this is why there was no safety. Yes, in a war, many people die. But there was no enemy. This was the only difference. It doesn't work anymore. The CIA has closed down. No. Can you help me? Yes. Yes, and they have a lot of new ideas of disease X, and they have some candidates there. I don't have time to speak about them. And this is the map. This was in Lancet, I think it was published. Yes, and it is statistics about some laboratory-acquired infections, LAI, and so what the people got in laboratories, which were noted. It was from 2000 to 2020, And then they also had the accidental pathogen escape from laboratory. It will last only 16. But nothing happened with this. It's not possible. There is no danger for an outbreak coming from a laboratory. You can intoxicate people. You can give them injections or spoil the water or seed, like I told you about AHEC, seed colibacteria artificially. And you can spoil the food, spoil the water, intoxicate people. This you can do. But in biology, normal biological environment of human beings, such a thing from the laboratory has no chance in evolution. It would kill the people, and you need living hosts who travel to transport the virus from one to the other. So, and they now go on, they do it, they have all those. In the pipeline they have 59, this is the German organization of big pharmaceutical companies, 59 COVID-19 and other viruses, respiratory viruses, where they make RNA, so-called vaccines. And they have all those other diseases they try to use the RNA technology. And you see, when you want to know what will happen soon, you just look at the stock exchange. If you're interested in health, don't use epidemiology. They lie. Look into the stock exchange. Then you know what you have to calculate with. And this guy there, he just got money from the Department of Defense to make some nasal spray with RNA against H5N1 and some other virus. He got money for it. The Department of Defense invested in new countermeasures. And they have many ways. It was published, they tried out many ways how to give you those RNA, DNA with nanoparticles or with vector viruses or whatever. You can do it through the skin, through the eye, through the lungs, through the nose, to the genital way or to the guts. You can eat or drink it, or into the ear, instill it, whatever. Yes, I'm almost finished. And I think this theater here, what we experience and talk about in WHO, has maybe such a distraction. Maybe we all hope that we can fight. If we prohibit them to have the decision, we think the world is safe. No, it is not. Yeah, they will postpone some decisions. And the evil will continue. Because they have already, what we are very proud of now is how we penetrate the cabinets around the world. This happened, and he said it in 2017 already. They have their guys, and the predecessor of WHO, what they did, they already made schools. They had their alumni. They had their people whom they educated. And this is the most efficient way to change the world. To have your people, you can send everywhere in each state, the young global leaders and all those people who get money now and who are just bought to follow them. They invest a lot, and this is very clever. Yes, and this is what happens. We had institutions, and sometimes there was someone corrupt. And now we have corrupt institutions. And there sometimes is not corrupt, and he's a whistleblower then. It has changed with the white herd, with one black sheep is now a black herd, because the boss is black. And it's the cheapest way if you want to bribe something, if you want to, with your money, you want to corrupt something. If you corrupt the boss, you needn't make any corruption with the many people working there. Just the boss. Young global leaders. Install them. It's clever. It's efficient. It's rational. And they did it. And we allowed it. We tolerated it for centuries, or for decades at least. And this is the world now. We have the system, we have all the subsystems, and you see the private interests, they go everywhere. Even in religion, you find sects who earn money with religion. Even in science, in public health, you have them in the private military firms. There's no monopoly of power anymore. If you have money, you can have soldiers. The whole world is now governed by those people who earned a lot of money in the past and who use this money. They cannot do anything with the money, but they want to shape the world now. This is what we experience. And they are in competition. It's not one group who is unique. They all want to earn more. They are in competition. Very often I'm asked, who is it? Can you tell the name? I can tell this name, that name, Rockefeller, and so on. I can, Bill Gates, or so, okay. But there are many different people from BlackRock, and they make strategic games, and it's very complicated. But it's a machine that is for widening out power, and it's a greedy machine, greedy power machine, which does the whole thing. And so this is what I wanted to tell you at the end. If we want to have a society which is our society, which we can control, where we say we can all speak and bring ourselves into this discussion, a democratic society, it cannot be big. The bigger it is, the less possibilities we have to find out whether there is a mistake or not. So the resilient society has to have a lot of transparency. We have to understand everything. If we entrust something, some power to some politician or to someone, to some office, we have to have transparency what they do with the power we entrusted, we gave them. So it cannot, we have to oversee it, we have to understand what's going on. So the bigger the size is, this is the S, the less it is resilient. They do what they want because we cannot see it. It's European Union and global, and what is this? Nobody understands this. And if it's, the other thing is complexity. When we are dependent on experts to understand what they do, then we are dependent on experts, and they buy the experts. So you can, I tell my students, you have a tattoo on your arm, take this. And always think of it when you want to do something with other people. These are principle things. If you want to have an organization or have something together, you should care for this. Thank you.
I want to thank. The conclusions were extraordinary. It was worth it, the wait. Please, as for the other speakers in the afternoon, starting from Panagis, please take place. There are only 5 seats and 5 speakers only. Please take position because there will be questions. Unfortunately, we can't go after 6 p.m. and also the invitations, 3 minutes each, please. So, of course, we also need to give space to other people. So, please, the questions, I ask the questions to be short. Good evening. I've only heard the part in the afternoon. I don't know who wants to answer this question. The first one is, what is this link between the military companies of the Pentagon of vaccines? Because in some contracts that were that raised from Argentina or I think Albania as well, it was written that the people who wouldn't respect that, among other things, would seize military bases or military places. It was a pretty weird matter, also because we knew that DARTA was working on vaccines with mRNA, and it was dependent on the Pentagon for the research of weapons. So medicine. And the other thing was two other quick things. One is we haven't talked much about the fact that during the pandemic they have transformed health people to the healthy carrier, because you can be you can affect others even if you are an healthy carrier, and this was a very dangerous thing. Last thing, sorry, the link between the organization, the ONGs, the NGOs, sorry, and the pharmaceutical companies, because we have seen that during the pandemic there was no humanitarian organization that and also I knew through different contacts with people that work in pharmaceutical companies that they are supported to give part of their prizes, and they are invited to give them to the ONGs, NGOs. And this creates a dangerous link, I think. So I ask you, thank you. Let's give two other questions and then let's let the speakers answer. Thank you. I'm an endocrinologist and nuclear doctor. I of course based on science. I want to thank the organizers at the beginning, and I hope there will be a debate very soon. So the science that gets concrete. So thanks to all the speakers tonight, this evening, today, I've heard so much true facts based on science, and also the will to know more about science, things that, of course, we haven't witnessed in the last few years. So let's hope for the best. Question is, at the end of the day, the pandemic emergency is a very tragic and dramatic aspect of a broader matter, and I think we should put some spotlight on. And I would like to thank a person that is not present today in a spiritual level, that at the beginning in Italy was trying to understand that something very bad was happening. He was one of the first. He's not an epidemiologist, he's not a doctor, he's not a scientist, he's not a politician, nor even a journalist. He's a philosopher that helped me to, let's say, open my eyes. So thanks to Giorgio Agamba. Thank you. I will be short. I'm a doctor. I'm part of ASIS association that helped actively InfoVax from the very beginning. There are many considerations to do. Of course, thank you, everyone. The first thing that I can think about is speaking about the disease. We talk about the diseases as unique matter, and the disease means that the cure is only one and the protocol is only the same one. If you get out of the protocol, you don't get any get any treatment, you don't heal. So the basic concept is that somehow we should also restructure, remodel. And I'm also talking about biology, because for biology, I mean the cell, the beginning of life. So we live in a world that is backward. And my question is, and I'm speaking about this morning intervention, is the health status in the past. Many things were made to determine, to look for the health state. And I wanted to know, as for the vaccine, let's say this drug called vaccine, is there a scientific literature behind it that can somehow give answers to this question on the health status? I'm not talking about vaccinated, unvaccinated people, things that were presented by Professor Donzelli, Dr. Donzelli, but are there valid studies about this aspect of health status? Yes, two very short questions again. Very, very short, please. I've heard, yeah, Russia, Venezuela, Cuba, and another country.
Io sono un medico e
I am a doctor. I want to. We were talking about medicines. At the beginning, there were therapies that everyone used. We're not talking about it yet, but I think that we should see another type of medicine. I'm getting many information about therapies because we can't go on with this chemical therapy. And this type of medicine, I don't like it, I don't believe in it. And it's not possible to go on in this way because 70% of disease come from wrong sources. We are working on something that is crazy, total, completely crazy, and I got it from the very beginning. So this type of medicine, we need to change it completely, otherwise I won't be a doctor anymore because I don't care about this type of medicine. And we can just work with herbs that we normally throw away. Thank you. So we have 10 minutes for the answers, so please you decide what question to answer.
Mayor, why don't you answer how many countries
Okay. So about Cuba, Venezuela, and Russia, I think what you're referring to is 11 countries that included those three, also Bolivia, Zimbabwe, North Korea, I don't remember them all, refused to agree with a UN consensus process at the General Assembly meeting in September to support the WHO. So 11 countries refused to go along with the UN's, what they called a silence procedure. They were going to just say, we're not going to have a discussion, everybody agrees with it. And a few days before it happened, 11 countries signed a letter, said we're not going along. Then the UN pretended that all the countries agreed, and instead of signing it as the whole General Assembly, they wrote a letter and signed it just by the General Assembly president. Anyway, that's what happened. It suggests that 11 countries don't like this WHO agenda, but we don't really know who's going to go along with it. If there is a vote, because there isn't always a vote, they have their fake consensus procedures. And if I were the WHO, I would try to use a fake consensus procedure just like the UN did in September. And if I couldn't get that, I would try to conduct a secret ballot, and then they take the basket with all the ballots out into another room for counting. They've learned this from the Americans, apparently. You know, they have somebody else count the votes while nobody's looking. So anyway, we'll see what happens.
Okay. Just go on this exactly. Seguo la Meryl sullo stesso tema, perché in realtà
I'm following Meryl on the same topic. Our governments can ask for the vote. In general, United Nations use the consensus approval, especially for the most common matters, as a treaty or amendments or regulations. But when we want to proceed with the consensus and also one government only ask for the vote, of course, this has to be proposed or there must be some negotiation. I want to reply to the answer about the NGOs and the conflict about it. The NGO term is very broad. There are many that have been mentioned today, some organizations that are organizations for the civil society or organization again for the rights for Green Pass, lockdown. So there are many organizations that are very linked, and they are kind of emanations that are linked to the business of corporates, and who discussed about it until 2016 with a protocol about the relation and try to differentiate the different types of stakeholders. And this is a positive fact, I think, that when NGOs are non-profit, but they are private associations, they are listed as private enterprises, but of course this is pretty broad. Since I have the microphone, I can answer about the medicine matter, if today we like it or not, that it's linked to the topic of health and illness, diseases. Today, medicine as we know it now comes from Rockefeller period, which was at the beginning of last century, from an important pact. And it started from the United States, and many drugs disappeared, many became illegal, osteopathies, etc. So there was this dynamic of imposing mechanisms of market in the medicine field. And of course, still today, we study on documents that come from that period, especially coming from North America or Great Britain. And then also we have our documents as well. And it's something I always tell my students. If, for example, a Nigerian student or a Vietnam student, Italian student, American student, what is your reference book for internal medicine? And 90% cases, it's Harrison that comprehend also other authors like Fauci, because there was this imperial power as for teaching, in the teaching area. So what is the medicine that is admitted and the medicines that are not admitted? And this brings me to the other topic, which is the disease and the health. Because this modern scientific, let's say, medicine that is standardized is based on the disease concept, and it doesn't take into consideration health, but also WHO, in its definition, says that health is a mental, physical wellness. And the orienting of the WHO, as we've seen with pandemics and other diseases, is very direct to the single disease, whilst we have to put stress on the health. And I want to conclude because I promised to Meryl one answer about One Health, something about One Health. So the idea that the health is the product of many determinants, political, social, environmental, cultural, and many others, where we need to intervene on with adequate policies about health. And this is part of the One Health concept. We can't ensure people the health if we don't have an health environment around us, if we don't have a polluted environment that is produced by the human activity, whilst if we live in a society that promotes the consumption of any substance and we're full of toxic elements, then we don't have any health, of course. So the concept of One Health is a concept that is healthy, and it can be instrumentalized to impose a control of who on other sectors. But for now, what's in the treaty as well is that we need to collab in different ways. We don't know what's going to happen, of course, but I stress that we need to see health as a product of different determinants, and we need to intervene for the next pandemic of non-transmissible diseases.
Speaking about how the medicine has developed, and why we don't take natural knowledge about how humans can live healthy in their nature, in their environment. What could help them? I think if you see the actors now in WHO and the sponsors, they are not interested in this. You cannot have a patent on massage. You cannot have a patent on a plant like this you can plug everywhere. You cannot monopolize it, so you cannot take high prices. You cannot earn money with it. That's so easy. If we would forbid patents on medicine, the whole problem would be gone.
Vorrei fare una domanda.
I would like to make a question on this panel of reliable scientists. Personally, I see you as my heroes because I've known them from the very beginning of the pandemic, and they are very good scientists, but also amazing people, people that had the courage to stand up for themselves and fight for human health and scientific community. I want to ask, I already have some answers, but I don't want to give any yet. And I've been thinking about it for years, from when the pandemic started. So let me give you an incipit. In 2011, if I'm not wrong, Greece, that is my other country, bought 10 million doses of vaccines, H1N1. And those doses, since people didn't get those doses and propaganda didn't work, they just finished in rubbish. They were thrown out. So the government got rid of them. And in this case, with this pandemic, the pharmaceutical companies had what they wanted. They had their contracts, they had their money, they sold their doses. And those entities, sovereignty entities that are trying to govern us, have had a way to put people in lockdown and impose all those policies. But the thing I can't understand, since everyone who knows something about viruses, molecular epidemiology, knew that those vaccines wouldn't work, right? And still they managed to sell them. But why was there this fight to give them to people? Places like Israel, Japan, they got vaccinated 6, 7 times. I mean, many contracts were already given. They had money. They've received money, and the patterns were received already. So why did they fight for it?
I would say they did all this is to see if the mRNA platform is going to work. The function of the Defense Department is to figure, there's going to be, they always believe there's going to be a new bioweapon. They need to prepare for it, and they need to make sure that they can produce a vaccine in a short period of time so that they can defend from it. What better way than try it in the world and see if it works? What doesn't make sense is the failure of our agencies, of FDA, NIH, CDC, WHO, VG Access, MHRA, everyone. No one looked at the safety data. Everyone ignored safety data. We are now on the 9th booster in the United States. We have over millions of adverse events, and they are recommending 10th booster for this fall. No one is looking at the data, and they keep on making money over it. That doesn't make sense. The fact that our agencies have completely abandoned their duty, and their duty is to protect people.
I would say that the people who run these agencies, and we can name them. I mean, Rochelle Walensky, Peter Marks, Janet Woodcock at the FDA, and others. They're not stupid. The data is clear. They know how to analyze this. I think that it's just too painful for us to realize that we're dealing with something very evil. We are dealing with people who are interested in harming and killing us. And most of us can't go there. We cannot face that. But there really is no other explanation for what happened, for the suppression of information and the fact this is still going on now after 4 years.
Io vi ringrazio, andrei avanti ore personalmente, ma so che la sala tra non molto ci manda via. Quindi abbiamo l'ultimo appuntamento, avanti con la slide. Allora questo, la CMSI, come vi dicevo, ha un ruolo scientifico e offre degli apporti coerenti anche su politiche sanitarie, non ha un ruolo partitico, ma ci sono le elezioni europee di giugno che consentono di chiedere ai partiti e ai candidati che si presenteranno di prendere degli impegni. Noi abbiamo ovviamente all'interno della nostra competenza ritenuto che almeno questi 3 siano irrinunciabili. Il primo è un impegno programmatico a non aderire a un nuovo trattato pandemico né a modifiche dei regolamenti sanitari internazionali OMS, quindi tenersi quelli che ci sono del 2005, a maggior ragione se le modifiche rendono vincolanti le raccomandazioni dell'OMS e prevedono delle concrete cessioni di sovranità, un OMS cui noi non possiamo più dare credito per quello che è in questo momento. Impegno a rigettare la bozza circolata di piano nazionale di preparazione e risposta a pandemie respiratorie, che impegnerebbe l'Italia a fare quello che l'OMS non è più sicura di riuscire a farci fare in maggio. E vi dico solo, perché fa parte delle risposte a una domanda, che questa cosa ignobile, che per fortuna è stata affermata e che era sfuggita anche alla vigilanza della nuova direzione di prevenzione in sanità, che però è stata d'accordo nel fermarla e metterla attualmente su un binario morto, prevedeva tra le tante cose la quarantena per i soggetti che in corso di pandemia sono, e uno dice malati, no, sono esposti, ma basta dire esposti, quindi già tutti. No, potenzialmente esposti, quindi tutti di tutti e basta? No, perché l'obiettivo è di togliere il rischio di trasmissione asintomatica. Tutti, di tutti, di tutti in quarantena. È chiaro? Allora, e la terza cosa, che noi la riteniamo la madre di tutte le
The third engagement is guaranteeing freedom of speech, of information, and promoting scientific comparisons. Freedom of information is based on data, is even more important, and we will be like in the Middle Ages if we wouldn't do that, like in the period of Galileo. So if we contrast the international norms of the WHO, we can guarantee the freedom of speech and we can fight against disinformation, which is different from what we deem right to censor. We're not talking about hatred. We're talking about physical violence. And I think everybody could agree with many philosophers. So we invite you to consider parties or at least candidates that are not ambiguous and that are clear. And they are clear to sign these engagements. We invite you to do that because these are indispensable prerequisites. And here is the list. We send the invitation to all the parties in our government. For the president, this is the party Fratelli d'Italia, literally Brothers of Italy. First of all, I would like to thank you for the invitation. Unfortunately, I'm not there in presence. I'm just recording this video before leaving Strasbourg. As you can see behind me, I'm in the Council of Europe, and as you can see this video, I will be traveling. For a long time because there are no direct flights from European institutions. I would like to say hello to Dr. Alberto Donzelli. I'm grateful for him. He knows that I'm proud to be born of a university which hosted the great scientist Galileo Galilei in Padua. Indeed, the motto is a universal university, which means freedom is in the University of Padua. We are very proud of this freedom of spirit and culture. Some centuries after I attended another university where I studied the philosophy of science, and I knew Popper, I met Popper, Mr. Popper, and I've thought that science can progress only thanks to theory, thanks to computation. Mr. Popper said that we can evolve in science, no thanks to our proof of science, but thanks to our computation. And it's very difficult because it creates a shock. In the past, we can follow this topic on TV because thanks to the experts' confrontation, I can my own idea, I can shape my own opinion. So I don't have this possibility to have my personal opinion because maybe we don't have this kind of discussion. We are in the politically correct era, so we should have the official version, which is stamped, for example, by those who are in charge of being the certificator of truth. And I thought that science can't reach a real truth. And also in politics, we're going through a different period. I've been working for 11 years in the parliament, and I often worked with other workers, and they work with their mathematical methods, thinking that they create possible words that they are opposite to reality. But when I ask them to have a discussion, to meet, for example, small and medium enterprises, they were reluctant because they wanted only to see their theory, because they already considered it with their mathematical methods. Yet, Mr. Popper said that hypothesis and scientific theory can be debunked by facts. So I'm confident that this Europe, I'm sure that this Europe can't work because it's against our fundamental principles, like the subsidiary principle. Scientific progress is not a linear path towards an absolute truth, and we'll need confrontation. We need discussions in order to exchange our opinion. This is science for me, because it brings us to scientific pluralism, and if there are wrong theories, it is right to leave them behind. I wish you a good job, and I wish to know your outcomes. Thank you. This was Elisabetta Gardini of the party Fratelli d'Italia. Then there is the Partito Democratico, the Democratic Party. We're going in a precise order. They didn't give us any answer. Then there is also the party Lega. And the chief of this party said, as Mr. Borghi intervened today, I renounced to deliver my speech, and I will follow the outcomes of this meeting. There is also the party called the Movimento 5 Stelle that didn't give us any answer. Then there is the party of Berlusconi, another party called Noi Moderati, and there is also this party, and the reply wasn't received, as well as all these other parties. But this party answered us and said that they couldn't participate. Italia Viva, another party, didn't reply. And Libertà, which means freedom, sent us this video. This is Ugo Rossi, a candidate. Good evening, everyone. I'm Ugo Rossi. I'm an advisor, a politician, and I will be candidate in the northeast for my list called the Freedom Libertà. I've also been against to what happened in the few years. Numbers were clear, and there is no number that justifies the pandemic. We we only based on the PCR tests, which are not reliable. WHO, the WHO, is a criminal organization. We need to exit it. We need to delete it because it's in the oligarchs' hands. Because they only want to do their interest. And why did they do all this? It's clear that they want to reduce the global population. They want to control all humanity. So there is a plan for the technological control for the human life. So it is fundamental to be against this situation. I didn't approve any Green Pass, any PCR test, and I didn't approve any swab. And it was important to give a signal. The majority of some parties were against me, and many of the members are silent because there is a kind of oligarchy in the parties. And this is the main problem, because policy is not free. Institutions are not free due to conflict of interest. So I signed every point of this engagement. I already shown it. We are against these tools of control. We are against all these treaties. And our party says no to the Green Pass. We say no to the WHO policies. We will struggle. We will fight for these treaties in the European institutions too, at all levels. So thank you, Ugo Rossi. There is the last speech. We received a video. We also asked to those who are collecting signatures to have two lists. And this party sent us this short video. Unfortunately, I can't be there in presence with you, dear experts, but I would like to tell you that I support you. The WHO situation is really serious. It's the most dangerous situation that we could have in Italy, but also worldwide, because it's only in private actors' hands. So we need to report this situation. We need to be engaged. We need to engage all civil political forces, and we need to choose between public health and private interest. Thank you for your work. Thank you, Marco Rizzo. He's the secretary of this party called Democrazia Sovrana e Popolare. As time's up, we already exceed our time. I think that it was a productive day for me, but I wish it was also for you. And you will see in the next days all the material that will be published on our website, and then we'll have some documents that can be managed in all possible contexts. We have less than a month to have an important outcome.